thank you very much, IHW, to give me this beautiful opportunity this morning. I'm getting to see a lot of dignitaries, luminaries from India and UAE. I have tried to play a bridge between Indian healthcare and UAE healthcare during the last 25 years. I've spent 10 years in pharma marketing in India, 7 years as a fashion designer, and now 30 years I've been running healthcare systems. I was given the opportunity to set up Apollo Hospitals Delhi, and Alhamdulillah, that's where the landmark hospital. I came to Dubai to open first Apollo outside with Dr. Belhol, and now for the last 25 years, I'm working with His Highness, the ruler of Ras Al Khaimah, His Highness Sheikh Saud bin Saqar Al Qasimi, as his group CEO. During this journey, I could set up a medical school, dental school, pharmacy, nursing, and one of the destination hospitals called RAC Hospital. Today, we are in most exciting times of our life in healthcare industry. I've spent 35, 40 years, but next 5 years are going to be most exciting because the way healthcare is being delivered today is going to totally change during the next 5 years because technology is going to be a biggest enabler. Today, as healthcare providers, we have 4 or 5 big challenges. Number 1 is chronic diseases, which are related to lifestyle management, which the wellness is going to play. Cost of healthcare is going to go up. Insurance has challenges to control the prices. And then finally, we have shortage of skilled manpower. We have to find solutions to bring in technology to address all this. But most important thing remains the challenge is to keep communities healthy and well. That is the solution because prevention is the key. I'm on a journey and I would like to share that with everybody because that inspires all of us. All these challenges which I have defined could be tackled with sustainable and technological solutions. We are experimenting, we are trying a new solution. I am on a journey to do the smartest hospital of the world. May God bless me and may ecosystem support me. We want to bring best of IoT, best of big data, best of machine learning, best of AI, which is fashionable to talk about in conferences, at one place and offer the solutions. The biggest solution is that the decision-making, each and every decision-making point, information should be available. So IoT can play a big data. Then with the help of machine learning, with the help of generative AI, a lot of solutions are available. So very exciting times, and thank you very much for giving me this opportunity. And I'm sure during the day we will find a lot of meaningful discussions on this and find innovative solutions. Thank you very much, and congratulations to each one of you to come here, and thank you, sir, for organizing such a conference.
Sir? I would like to invite Kamal to come on stage and please present Sir with memento. Please give a round of applause to Dr. Raza Siddiqui. Thank you so much, sir, for coming here. Your leadership, your vision is one that has inspired many people. Thank you for sharing your experiences with us. I would now like to introduce our next keynote speaker, Dr. Mohammad Mazen Batterjee, co-founder at Amidst and managing director at Batterjee Pharma. He's a prominent figure in the pharmaceutical industry and co-founder of Amidst, a platform innovating medicine ordering systems. With a background in global education, His leadership at Amidst is focusing on enhancing healthcare accessibility and digitalizing medication systems for global impact. Ladies and gentlemen, please welcome Dr. Mohammed Mazen Batterjee onto the stage with a round of applause. I request him to please address the audience and share his insights with all of us.
Assalamu alaikum, distinguished guests, ladies and gentlemen. When I was asked to come and talk to the honorable guests, I was thinking, okay, we're going to talk about something related to global health, but it's very important to have a clear message. And the message I wanted to talk about today is how it is important that all of us think regarding the impact that we are leaving in the world as we pass by in our journey. And to go through, I wanted to share a short story that spans over a century of how small things can lead to an everlasting impact. So over a century ago, my great-grandfather heard about the neighbor's child who was sick and couldn't access medication. So simply, he decided with his sons to start a pharmacy in Jeddah to ensure that there is accessibility to medication and availability. Years have passed, and still there were issues with accessibility and availability of medications. So my grandfather and his brothers, they have worked on creating infrastructure to import medications from across the world and create the platform to educate medical practitioners and healthcare providers to ensure that high-quality medications are available and accessible. Years have passed and there were disruption in supply chains. So again, my father decided to start up Batterjee Pharma to manufacture medications locally, providing hundreds of medications in the region, collaborating with multinational regional pharmaceutical companies, but also building these capabilities that have enabled higher access and availability to medication. Then when COVID has come, the whole world faced the challenges and the shortages of medication. And we decided to start Amidst, which is a technological company that has helped hundreds and thousands of pharmacies and healthcare providers to understand more about their demand and supply, employing AI and technology and ensuring that there is no wastage and forecast is being done more accurately. So this has not only helped them reduce the shortage, but also ensure availability of medication and also ensure that pharmacies and healthcare providers are better in managing their business and have accessibility to the highest level of technology. What I just wanted to share here today is that together our collective effort can lead to extraordinary results and lead to meaningful impact and legacy. Thank you, and wishing you all a great day.
I would request Kamal to please come up on stage and present Dr. Batterjee with a memento from our side. I would now like to introduce our next keynote speaker, Dr. Dharminder Nagar, Managing Director, Paras Health. He is a visionary leader dedicated to creating affordable and quality healthcare across India. He has transformed healthcare delivery in India's smaller towns through innovative solutions. Under his leadership, Paras Healthcare has expanded significantly, bringing accessible and quality medical care to underserved regions across the country. Ladies and gentlemen, please welcome on stage Dr. Dharmender Nagar, Managing Director, Paras Health.
Good morning, everyone. Ladies and gentlemen, healthcare and sustainability. That's the topic. When I thought about this, I had only one thing in mind, that I have a confession to make. Ladies and gentlemen, I have a confession to make. Healthcare is perhaps one of the most polluting industries in the world. That's the confession I make today. The use of single-use plastics in healthcare is growing up exponentially. It is amazing to see how healthcare has grown, accessibility has grown, but wastage has grown exponentially. Dr. Betterjee, you mentioned that your grandfather started the pharmacy chains. Perhaps at that time, tablets were not packaged in 3 layers of plastic, 5 layers of packaging. Before you get to a tablet, you literally have to spend 5 minutes peeling off layers. I have no clue why those 4 layers exist. Absolutely no idea. COVID, the phenomena we saw, was a worldwide healthcare emergency. But ladies and gentlemen, it was an environmental disaster. The amazing amount of plastic that we used, I literally saw it. Amazing amount. And you know the legacy of that? None of our doctors really want to reuse any sort of gowns anymore. They want to use it, throw it away. Use it, throw it away. For a poor country like India, it's a cost burden. It's an environmental burden. Perhaps the Americans can afford to use that much of plastic and get the privilege of lecturing us about environment. It is our duty in healthcare to figure out solutions to reduce our carbon footprint. We are moving forward to an environmental disaster. We recently opened a beautiful hospital in a beautiful part of our country in Kashmir. We are right at the Dal Lake. The amount of plastics we are generating in this small city, it's so hard for us to dispose that hazardous material. There is no single point of disposing it. We've solved for healthcare accessibility in small towns. I've gone to a tier 3 town called Darbhanga in middle of Bihar, but we don't know what to do with our waste. The government doesn't know what to do with our waste. We are still a corporate hospital. We still have resources. Can you imagine a single doctor running a small practicing a nursing home or a small nursing practice? Where does he dispose of? He can't even afford to dispose it off. You'll see at every town entrance in India, huge dumps. Earlier, these dumps used to be organic material. Today you will realize if you sift through it, 30% is healthcare. You'll see plastics of healthcare. You'll see syringes. This is the problem. So my confession to you is that we are part of the problem. And if we don't accept that, we have no right to tell somebody else, sort this out. We'll sort this out for you. What is the roadmap for the future? This is all a problem that we've identified. We know about, some of us more distinctly than others. How do we sort it out? What is the way forward? Energy efficiency. The recent hospital I've set up in Kanpur, which is 450 beds, we made sure that we are LEED Gold certified. This is a small town. This is not in a fancy part of the world. But we made sure even in these kinds of cities, we'll do LEED. And it is my assurance and a commitment to everyone sitting here and the communities we serve that everywhere we go, sustainability in building our hospitals will be part of our mission. I'm also proud to tell you the fact that waste, I mentioned disposal, but the paper waste we do in hospitals is amazing. A single blood report now comes in 18 pages. It used to come on one page before, now it comes in 18 pages because we want to make it fancier. We want to look it nice. We have 5 different things. I'm proud to tell you, in Kashmir, our hospital, we are on electronic medical records. There is no paper. All our doctors are working on electronic medical records. It's a testament to our clinicians and our doctors there who are sitting in a small town. I didn't have to push them. They wanted it. That is part of our commitment. This is part of the solution. The other point is how to manage this plastic waste. Earlier in our careers as doctors, we would have seen, we would sterilize stuff. We would reuse stuff. Catheters can typically be reused. We have plasma sterilizers, we have ETOs. Our health minister is sitting here, ex-health minister, sir. Today, the burden, compliance burden on us is, if we reuse anything, the drug inspector will come and charge you with the crime that you've reused it. Whereas you should be getting awards that you've reused it. Because there's a cost reduction and it's environmental friendly. The policies need to support, without policy introduction, this will not happen. My humble submission to all of us, each one of us, in any sphere of life, is simple. Let's look inside. Let's make decisions that affect us and our communities. Take responsibility and do everything in our powers to make a difference. Paras is committed to make a difference not only to patients' lives, but to the communities we serve. It's our responsibility, it's our commitment. Thank you, ladies and gentlemen, for giving your time and your patience today.
I would request Kamal to please come on stage and present Dr. Nagar with a memento, some very hard-hitting words coming in from here. I just hope that all of us also make a contribution to sustainability and not wait for incentives and regulations from the government. I would now like to introduce our next keynote speaker, His Excellency Yaqub Al-Ali, Executive Director and Private Advisor to the Office of His Highness Sheikh Juma bin Maktoum Al Maktoum. Mr. Yaqub Al-Ali was recently honored by World Book of Records London for espousing the cause of empowerment of youth, economy and welfare of the people. Ladies and gentlemen, please put your hands together and welcome on stage His Excellency Yaqub Al-Ali.
Assalamu alaikum. Your Excellencies, ladies and gentlemen. This is Yaqub Al-Ali from Dubai. I just want to thank the organizer and the team for inviting me to this event. All the best. Thank you.
Request Kamal to please come on stage and present His Excellency Yaqub Al-Ali with a memento. Thank you so much, sir, for your presence here. We are deeply honored to have you with us, and I'm sure all of you who come in touch with sir will gain a lot of insights on how the youth can be empowered and how all of us can be more responsible citizens. I would now like to introduce our next keynote speaker, Dr. Harsh Vardhan, the Honorable former Union Minister for Health and Family Welfare, Science and Technology and Earth Sciences, Government of India. With a career spanning over 3 decades, he has played a pivotal role in shaping India's healthcare policies, notably leading India's polio eradication program to global acclaim. Dr. Harshvardhan championed numerous healthcare initiatives, including the National Health Policy and the Ayushman Bharat scheme, which is an insurance scheme for the underprivileged. His visionary leadership and commitment to improving healthcare access and affordability have left an enduring impact on India's healthcare landscape. Ladies and gentlemen, please put your hands together and welcome on stage Dr. Harshvardhan.
Good morning, everybody present here in this august audience. Kamalji and your team, I wish to thank you for this great opportunity. All the distinguished speakers, I know there are so many learned doyens of their respective professions sitting in this gathering. Thanks all of you for being part of this. In fact, I literally feel overjoyed being a part of this 10th innings of your integrated health and well-being summit. And honestly, for me, it's always an honor and a privilege to be part of anything which is dedicated to holistic health, because this is a subject which has always been very close to my heart. And fortunately for me in my life, I have enjoyed positions which have helped me in leveraging my fulfillment of my dreams about universal health care, basically. So that's why I consider it as a privilege to be part of this gathering today. Some 5 decades back, I joined one of the best medical schools in Asia, did my MBBS there, MS there, and then started my practice as an ENT surgeon in Delhi. And while I used to practice, I always dreamt about a disease-free world, because we all know that without health, there is no happiness. And that's how my life had started. And in the last 40 years or so, 40 years, 4 decades have been professional work, and 3 decades have been professional work as well as public life, in which I enjoyed various positions as Health, Law and Education Minister in Government of Delhi, as Union Health Minister, Union Minister for Science and Technology, Earth Sciences, Union Minister for Environment, Forest and Climate Change, along with Prime Minister Modi, and also as an advisor for WHO for many, many years in all the Southeast Asian countries. And lastly, during COVID, as the chairman of the executive board of WHO. I dreamt about so many things, and when I started my public life 31 years back, the first major dream of my public life was to see a polio-free world, and particularly at that time I was only dreaming about a polio-free India. When Kamalji came to me and met me a couple of weeks ago, he said, I have to come to this meeting and talk about polio eradication and how you could achieve it, or what was that propelled you to dream about it. So I said, okay, I can plan this, but how much time you want to give me? He said, you can talk for 20 minutes. I said something which from seeing the dream to its realization took 20 years. You are asking me to talk about it in 20 minutes. It's going to be a great Herculean task and a very tall order. And then he also said simultaneously, you must talk about COVID also, you must talk about other things also a bit. So I said it's going to be very tough. But anyway, I'll just briefly outline, and the crux of it would be that the story, in fact, I believe can inspire anybody to take virtually or dream about virtually seemingly impossible tasks in life. And when you start working on those missions with your heart and soul put into it, there is not a single soul in the universe which does not participate in it, or where there is no support for that. That is, in fact, what I could see during my experience, during my journey of polio eradication. I'll start with polio and then talk a bit about what we could do under Prime Minister Modi, and of course during COVID and a couple of other things. I'll try to be very, very brief. You will be surprised that I became a minister in Delhi government in 1993 on the 3rd of December. And on 20th of December, although I knew about the cases of polio and the sufferings and the agony of the parents who have to live with the burden of a crippled child all their life, but realizing and knowing that polio could be eradicated like we could do for smallpox in 1980, because till then only smallpox had been eradicated from the whole world. So 17 days after I became a minister, I was invited to a function in Maulana Azhar Medical College, and I was in fact convinced, I would say, or they were passionately working about it with a few pediatricians who said and who told me for the first time that 50 to 60% of the polio cases of the whole world, they belong to India. We were home to such a big number of polio cases. There was a strategy by which polio could be eradicated like smallpox. The World Health Assembly had already pledged to eradicate polio from the whole of the world by the year 2020. And in 1980, not 2020, 2000, by the year 2000, and in 1988, they had pledged this in the World Health Assembly. But from 1988 to 1993, in India, there were no takers for this pledge of the World Health Assembly because everybody thought that this is just impossible, because the strategy wanted that every child has to be immunized on a single day in one single stroke, and this has to be done for a number of years together. I will not get into the doctors here may be following the science behind it, but I will not get into those nitty-gritties. And for 5 continuous years, the pediatricians were knocking at the doors of everyone in India, but everything was falling on deaf ears. Nobody was ready to listen to them. But ultimately, they told me that this strategy can help. And you will not believe it, that was the evening of 20th of December 1993. And when I came back home, I just kept thinking about it the whole night. And a dream was born. Maybe I don't know what time it was, in the midnight of 20th of December 1993, to do something for these children. And the only thing that I did was to write to WHO next morning to give me everything possible about polio eradication in the whole world. They gave me this much of papers, right from Albert Sabin's research papers to Jonas Salk's vaccine, to the experience of the various countries in the whole world, which took me almost 10 days to study. And we started with a small core group of 4 people. And when people were not getting convinced, whether it was the administration or the politicians, we took just one plank, that if India can provide a ballot paper to everybody in this country on the same day, in the vicinity of their homes, why can't the same country provide vaccine in vaccine carriers at -20 degrees centigrade to every child in the vicinity of their homes? It's a long story. We started with this, and a movement which started with the brainstorming amongst 4 people, a Secretary Health, Minister of Health, 2 pediatricians, and a management friend. Ultimately, the journey lasted for 20 years. I worked for it for 20 years. when we successfully could do it in Delhi on the 2nd of October 1994, putting 4,000 polio kendras all over the city, ensuring the support of WHO, UNICEF, Rotary International, and almost 400 organizations only in the capital. And then when we took it to the various state governments and the central government in 1995, it became a national program. And when we could do it in 95 successfully in India, it was then that Nelson Mandela, who had just come out of jail, he said, now probably we can do it in South Africa also. And he launched the movement for kick polio out of Africa. We know Nelson Mandela very famously said that healthcare is basically, it's not a privilege, it's a human right. And it's a long story. I had the privilege to work for 20 years for polio eradication at all international forums in all the Southeast Asian countries. I was part of all the global technical consultative groups. And incidentally, the journey which took 20 years starting from scratch would see a country like India, where of course we were devoid of the state-of-the-art facilities, we did not have the trained manpower, and where 134 million children had to be immunized at almost 6.5 lakh booths all over the country on a single day, at a single time, number of years. We could successfully do it, and we could show it to the whole world that, and then when WHO certified India as one of the, India along with the Southeast Asian countries and the whole region as a polio certified nation, when after the last case on 13th of January 2011, which was reported in Howrah, that's the last case which has been reported in India. When we completed 3 years after that, we were certified as a polio-free nation, and the Southeast Asia region was also certified. By that time, from a minister in Delhi, I had incidentally become the Union Health Minister, and I myself received that certificate of honor from the WHO's representative to India. So, but and now that journey which started where 125 countries were polio endemic all over the world. Today when I talk to you, it is only our neighboring Pakistan and Afghanistan where there is still a bit of polio left. And in the last 12 months or so, some 12 cases have been reported from those places. And I'm sure by 2026 or so, the whole world shall become free from polio. So this is just a very brief story. There are so many things I have. Maybe I'll try to share with some of you my book. I wrote the whole story of last 20 years along with the last chapter, Dream Fulfilled, in this A Tale of Two Drops, which was released by our former Prime Minister Atal Bihari Vajpayee in 2004, and then subsequent edition was released by Mrs. Sushma Swaraj in 2014, along with the presence of very senior dignitaries, all the MPs and all the chief ministers. But I think since we are all working here on holistic health and number of issues, the story about polio eradication, and then I also enjoyed, I would say that although that was a very bad time, very sad time, and of course one of the most important time in everybody's life, we lost a lot of our colleagues, friends, neighbors, relatives during the COVID. But I enjoyed, in fact, I don't call it enjoyed, but unfortunately at that time I would say I was the Union Health Minister when COVID entered the whole world. And incidentally, I was also, during that time, I became the chairman of the executive board of WHO, so had the privilege to not only serve the 1.4 billion people in India, but in fact the 7 million people all over the whole 70 million people all over the whole world. And those days, I think, if we recall those days, we'll be able to appreciate that probably COVID has been our greatest teacher in recent times. And it has really taught us the real meaning of health and well-being. It has really taught us what is holistic health, and it has taught us the importance of health as well as environment, as well as the health of the environment. I think all these things have been so important, and it has taught to the whole world that you can no longer take health for granted. Health has to be given its due priority, not only by the governments, but by the people at large also. And that is why we always say that in health, it is not the treatment part that's important. It is also the 80-90% of it is prevention. The positive health attitude development. I'm very happy that Dr. Dharmendra spoke about those environmental issues. I had the privilege to be the environment minister also. And those who may have followed me working during the environment ministry, we started a green goods movement, green good deeds movement there, which was in fact followed by the BRICS countries also. It was appreciated by UN. We compiled, after a detailed brainstorming, a list of 700 small deeds, which we called as green good deeds, which of course include all those things related to plastic, etc., etc., etc. And we said it is everybody's responsibility to be performing those green good deeds, and that is your green social responsibility. And with that green social responsibility, with that small bit of contribution to the environment, a duty which we owe for our children. You see, something which we inherited, which we got from our ancestors, the clean air and the clean rivers and the dense forests and everything around us in the best possible manner. It is our duty to deliver that also to our children. And these green good deeds, if you get time, you write green good deeds on Google, and you will get a all detailed description of how the BRICS followed and what is the potential of those green good deeds. Each one of us, I think, since you are no ordinary individuals, each one of us who is sitting in this August gathering is an institution in itself. We have large number of followers in the society, and of course we have the potential to in fact develop hundreds and millions of followers in the society. Today, in these times when apart from the government's responsibility, the most important responsibility is of the people. And our responsibility is to educate the people and tell them that it is not only government which has to take care of your health, you yourself also have to take care of your health. And now when I would like to, at this forum, highlight two very important things that are actually happening in science. One is the research around foods, And those who have heard about a very great scientist named William Lee, he has written so much about how he says we have to eat food to beat diseases. Today, the foods are considered as powerful as the drugs. Either they can produce a disease in you, or they can even eliminate diseases like cancer also in your body. So, and simultaneously, with the anti-aging movement and revolution going on in the country, scientists like David Sinclair, they have pointed out to the whole world that we have to fight aging. And if we can teach our society people that they should learn to actually imbibe those habits and principles. And when I talk about it in concise way, I say that one should learn to eat less, exercise more, have good quality sleep, keep all sorts of tensions away from you, and perform a green good deed. I think you can beat aging also. You can help the cause of health also in a big way. And I think this small message, because once people start learning and knowing about the foods also, they will know what to eat, how much to eat, and when to eat. Big hospitals and big machines and big technological advancements may not help us as much as these small steps. If you go back to Prime Minister Narendra Modi, one of the most dynamic leaders in recent times that India has seen, what are the movements that he started? He started a Fit India movement. He is asking everybody, promoting in a big way. He is motivating everybody to walk, run, swim, cycle, and do whatever is good as a physical exercises. We in India have started a Eat Right movement. He ensured in 2014 that yoga is not only performed by Indians, but it is performed by the whole world. So all these preventive steps, and today at 1.75 lakh health and wellness centers all over the country, crores of Indians have been screened for basics like diabetes, basics like hypertension, basics like cancer breast, basics like cancer cervix. Crores of Indians have been through telemedicine, helped even the underprivileged people. They are enjoying those benefits. You know, 60 crore Indians, and now to add it to that list is the list of, I would say, the senior people. They are enjoying benefits of the Ayushman Bharat. Nowhere in the whole world, any poor person, he doesn't have a single penny in his pocket. He is today in Bihar or in Nagaland or in Chennai but if he has a card or if he has a mobile number, he can get into any of the top 28,000 hospitals in India and gets treatment worth almost 5 lakh rupees free of cost. This is the power of science, power of health, and power of governance that India has seen. There are so many things that have been done by under Prime Minister Modi. We have been working on eradication of many of these tropical diseases like malaria, Kala Azar, tuberculosis, etc., etc. The list is huge, and I'm sure that organizations like yours can certainly help the country in a big way. Since we are in Dubai, we have to congratulate our Dubai people also, because there are some of the very interesting things that they have done in the field of health. We just heard Dr. Raja also, and I just was congratulating our Excellency about their 2021 health strategy, about the way they promoted medical tourism, about the way they are promoting research, about the way they have improved their health structure. And I think what is needed is more of collaboration between the Dubai people and all the people all across the world. There are a large number of challenges also which the whole humanity faces. I think the issue of health equity, we have to ensure that the underprivileged are also taken care of in the best possible way. There are challenges about training manpower, developing the capacity building. But you will be happy to learn that while we were dealing with COVID in India, at a particular moment, there were at least 1 million people who were under our closest possible surveillance, where we knew where that person is sitting, where that person is sleeping. People were talking to him on the telephone. And 3 million people within the shortest possible time, we trained them to handle COVID. And when we had the first case on 30th January, when we did the contact tracing, it was 262 contacts of that medical student, starting from the man who was sitting around him, around her in the aeroplane, to the railway station, to the airport, to the hotel, to place in Bangalore, to the place in Kerala. So that is the level of potential that India enjoys. And I'm sure that when Prime Minister Modi in India talks about a developed India by 2047, he's not talking about something which is absurd. It is not a political statement. It is something I'm sure it can be realized. And for that, each and every Indian has to be, in fact, part of that movement. Each and every organization like this has to participate and put their heart and soul into that. Dr. Tedros says there's always, he used to say that global health is a shared responsibility. It's a shared commitment, all of us. And I remember the former Director General of WHO, Dr. Margaret Chan. She also said once that investing in health is in fact investing in humanity. So I am very happy that there are a large number of dignitaries present in this gathering who are committed to the cause of health, because I have always, whole of my life, I have promoted and propagated. I have been eating, I have been breathing health, and especially polio eradication, etc. And I have always said that health has to be developed as a huge social movement. And if we can ensure the health of the society, we can ensure the economic development, we can ensure the progress, we can ensure everything. Poverty alleviation to whatever the problems that we can think of. Health, I think, is the answer to all those things. Our teachers used to tell us while we were, students in primary, that if wealth is lost, nothing is lost. But if health and character are lost, everything is lost. So I think we have to remember the teachings of our teacher and rededicate ourselves to health issues. There are so many things to talk, but I am sure that I have taken more than what was allotted to me. With these few words, I once again thank Mr. Kamal Narayan and all his distinguished colleagues and workers who have been contributing for the success of this program. for giving me the privilege to share some of my thoughts with you. Thank you so much.
I would request Kamal to please come up on stage and present Dr. Harshvardhan with a memento. Thank you so much for your enlightening words, sir.
Dr. Harshvardhan, thank you so much, sir, for your inspiring journey of 40 years. And we were privileged and we were actually blessed to have a health minister like you. Dr. Harshvardhan has always put health and his profession, before whatever, work he was involved, the missions he was involved. When he was heading the state BJP also, at that time also he used to see patients for, most of the part of, or the major part of his day. So thank you so much, sir, for you being such a committed health crusader. I request all of you to give a standing ovation to the man who built a healthier Ayushman Bharat for all. Thank you so much.
Thank you so much, sir. India has a lot of potential, no doubt, but along with potential, we also need vision. And it is visionaries like you and Prime Minister Narendra Modi that will make the dream of Viksit Bharat possible, with health for all a possibility as well. I would like to tell all of you that we have lots coming up for you during the day today. We are going to be talking about digital health. We're going to be talking about fertility preservation and how we can build healthcare partnerships globally for the betterment of the entire world. We will now have our first panel discussion, and this is on harnessing digital health and pharma tech for global healthcare equity. Technology has brought in greater ease and better connectivity in our lives and is also transforming healthcare from drug discovery to delivery service. In this session, our expert speakers will discuss how digital platforms, telemedicine, and advanced health analytics have been instrumental in healthcare delivery and how these solutions can be adapted globally. Additionally, it will cover the role of pharmaceutical technologies in enhancing drug delivery and personalized medicine, thereby addressing critical health needs in underserved regions. Just a reminder, in case you want to go through the agenda of the day and know about the speakers who will be airing their thoughts on stage today, you can scan the QR code on your table using your phones, and you will have a soft copy, a digital version of the agenda in front of you. For our first panel discussion on harnessing digital health and pharma tech for global healthcare equity, please put your hands together and welcome on stage our moderator for this session, Dr. Amala Khopkar Nazaret, Honorary Secretary General, African Federation of Obstetrics and Gynecology. Please welcome Dr. Nazaret on stage with a round of applause. She's a globally recognized OB/GYN specialist with over 2 decades of experience in women's healthcare. She's a member of the FIGO Governing Council representing UAE from 2021 to 2025. She has been instrumental in advancing healthcare initiatives across Africa and the Middle East. Thank you so much, ma'am, for being with us. I would now like to invite on stage our other speakers for this session. Please put your hands together and welcome Mr. Saeed Ali Mehdi, Director, Head of Innovation and Scientific Partnerships, Middle East and Africa, Siemens Healthineers Regional Headquarters, Saudi Arabia. Please give a round of applause to Mr. Mehdi. Please welcome Ms. Sophie Smith, Founder and CEO, NAPTA Health. Please give a round of applause to Ms. Sophie Smith. Please welcome Mr. Prem Iyengar, India Lead, Life Sciences Technology, Accenture. And Mr. Neil K. Verma, Chief Executive Officer, Promise Neurosciences. Please give a round of applause to all our speakers making their way up to the stage. I'll hand it over to our moderator, Dr. Nazrat, to steer this discussion.
Hello, everybody. Very warm welcome. My name is Dr. Amala Nazrat, and I'm the Secretary General of the African Federation of Obstetrics and Gynecology. Before we start today's panel, I just want to tell you what African Federation of Obstetrics and Gynecology is. It's a federation of 54 countries of obstetricians and gynecologists from entire region of Africa, which contains 5 zones. We have the Middle East and North Africa region, which are the Arabs. We have the Central Africa region. We have the Anglophone Africa region, which is on the east side of Africa. We have the Francophone Africa region, which is on the west side of the Africa, and South Africa. And it's a wide diaspora of women that we deal with and healthcare-related equations and solutions that we solve from them, right from the ultra-rich to the ultra-poor. And what we ask for is very basic, simple thing, good quality healthcare for each and every woman residing in the region of Africa. And how can we achieve that? How can we unite the rich countries with the poor countries so that equality in healthcare can be shared with all the regions is what we are here to discuss. So I welcome all the other panels also on stage, and I look forward to future collaborations with each one of you. Thank you very much. So I've been given a few questions, and I'm going to hand over the mic to Mr. Neil. If you could talk a bit about what you sent to me yesterday about the pro-MIS neurosciences that you represent. How is it affordable and sustainable in working on addressing some of the most challenging diseases in neurology? And what role do you see for artificial intelligence, which of course Dubai and United Arab Emirates is also very much strongly hell-bent on investing into healthcare, and a digital health platform in accelerating these breakthroughs and making them more affordable and accessible globally. And I'm talking about making it available to poorer countries like Ethiopia, where the healthcare budget is the poorest in the world. How can this benefit a grassroots level woman in Ethiopia, for example?
There we go. Thank you very much. Well, first of all, thank you to the organizers for inviting me. It's a privilege and an honor to share the stage with my colleagues and also to share the stage and listen to the amazing keynote speakers this morning. Yeah, just briefly, I mean, I'm CEO of actually a couple of companies based in the US. One, Promise Neuroscience, is focused on some of the more severe neurodegenerative diseases. We've got a lead program in the clinic for Alzheimer's disease, and we're also investigating Parkinson's and schizophrenia. And I'm also CEO of a very interesting cancer company spun out of MD Anderson, and we're looking at some really novel cellular therapies for the treatment of some very serious, rare, and common cancers. And it's interesting, and I'll talk about a little bit what we're doing with generative AI and affordability, but it's interesting to be represented here. And this is not a conference or a setting that I'm typically invited to, so I'm especially honored to be here. But it's interesting in the whole world of sustainability to include kind of the innovators or innovation in whether it's research development, novel medicines, and even technologies applied to that. But it's nice to be a part of that sustainability discussion from a therapeutic side as we try to, you know, sustain the longevity of life. Not only sustaining life, but sustaining life in a healthy way. There's no point in living longer if it's no fun. So you want to maintain life and maintain a healthy life, and I think that's what innovation. I think sometimes we're kind of kept out of the conversation, so it's really, really important and really pleasing for me to be part of this discussion as we're out there developing innovative, novel drugs that are combined with healthy diets and healthy lifestyles as well. I don't want to miss that opportunity in saying that. But for example, we're pioneering research in the Boston-based company, the neuro company, the Alzheimer's-based company. And I have a neuroscience degree. I have an MBA. I've been really fortunate to be the CEO of companies in the US and in Canada, my home country, in Europe, in China, in South Korea. So I've kind of done global kind of entrepreneurial pursuits. And back when I was living in Switzerland, I was part of the WHO, World Bank kind of industry collaboration to provide novel medicines to all parts of the world, developing countries included, and also increasing access and affordability in this part of the world. So it's kind of, I won't say come full circle, but it's really interesting to be here. And just touching on the question, and I think looking at obviously novel science and the science that comes out of whether it's the neuro company or the cancer company, the researchers that are behind this are absolutely remarkable in what they do and their dedication to science and developing first-in-class and best-in-class medicines. But then when you look at these novel technologies that are coming, everybody talks about AI. I was at a summit yesterday in Abu Dhabi, and Gen AI is like a huge, exciting concept and discussion point, rightfully so. And I think we can use AI combined with novel research and development to do a lot of work in providing drugs, not only in the U.S. and in the West, but also to other countries, whether it's Africa, Asia. And it's important for me as an individual. As I said, I've worked around the world providing medicines, affordable medicines, novel first-in-class medicines to patients around the world. And we use AI to not only to refine the drugs and the targets we're looking at to optimize the efficacy. We use AI to assess and monitor safety profiles of patients. We use AI to look at personalization of medicines. We're looking at, for the cancer company, we're looking at novel forms of the cancer, different epitopes that are more prevalent in Asia versus the US. So AI is used across the board in what we're doing, whether it's neuro or cancer. And we're also looking, which is an important aspect, on the manufacturing side and how to drive down costs, because I was talking to a colleague yesterday, the development of novel medicines is a very costly exercise. So as we can drive down costs of manufacturing using technology, then we can look at affordability, not only US, where we have a little bit more flexibility, obviously, but then affordability in the rest of the world. And then my last point also is just a reminder that the importance, and it's often kind of overlooked sometimes in these conversations, but the importance of intellectual property to patents and IP as we kind of expand globally. It's a really, really important aspect for us. But using these novel technologies and digital technologies to identify the patients, improve efficacy, drive down side effect issues, and drive down cost of goods is kind of what, there should be a lot more, I have to admit, a lot more US companies thinking about this. But I think we're starting to think more and more, and kind of attending conferences like this is hugely valuable to me in understanding the needs, of the rest of the world, and because we all suffer from the same disease, the same cancers, the same forms of neurodegenerative Alzheimer's, Parkinson's. So if we can take these medicines and make them affordable for everybody in the world, that's a huge goal of mine. So I appreciate the question and the attention.
Thank you very much for this question. I have a very interesting question for you, a follow-up question. We're talking about artificial intelligence in the operating room. So we are talking about robots which are actually helping the doctors operate. But now we are facing a situation with subspecialties like neuroscience and orthopedics, where the surgeon doesn't really need to enter the OR. It's the robot that's doing everything. The surgeon is sitting in the lounge and controlling the OR. Is AI here to kick all the surgeons out of the OR?
Thanks for asking me that. Yeah, no, I don't think so. I think there's a lot of I won't say paranoia, and sometimes it's rightfully to think about where can all this lead, but I'm very much a believer in technology and advancement, and I don't think, and certainly there'll be certain individuals that we may be made obsolete, but I think the advances to society and the accessibility that something like this would afford, and it's not only robots with the doctor not having to be there. I mean, there's always individuals and specialists that have to manage these, that have to guide, that have to interpret the data as well. So I don't think it's a technology that's going to make humans obsolete. I think it's going to be very complementary, and whether it's in the OR room or just simple, virtual discussions in remote parts of the world that physicians aren't necessarily largely represented. So for me, it's very much a complement to the specialists and the doctors and the physicians in the world. Certainly not a replacement by any means.
Thank you. Thank you for clarifying that. My next question is to Ms. Sophie Smith. Welcome to our panel. And I see that you are very much invested into management of chronic diseases. And one of the most important breakthrough that's coming into the medical world in terms of management of chronic diseases is the correction of the microbiome of the gut of the patient. And there's preliminary work being done in India. We've published a couple of papers in the IHW journal, and now we are liaising with scientists from New York University about gut microbiome. Where do you see the future of treating chronic diseases by correcting the gut microbiome of the patient? And how can you contribute?
Okay, so just by way of a brief introduction, my name's Sophie Smith. I'm the founder and CEO of NABTA Health. We were the first women's health technology company in the Arab world, founded now 7.5 years ago. We spent 6 years in R&D, developing a hybrid model of care that today provides women's health add-ons to plug the gaps in insurance coverage. Our mission is to empower all women in the Middle East and Africa to effectively manage their health. Our thesis, as you rightly pointed out, is very much around the fact that traditional healthcare systems, as we know and occasionally love them, were really designed in the 1900s to treat acute diseases. Go back 100 years, the majority disease burden, 85%, was infectious diseases, respiratory diseases. Diagnose a person with a disease, treat the disease, it should go away, and so would the person. But today, the majority disease burden is not acute, it's chronic. 70% lifestyle diseases, metabolic diseases, issues that affect our physical, mental, and nutritional health on an ongoing basis. And fast forward another 100 years, 95% of the disease burden will be chronic. And so our hybrid model is kind of built around this assumption that we need to move away from a model of care that is disease-centric and provider-led to one that is person-centered and person-led. And that's where technology comes in. Historically, we've not been able to do anything other than adhere to this traditional model because it's built on the knowledge of 24 specialties, each specialty owning a particular disease set or part of the body, and 2 decades of learning and practical or applied learning go into the mastering of this specialty. And until very recently, it simply wasn't possible to take all of this specialist knowledge and orient it around a person, around their age, their stage, and their goals. But with the application of artificial intelligence, and specifically the ability of machine learning to assess billions of data points in a fraction of the time, we can now take this specialist knowledge and we can personalize it. We no longer have to pin a person to a disease and treat the disease. We can pin diseases to the person and treat the person in an age, stage, and goal-specific way. In terms of the gut microbiome and the role that it plays in the health of an individual overall, I think we're still in the very early stages from a research perspective. There are 2 sets of biases that have historically made it difficult to advance care in this part of the world. One is a gender bias, the other is a racial bias. If you look at women, women were largely excluded from clinical trials until 1993, they still today represent only a tiny percentage of clinical trial participants. 70 to 80% of all animal studies involve only male animals because women are more hormonally complex. And this hormonal complexity was seen to give mixed results. So easier just not to test things on women, test on men where you can't get questionable results because of the interference of hormones. Obviously what this means is that you then have most things, from therapeutics to medical devices to clinical pathways that are not really designed for women. The second bias is that is due to the fact that 92% of clinical trials occur in the US and Europe, and the remaining 8% mostly occur in the Far East, where they have to be demographically representative. And this means that only a tiny percentage of clinical trial participants today still are of Middle Eastern, African, or South Asian origin. So if we want to correct these biases, and if we want to do things like study the microbiome and its importance in the context of our overall health in more detail, we need to reorient and create hubs for research and clinical excellence here. Where NABTA comes into this, other than publishing a lot, I mean, we published a book on hybrid healthcare that involved contributions from thought leaders around the world. We are a case study now with Harvard, with INSEAD, with MIT. We try to make sure that as many of our local clinical studies are published and available to people in the region and outside of it. We are actually just, and it's not yet officially publicly announced, we are opening the first Women's Health Research and Development Institute in the region in partnership with Princess Noor University in Saudi, and this will become a new hub of research for women's health and for population health in general in the region.
Thank you. That's fantastic news, and congratulations. That's fantastic news. My next question is to Mr. Prem Iyengar. Hello, sir. When we started practice about 30 years ago, we were very old school, pen and paper files and all of that stuff. And then came the integrated online or, computer-generated sheets for putting down history, storing data, everything. Right now, and I speak in context of Africa because that's the region that I represent, there is only about 20 to 30% uptake of integrated healthcare systems in terms of technology is concerned. And these are only amongst the nations that can, afford it. How affordable do you think this digital healthcare system can become so that poorer countries can incorporate it and it can become a standardized healthcare system for the entire region?
So, thanks a lot for the question. It's an interesting topic to talk about, specifically because it directly hits the health equity piece of the puzzle, right? Surprisingly, on a lighter note, you'd be very surprised as to how many large pharmaceutical organizations still use pencil and paper to mine all of the data. I still validate spreadsheets today. It's unbelievable. Can it be made affordable in lesser privileged areas and nations? Absolutely. It's a matter of the right level of investment and penetration. The technology exists. The technology as it stands today is expensive. However, with scale, you can always reduce costs. I mean, that's a 101 of any manufacturing arena, right? And as we scale, we can very easily look at using, to your point earlier, you said 92% of trials are being held in US and Europe. What is really preventing us to go to the 8%, right? Why do those numbers have to be that skewed? If the numbers are not so skewed, you're automatically going to start reducing the cost, and you're automatically going to start penetration of technology into these arenas. It exists. It's a matter of a mindset and a change in the way we look at it. We already know that technology can reduce the cost of a clinical trial. You can have synthetic data and predict the outcome of a clinical trial today before you even get to phase 2s and 3s. So you've already reduced the costs. So when you've reduced the cost there, you've used the technology. It's not that hard to penetrate it into those nations that are less privileged. So taking that into account. And then again, what's also important is to look at it from a patient standpoint, right? The plethora of patients that are available and who would be willing, because we spoke about how rare diseases are present in some of these nations. Orphan diseases are present. There's so much possibility of using different types of technology, whether we talk about mRNA, whether we talk about cell and gene therapy. These are specifics that can go into these nations and really help the rest of the world. It's a two-way street, because the concentration can move more towards the areas where the diseases are present. You can actually use that to go out and get those results into the much more established countries also. So again, coming back to just to conclude on that, right? Get it to a level where you can reduce the cost of research, the cost of trials, using technology, and then take it to those countries so that you can further reduce it, right? That's basically the point.
May I comment? I think you make an excellent point that perhaps the single greatest application of things like generative AI is in the democratization of knowledge. And I don't necessarily mean here for consumers of healthcare, but also those who design and develop it. We should be doing more research here. We should be manufacturing more here. You know, we saw this during COVID with the manufacturing of vaccinations. There were huge issues with vaccine shortages around the world until countries said, you know what, we can make these ourselves, and then it solved a lot of issues. We shouldn't be reliant on research that is being done in parts of the world where the population and the demographic are not relevant. I think if as healthcare leaders and as a sort of collective, we should be looking as much as possible to work out how we can be building things that are by and for people here.
Excellent. That's an excellent point. I have a very interesting experience that I have to share. In the month of May, I was in the city of Busan representing Africa at the Asia-Oceania Federation of Obstetrics and Gynecology, and there was a small conclave which was held by another ultrasound company, because since you belong to Siemens, I'm not allowed to mention any other names on this stage, but it was a conclave done by them, and it was all about the role of ultrasound and artificial intelligence. And I just happened to go in, check in over there. It was a nice little swanky conclave, and there was an Indian consultant who was actually just checking the equipment which had AI integrated in it, and there was a 22-week patient, pregnant patient, just lying there who had come as a subject, and quickly, without even batting an eyelid, within 30 seconds, the patient was detected, the baby was detected with right ventricular hypertrophy by the machine without even the radiologist, because when we scan the heart, there are certain angles we need to put the probe on to get the actual thickness, but with just one view, it was able to detect that, and something as life-threatening as that with a atrial septal defect, which was right in front of our eyes to see so that we could immediately detect. What I am trying to ask you as a representative and coming from Siemens is that I know that this technology is getting integrated in most of the ultrasound machines. The only question is how specific it is as compared to a human eye. And second, how affordable is it going to be in the next decade?
Thank you. And I mean, first, I would like to thank the organizers for bringing us together and really talking about the important points like you are bringing in. And so personally, I've been also working very closely in the African countries for the past couple of years.
And just 2 weeks back, I was in Kenya. We were doing one of the program for building local capacity. I mean, Dr. Harsh mentioned about it. That is very important to also build the local capacity. So at the end of the day, in next 10, 15 years, of course, technology is one of the key backbone of the digital transformation and improving the healthcare. Either if it's AI or it's coming new IoT-based technology, wearables, and so on. But one of the most important element is the workforce. And I agree with Neil. So there is technological evolution with AI, but it could never replace it. The people who are not using it, they might face some challenges, but it's never there to replace. And if we talk about the different elements also in Africa continent, so I was doing a study and we found out that there are multiple diseases that are there, like we take example of coronary artery disease or any peripheral vascular disease and or even going into the oncology space. So each country in Africa itself is very diverse. If you go to Egypt, the treatment, the cost of treatment, and it's very different if you go to Ghana or Nigeria. And there is a lot to learn from the local, I would say, best practice sharing as well. And so this is a very surprising point for me as well, that of course I represent Siemens Healthineers. I work with different hospitals, universities and government, and access to care is one of our growth vectors. So we want to enable the hospitals to, or doctors to have a technology with that they can help the patients in providing care. So coming to your point of the use of technology you mentioned about, so of course it is there, it will be there, but also there is a lot of leapfrog we need to do. So we talk about AI, so still there are 37% of the world population that is not having access to internet, and majority of them are coming from African countries as well. So still there is a lot of need. Of course technology could be the backbone, could be the leverage, but I feel still there is a lot need to work on the workforce or the human capacity to learn and to also provide the care to the patients.
Thank you very much. Thank you. I have, I think, just about time for one discussion and before we wrap up the session. But I just want to tell you that I was born, brought up, raised, trained, everything in India, and came with a hope and a dream to Dubai 30 years ago and never left the city. So I have seen it evolve from where it was to what it has become now on sheer grit, determination, resilience and persistence. And these are the qualities that the country has imbibed in me, which, which I came here with. But when I look at Africa, and I'm really saddened to say that the healthcare infrastructure is so low that we have to ask WHO to send official letters that by 2030 there's going to be no female genital mutilation, there's not going to be any postpartum hemorrhage, there are not going to be any more cases of cervical cancer diagnosed. We actually have to get them to get these official letters coming in from WHO to be sent to healthcare ministries so that things can be implemented. So my last question to you is, Mr. Neil, is that how important is a public and private partnership in achieving this kind of healthcare equity, especially in places where certain countries who are planning to again legalize female genital mutilation again in their parliaments, who are working right now, and we are sending them letters not to do so. How important is a public and private partnership through digital health, and what role do investors play in making this vision a reality?
Yeah, that's a loaded question, but a very important one. I mean, the role of partnerships, public-private partnerships, is exceedingly important. And again, when you look at the partners or the stakeholders that are involved, I mean, there are multiple groups here that we're talking about, all the way from the basic science, the research and the development, to the hospitals running the clinical trials, to the physicians trained to run clinical trials to manage the patients, to the regulatory authorities that have to streamline this to get the products, to the patients and beyond into market, to the governments, their role in providing access and basic sanitation. The investors are absolutely critical. And then you've got the whole manufacturing support as well, which is significant. And if we're dealing with living cells, which we are with one of the companies, you have to have local manufacturing. So there's a collective group of, 10 or 12 or 15 stakeholders that all have to work together. And it's a huge task to get them all focused on the priorities of healthcare. As I said, it goes from sanitation to cutting edge drugs. So it's again, when this was whatever it was 20, 30 years ago, and it might have been the first, just the three groups coming together, the pharma industry, the World Bank, and WHO, to look at how do we get the Western companies to develop medicines that are more suitable for developing countries, and then how do we increase access to these medicines once they're there. And this was a long time ago, and I think there's still huge gaps. As I said, it's interesting to be here in UAE versus Africa. There's a lot of wealth here, as you well know, and the commitment and the enthusiasm by leadership to establish a life science ecosystem in UAE is really terrific, and that's kind of why I'm here, to try to help. And we've got people who want to build and manufacture and do research and work with the Cleveland Clinic in Abu Dhabi. But that's, as I said, that's still a far cry from what's going on in Africa, and I think it's a whole education, and these forums are really important to kind of bring these, some of the lesser privileged countries into this discussion. So there's no easy answer, but just to say that the importance of this stakeholder management and public-private investing, the investors have to be in it for the long term, and there's multiple different industries and support mechanisms to invest in. But it's a long-term commitment by multiple investors and governments, and it's, again, not an easy answer to solve, but it's really important to have these discussions. It's a great question.
But definitely, I think if we take it one step at a time, slow and steady wins the race, maybe 10 years down the line, we'll be talking about equity in healthcare for all the countries of the region, including MENA and Africa and maybe other continents as well.
I hope so. I think so as well, and I think the technology is going to allow us to kind of make things much more kind of a commonality amongst the lesser and the richer countries, and I think we'll see it coming together over the next 5 or 10 years, I hope.
So for global equity in healthcare for everyone, and with that we conclude today's panel. I thank you all for a patient hearing, and I thank all my panelists for their valuable inputs, and I look forward to working with you in the near future. I probably might hound you. Thank you.
Thank you for sharing your wisdom with everyone. I request you to please stay on stage for just 2 minutes. I would request Nikki Gupta, healthcare branding expert and CEO of Teamwork Communications Group, to please come up on stage and present our speakers with a memento. We are grateful to them for coming here and sharing the wealth of the knowledge with the audience. I request you to please present a memento to Dr. Amala Nazret, our moderator for this session. A memento for Mr. Saeed Ali Mehdi, Director, Head of Innovation and Scientific Partnerships, Middle East and Africa, Siemens Healthineers. A memento for Ms. Sophie Smith, Founder and CEO, NAPTA Health. A memento for Mr. Prem Iyengar of Accenture. And a memento for Mr. Neil Barba, CEO of Promise Neurosciences. I request all of you to please gather for a group photograph. Please give a round of applause to all our speakers. Thank you. We'll move on to our next keynote session. In a world of TikTok and Instagram, new acronyms popularized by millennials and Gen Z keep coming up. We have DINGS, double income, no kids, and we have SINGS, single income, no kids. Preferences are changing, but science offers hope to all. It is now possible to postpone having children thanks to science. Fertility preservation helps people save their fertility for future conception when their fertility currently is under threat from a medical or a surgical intervention, such as radio or chemotherapy, high-grade or advancing endometriosis, surgery on the ovaries, and other such procedures. Or it is for those who are not yet ready to conceive due to personal or social reasons and are at the risk of losing their ability to conceive with time. So please put your hands together and welcome on stage Dr. Purnima Durga, co-founder and medical director of MOM IVF. Her extensive experience in IVF and recognition through awards such as the Best Fertility Consultants highlight her commitment to improving reproductive health and advancing fertility treatments.
Good afternoon, everyone. Esteemed colleagues, global industry leaders, and distinguished guests. I'm here today to represent the declining fertility trends globally and why it is important for us to know about this option of fertility preservation. Even though the science have advanced so much, still a lot of doctors in our fraternity only don't know that there is an option of fertility preservation which is 100% proven, which is not experimental now. So I'm going to talk about the role of technology. Since morning we have talked about about sustainability, technology, how it changed the healthcare sector. But I'm going to talk about technology, how it led to our lifestyle disorders, which has increased the incidence of cancers, diabetes, cardiovascular diseases, and especially I'm going to talk about how it affected the fertility rates in the couples. We all know that the total fertility rates are coming down, especially I think a lot of people might be knowing here, Japan is having the least fertility rates there. The number of children born are very less. They're not at all looking at giving birth to children now because of varied reasons, because of a lifestyle or lack of time or delaying the pregnancies or not getting married early. So there's so many reasons, and also the total replacement rate is also coming down. The number of deaths are increasing, the number of births are reducing. So today, I think all of you know what do you mean by infertility. Infertility, we call it as a couple when a couple is failed to conceive even after having a regular protected intercourse for more than 1 year. We call them the couple as infertile, and these are the couples who need to come to the doctor for the consultation. So as we all know that, how many of you can imagine a world without cell phones or the fitness trackers or the sophisticated medical devices which we now take for granted? Even me in my center first, instead of now doing a pelvic examination with my hand, I rely on more on my ultrasound machine. So we have taken the medical technology for granted, right? So, but previously it's not the reality. Not before, we used to believe more on intuition than the data. And healthcare or the healthcare management is more about treating the problem than preventing it. Fast forward to today. Today we are in a place where healthcare, we are more focusing on the preventive aspect of the disease than the treatment aspect. As technology has opened the doors for so much of innovation, there is also paradox as with improving technology, we are sitting more and more in our offices. We have become more passive. We have become passive lifestyle, so we're not active. So which has led to lot of sedentary lifestyle diseases, like we all know India is a hub for diabetes. There is a high incidence of diabetes, obesity. Morning we talk about, Dr. Nagar is talking about plastic sustainability, how doctors itself are using plastic or paper wastage and all. Yes, this should go to a larger audience. Doctors itself should be motivated or regarding this, because as I told you, I'm a doctor. I mostly talk in the scientific conferences. My talk is mostly about data, papers, presentation. I was so fascinated when I got an invitation for IHW Council about the work they are doing. Probably this is the future where we need to talk more about the sustainability aspect of it. And we talk about plastic. We in ISAR, Indian Society of Assisted Reproduction, we 15 members, committee members have come up and studied extensively about the plastic usage and fertility. There are certain endocrine disruptors in and around us. The perfumes we use, or even the sanitary products, or the cleaning products which we use, all are having chemicals which can disrupt our endocrine system, which can lead to all this increase in the diseases. So we are doing extensive research on these endocrine disruptors and its health on fertility. We may not able to avoid all these things, but at least some substances which are proven to be endocrine disruptors which cause long-term diseases in the future can be avoided by creating awareness in these forums like this. And the other aspect which we in the discussion which has happened in the panel about the gut microbiome. Yes, the gut previously, I think, previously we used to say that when you are sick, just give rest to your gut. See, that's previously the treatment we used to follow in ancient times. So gut microbiome is the main important thing which we need to study, and there again we Indian Society of Assisted Reproduction studied exclusively on the gut microbiome and the vaginal microbiome and the incidence of infertility, which is again plays a very important major role. And sir talk about the food we take. Food can cure the disease and cause the disease, which is very, very important thing. As we all know, in infertility, when I'm sitting in my clinic and seeing 40 to 50% of the patients who are coming up are polycystic ovarian disease, which is a lifestyle disease which can be prevented by the type of food we take and all. So 50% where they have a lot of hormonal issues, they have insulin resistance. As a doctor dealing with the core group of reproductive age group, which patients come to me, it's my responsibility to tell all these factors which can affect their long-term health. It should be a holistic approach. So, so when it comes to innovation and technology, as we said about technology has its pros and cons, but technology has revolutionized the healthcare, especially the sector of IVF. We have very good ultrasound machines which can detect the disease early, and we have in embryology lab where we literally create the babies. AI has revolutionized the technology. Previously, the success rates in IVF cycles used to be as low as 20 to 30%, where we have increased to 50 to 60% with the help of AI-based technologies. And today I'm here to represent fertility preservation. Fertility preservation is preserving either your sperm, egg or embryo for your future usage. The main indications of fertility preservation are medical and social. Medical, the most common indication is onco-fertility, as we have seen increase in the detection rates, especially there is increase in the childhood cancers as well now. But fertility preservation, as the survival rates of the cancer has also increased, it's very important to counsel the patients regarding the fertility preservation. Lot of oncologists themselves don't want to counsel the patients because the main priority is survival. But as the survival rates of cancers have increased now, it's very important to tell them that there is a simple option of fertility preservation where they can preserve their sperm. For sperm, it's not a very big procedure. They have to just give their sample for the egg. And in pubertal age, you can also preserve the ovarian tissue cryopreservation also for their future usage. One in the medical condition is oncology, which is very important for them to counsel their fertility preservation and have their own biological child. The other is increasing endometriosis. I don't know how many of you have heard about endometriosis. Endometriosis is a condition, it's a lifestyle disorder again, which is increasing a lot, where it reduces the egg count of the female drastically. So these are the people where we need to also counsel them about these options, that fertility preservation is there, where they can preserve their egg or sperm or the embryo for their future usage. And another aspect is which we are talking about is DINK, and that's what double income, no kids, and all these have become common now, the social egg freezing. So basically, infertility is generally not treated as a disease, but WHO has clearly said that infertility is a disease. It is fertility preservation comes under preventive medicine. So we are preventing the couple of for the loss of pregnancy in the future. So it comes under preventive medicine. So social egg freezing is there. Any woman who wants to postpone their pregnancy or want to delay their childbearing for whatever reasons, we can freeze their eggs and also sperms for their future usage. So basically, technology has revolutionized healthcare, especially the field of fertility. So fertility preservation options should be discussed, and I'm so happy and proud that I'm in a field where compassion, innovation, and technology plays a very, very important role. Thank you so much for your patient listening. Thank you.
I would request Kamal to please come on stage and present Dr. Purnima Durga with a memento. Thank you so much for your talk on preservation of fertility. For those who desire children and are not able to do it in the now, can do this in the future, and this is surely a marvel of science. Thank you so much for telling us about it. I hope all of you have scanned the agenda and have a soft copy of the agenda. You can keep this as a reference point about all the speakers who will be speaking and what is coming up during the day today. It's going to be very interesting because we are going to be talking about healthcare, we're going to be talking about technology, their intersection and partnerships, the power of partnerships to advance healthcare to all, to improve access and to improve knowledge dissemination of healthcare as well. We will now move on to a panel discussion, and the topic is United for Health, Transforming Global Health Through Healthcare Partnerships. This session will talk about the critical importance of cross-sector collaborations in tackling global health challenges. This panel, featuring leaders in mental health, pharmaceuticals, finance, public health, and hospital management, will explore innovative partnerships and strategies that can drive sustainable advancements in global health. By harnessing the collective expertise of diverse sectors, The discussion aims to create actionable solutions that transcend traditional boundaries, ultimately fostering a healthier and more equitable world. For this discussion, please welcome on stage our speakers. Please welcome our moderator, Mr. Neil Verma, Chief Executive Officer, Amidst Neurosciences. Mr. Verma is a seasoned healthcare entrepreneur with over 25 years of global experience. He currently leads Mongoose Bio, focusing on cellular therapies for cancer, and Amidst Neurosciences, developing treatments for neurodegenerative diseases. Please welcome our other speakers in this session. Dr. Shehbaz Bichu, CEO, Aster Hospital and Clinics, UAE, Oman and Bahrain. Please welcome Dr. Mohita Srivastava, Director and CEO, Cognito.me LLC. Please welcome Mr. Mohammed Asif, Executive Director, Plan International, India Chapter. Please welcome Mr. Manan Kalvia, Global Sales Director, International Markets, NASCO Health, and Ms. Shilpa Bhasin Mehra, Independent Legal Consultant. I'll hand it over to Mr. Neil Verma to steer the discussion.
Thank you very much. Hopefully you're not too tired of my voice. I was asked to do a moderating session as well as a panel session earlier. So again, my privilege and honor to be with an esteemed group of panelists and colleagues to explore kind of this idea of partnerships and collaboration, which we talked about a little earlier, but the importance of that. And you can see the bios and the backgrounds of the speakers in your pamphlets on the table, and all of them have a distinguished career, and I'm sure lots of interesting things to say. We're going to start maybe a little bit differently with a little bit of a story. Talking with my colleague and now friend Shilpa, who wanted to share a personal story with all of you, with all of us. We'll break into a little bit more of a Q&A format in just a minute. But I'd welcome Shilpa just to tell us a little bit your story and what you want to share with us, please.
Thank you. Thank you very much, Neil. So being a lawyer, I will start with a disclaimer. I do not belong to the medical fraternity, leave alone being an expert. But I do have one medical phrase, which is written in my discharge summary. I'm going to narrate that. You'll probably understand it. It's called acute disseminated encephalomyelopolyradicular neuropathy. I had to mug it up. So I'm here because Mr. Sudhir Mishra insisted that I speak at this event. And the reason for that is that doctors call me a medical miracle. So a short recap on my story. I was fit as a fiddle till the year 2003 when I was struck by a deadly viral meningitis. I was in coma for 40 days and then waist down paralyzed for 2.5 years. I believe when I was in coma, I was declared dead twice and revived. So when I saw the topic of today, I feel I am a end product of collaborations, and that is why I am sitting here with you today. Transforming global health requires innovative solutions and a collaborative effort. I will leave all the technical and fancy knowledge for my esteemed panelists. I will speak as an end user. So I wanted to just bring this discussion from a global level to an individual level. When I was very, very sick, I had modern medicine, traditional medicine, as well as holistic healing, all happening at the same time. So I'm just imagining that if that could have such an incredible effect, imagine taking it to a global platform. What can't we achieve? And I would not want to take more time. I would just like to say that I love the word, the first word actually, united for health. I'm a student of political science before I studied law, and the word united reminded me of the world-famous slogan coined by the communist leader Karl Marx. Workers of the world unite, you have nothing to lose but your chains. So I would urge the healthcare industry with all its workers as well as stakeholders to please unite. You have nothing to lose but your limitations. And we as end users have everything to gain for a healthier, more compassionate, equitable, as well as sustainable world for all humanity. Thank you.
We should probably end on that. That's very, very well said, and thank you for sharing. If you have just Shilpa, if you had kind of one message to share for other individuals that had to endure what you did, you know, for the panel and for the audience, what would that kind of single take-home message be, do you think?
My message would be life is so precious, and how can you give up? You have to give it your best shot, whatever it takes, whether it's global partnerships or your own inherent will to live. You can't give up.
Very well said. That's an interesting way to kick off the discussion. As I said, these global partnerships and the relevance and the importance of working together as individuals, as companies, as countries, as we talked about previously, stakeholders. And it's interesting, maybe Dr. Bishu, I can ask you first to kick off, because we think of innovation, you know, as I said, I'm kind of with innovative companies, you know, some really clever scientists, and you think of it potentially coming from a single source. But maybe you could speak to us a little bit about how partnerships, collaborations can drive innovation. And as you've asked, kind of improve healthcare delivery. So not so much a single point of innovation, but more a collaborative collection of points of innovation. Maybe you can speak to that a little bit, how partnerships drive innovation and improve delivery.
Good morning, everyone, and very happy to be there in this panel. So I'm basically an anesthetist, so doctor more than a CEO. So I'll have a doctor lens on all this. So especially on collaboration and partnership, right? In yesteryears, right, we were talking about collaborating between different specialty of medicine, like what she said, and different hospitals. But now the time has come where the partnership is to be between technology, with data science, with healthcare. So if you really look at the way in which the healthcare is going, vis-a-vis to other industries, like banking industry, etc., they're far ahead in terms of technology. But if you look at healthcare, they're one step behind. So, but there are a lot of things which technology can bring, one in terms of accessibility. Even if you look at this part of the world, so an Aster DM Healthcare, it's a group, right? We have a brand called Medcare, which is our top brand, an Aster and an Access brand. The Access brand is the brand which really touches the lower income group of people. So that's where people are unaware about technology and what it can bring, that accessibility the cost of accessible to healthcare can be dramatically reduced with this technology coming in and getting this collaboration. So things can't be done by an individual sector, and government can't do it alone, private can't do it alone, technology can't do it alone. But if you collaborate and bring all that into one platform, that's where the miracle will happen. And what we lack right now is those platforms wherein everyone can come together, discuss, and understand their pain points. If you talk to a technology guy, right, he'll be talking about technology, but his understanding on healthcare will be less. Now, if you talk to a healthcare person, he'll be talking about healthcare, but his technology is less. So if you bring them on one platform and make them collaborate, I think sky is the limit for accessibility of healthcare to different part of the world.
Excellent. Thank you very much. Maybe Dr. Mohita, over to you. You're CEO of a neuroscience company, cognition-based. Maybe we can get you to talk a little bit about some of the advancements that you expect over the relatively short term with the cognitive rehabilitation programs you're working on, and where you see this kind of advancement and technological improvement coming from in the near term.
Thank you, Neil, for asking this question. And I would like to thank the organizers for inviting me on the stage. And by way of introduction, I'm Dr. Mohita Srivastav, and I'm a neuroscientist and a neuropsychologist by profession. I'm also the founder of Cognitome program, the program which is meant for cognitive rehabilitation. First of all, I would like to mention about the importance of cognitive health. We are interchangeably using the term mental health with cognitive health. But what's the difference between the two? So first of all, I would just like to shed a light on these two. That cognitive health is a distinct concept, and we should not use the term interchangeably or synonymously with the mental health. Mental health is one state of mind which actually deals with the emotional and the psychological well-being. But cognitive health deals with our intellectual capabilities of our brain. So I decided to formulate this program, which is a cognitive rehabilitation program meant for all, including the neurological and the psychological patients, and for the corporates and for all of us, the teens and the youngs. Because down the line, with age, we also experience brain fog and cognitive decline. So, though these cognitive rehabilitation programs across the globe, there are many programs that are going on across the globe, and they're mostly using the digital tools and technologies to give the cognitive training, or we call it the brain training, and they're called as the brain training programs, and they're different. You can see the mobile apps, the apps used for the different tablets, and you can do it across the globe sitting whichever region you belong to. I see the future, I mean, if you ask me, my program is Cognitome program is basically focused on the manual cognitive task training more than the digital cognitive training. But we are also using multiple digital tools and programs based on AI and machine learning. There are brainwave entrainment protocols. There are different neuromodulation tools and techniques that we have been using. And I see that the future advancement of this all the cognitive training programs is completely related to the AI and machine learning, because there are many interactive games and exercises that are being used for the brain training, as well as virtual reality and augmented reality, which we are using now as well, to simulate the real-time life experiences. And next is the most common thing that are being used for the brain training is neurofeedback and brain-computer interfaces, brain mapping, all those stuff that we are using currently here as well. And I see that a lot of interactive games and exercises and cognitive task-based targeting a particular cognitive function and targeting a particular brain region is yet to come, because there are multiple generalized software and the programs that are being used, but we should emphasize on devising certain protocols and plans which are meant to target a specific cognitive function for a particular brain region. Though in that area, the quantitative EEG, or we call it as the brain mapping, is doing a lot. But still, I say that use of VR and AR is, a lot of things are yet needed. And at last but not the least, I would like to say that mindfulness-based practices, which are not always the meditative approaches, they're called as the neuroscientific meditative approaches, or we call it as the cerebration techniques. So they also require a lot of VR and AR-based tools, digital tools, which really helps in improving the cognitive functions.
Thanks very much. Very, very interesting. And Mr. Asif, as Executive Director of Plan International, maybe you can tell us a little bit about what Plan does and how you kind of incorporate or how you use kind of partnerships to, to drive growth, but also access in some of the underrepresented regions. I think would be interesting for us, please.
Thank you, Neil. First of all, let me start by sharing that it's an honor and privilege to be here, sitting with some really eminent, incredible people who have done much in the space of public health. So as Plan International, we in India, we are working on trying to see how we can augment, how we can work together with the government, with other civil society organizations to tackle some of the burning challenges in public health space. So we are working on eliminating parent-to-child transmission of HIV, working on eliminating TB. But coming to the theme of our conversation here, United for Health, I think this is a spirit that is very much part of who we are. Plan International, while in India we are a locally registered national organization, but we are also connected with the Global Federation of Plan, which works across 80 countries. And as part of our processes, especially in the public health space, what we do is to see how we can take knowledge, information that we gain through our public health work in different parts of the country, in India, to other parts of the world, so that we are able to support, contribute to addressing some of the burning challenges in public health worldwide. And since this is something which I think the theme is very apt, because, and coming from India in this country, Dubai, I feel that it's important for me to also bring to light, especially when the subject is United for Health, because what India did during the COVID-19 pandemic was something incredible, because India, as we all know, is a major manufacturer of vaccines, and how through the process of sharing the vaccines with a large number of countries worldwide, we were able to tackle the pandemic. So this is one very good example of how, when we work together, when we share innovations, when we work with a global lens to addressing public health questions, we are successful. And I'm very happy to share that, and I think most colleagues here in the room are well aware that over the last few decades or few years, number of disease, number of public health issues have been eliminated. And it's all been possible just because there was greater global cooperation, there was collaboration between countries, between NGOs, civil society organizations, between the medical fraternity, the markets were interconnected, supply chains were ramped up. So all these contribute to addressing public health, making the world a much more healthier place. And Plan International, as a small organization, is trying to make its modest contribution towards that goal. Thank you.
That's great. No, thank you so much. Very important. And Mr. Kalia, I understand Global Sales Director of NASCO Health. Hopefully this is a fair question, but I'm assuming it's a for-profit organization, and I'm curious as to how do you maintain profitability and financial success while also ensuring you drive partnerships and increase accessibility to some of the outlying regions or even your core regions, but how do you push partnerships to expand into some of the underrepresented areas while maintaining a focus on the top line and financial growth? So let me know if that's not fair, but just to put you on the spot.
It's a fair question. So we are definitely a profit organization made for profit. So NASCO Healthcare is basically a manufacturer of mannequins, right? We manufacture mannequins starting from the lowest CPR mannequin going up to the high-end mannequin which is operating like a human. So we manufacture these products, but at the same end we are collaborating with bodies like in India, for example, ASHA, right? It is the body which trains people like what you can say, like midwives in remote areas of India. So we make small mannequins which are like costing less than $50, replicating a neonate, and if some complications happen, what can be done to save a neonate? Like this is something which is not possible, not heard of, and we are doing that just for profit. So it's not to make profit from there. We are providing to the government of India at a high level. People come in and they take those. Similarly, the same concept is implemented in Africa, in low-income countries. So we go in, we provide those supports to these low-income countries. Profit comes through other projects which are associated with generate from there. In addition to this, we are doing a lot when it comes to CPR. We as cardiopulmonary resuscitation, we collaborate with American Heart Association, European Resuscitation Council, and develop tools and technology which can actually help a doctor save a life. So she gave an example, she was in coma, people came in twice, revived her, right? So we developed those tools so that the doctors or the future nurses are ready to face such challenges, because the family is under a pressure at those kind of situations. And you don't want a person who is not trained, cannot give the right CPR, and cannot save your family members. So we are taking those initiatives, collaborating at the deep level, whether be an industry, whether be a government, and understand those needs. Recent example is like a government of Angola came in and asked us that we want to standardize the level of healthcare, what you can say, providing the right healthcare to our people all across the country. What can you do for us? So we went in with a program which was accepted, and they said like, guys, you are the ones who can do it, not charging us too much money. Like you are doing something. So we implemented a standard centers into like 11 new hospitals which the government of Angola has built. So they are getting trained on the products so that they can provide those life-saving skills on the real humans.
Excellent. No, thank you. I'm going to ask kind of all the panel members. And what do you see as some of the key kind of healthcare challenges? Some of the key public health challenges that can be addressed through partnerships. So what do you see some of these real challenges? So it's more of a, I'll ask a reverse of that question in a second, but some of the key challenges that exist, or some of the gaps, what are they that these partnerships can solve or resolve? What are you hopeful about coming together as partnerships that this challenge and that challenge can resolve?
So again, if you look at the gap between the care delivery, right, from the modern countries to the countries who are underprivileged, the gap is huge. So last week, we have a wing called Asta Volunteers. The Asta Volunteers are, we have mobile vans which we give for free to different underprivileged countries like Tanzania, and the team was in Tanzania. So I had a couple of doctors who were in Gaza 2-3 months back, and then to Tanzania. And they were telling the Gaza is so equipped because people know about it, people contribute, and the ICU setup, everything is fantastic there. But when you go to a place like Tanzania, Zanzibar, right? The healthcare access is so low. So partnership like what you were talking about, right? If we can really collaborate together. So the entire funding does not come from ASET alone. We have a lot of people like different charity organizations joining hands with us. See, those charity organizations have the fund, but they don't know how to access. Now we have the know-how, but fund will be an issue because we are also for a profit organization. Once we club all of them together, that's the right way to reach out to underprivileged countries. That's one thing. Second thing, after being there, when we looked at a couple of cases, right, they still open cases, which was a surprise for us, wherein most of the cases are done laparoscopically throughout the world. They still are 20 years behind for ectopic pregnancy, etc. They still open the case and then do it. Now, even if you have fund, you give them all the laparoscopic instrument, they still don't have the expertise to do it. So what we were planning is, why don't we train those people, bring them to India, bring them to Dubai, show them how to do the cases, and our doctors going there on voluntary basis. So doctors also are feeling very happy because they're doing something to change the society. And in the span of 2 years, you will see that entire demography changing. So I think that type of collaboration between different industries and technology should come in. Only then the broader problem of healthcare will be addressed. And it's not going to be very easy like what you think. Bringing them together and making them work together for a better cause is something a platform is required.
Thanks. Anybody else? Kind of what challenges do you envision being overcome with some of these partnership discussions?
I would say that, like for example, if I talk about my like cognitive training programs, the challenges, but in this digital age, actually everything is accessible and possible. But still, there are certain challenges when we need to do the brain mapping or to do certain tests which require devices, you know, to be put on the headgears to wear for the patients or the clients who are coming to us. But the challenge is that the program is global, it is running globally, the cognitive training program, but the people who cannot come and fly to Dubai for the same, they actually cannot be assessed. So the challenge which I am facing at the moment is that the program is running globally. We can devise the protocols for them, but due to the geographical distances, we are unable to use the headgears on them. So in that ways, I ask them to go to your doctor or for this particular test and blood work or quantitative EEG and brain mapping and share with us the report. And then we plan. So we plan the protocol for their cognitive rehabilitation. But I would say that, you know, we can actually overcome these challenges by devising certain portable devices which are to be used by oneself, and like headgears, very portable headgears, already there in the market, like Muse headband, and there are many things that are already there, but we need a little more of it, you know, to cover the geographical barriers. And we can actually, that's what I think, that now this is how we can unite globally. If we focus more on certain headgears that are available to the population worldwide for the cognitive training programs.
Very good, thanks. Mr. Kali, did you?
Yes, so how we have collaborated is like, just one example, we brought in virtual reality, right, and taken it to the remote areas by bringing a complete outpatient clinical environment using artificial intelligence. So because in remote areas, the infrastructure is not existing, getting the mannequin is not the right thing, right? So we brought in those VR tools with artificial intelligence, so the students, even the professors, are able to practice how to communicate with the patient in their local language. So in Africa, so we have French being used very effectively for communication training. So when like a fifth-year student or a doctor is talking to a patient in the real time, they say that we are more confident in what questions to ask. We are able to do the right diagnosis because we know how we are assessing our patient. So this is how we are getting united with the right technology to the healthcare providers.
I think one of the biggest challenges which still remains is that strategic orientation of leave no one behind within the healthcare paradigm, healthcare response mechanism. Because while there is enough and there's much that's happening in the health, quite often we see that it does not reach the last mile. It does not reach the most marginalized. In India, under the leadership of our Honorable Prime Minister, Shri Narendra Modi ji, and our former Health Minister, Dr. Harshvardhan ji, earlier mentioned, we are trying our best to see that how do we have that lens of leave no one behind in our healthcare response. And it's difficult, it's tough, but it is something which I believe is critical if we have to tackle, because if we want a world which is healthier, which is prosperous for everyone, then every person, wherever he or she is, has to be within the frame of quality public health, optimal public health and healthcare. And I think I wouldn't call it that the world has not been thinking. We did discuss it as part of the deliberations around the Millennium Development Goals and now in the SDGs. So there is a clear strategic intent. It's just about how do we take it down to the brass tacks, to the last mile. And I think, but I'm very optimistic that we will achieve that goal and ensure that every person, wherever he or she is in any part of the globe, has access to quality, affordable healthcare.
Very well said. That's really, really interesting. Maybe as I'm kind of looking at the clock here, we've got a few minutes left. What do you think in trying to overcome these challenges? And it's interesting, again, more from a positive perspective, and what are the challenges and how are we trying to achieve our outcome? What do you think some of the biggest roadblocks are? If you could, whether it's going the last mile or doing or bringing groups together, and it sounds like you have a clear path to overcome some of these, but if you had to point to, one or two, I won't say insurmountable because nothing's insurmountable, but kind of roadblocks that's frustrating that you see you're coming up against that are really preventing you from kind of going that extra mile or bringing the partnerships together to secure an outcome. So what are your roadblocks that you're coming up against?
Can I just take that? So as an organization working at the grassroots with an intent to serving the most marginalized, the underserved, one of the biggest roadblocks which we face is getting the quality human resources, the public health workers, the para-health workers who are ready to go down in forest villages, in villages which are up in the hills, to serve people, serve communities with their knowledge of public health. And I think that is something which to me needs to be tackled and addressed.
I was going to ask, is that because there's not enough people, or there's no desire, they don't want to go down to those places?
It's many things. It's not so easy to pinpoint which one is the problem, but yeah, definitely there is a desire for people to work in urban areas. So in urban areas, again, in better hospitals, in better health facilities, people don't want to go and work in smaller health facilities where there are other levels of challenges.
Definitely different regulatory issues. The second is that if you compare the doctor generation, so my in-laws, they come with entire family of doctors. So the way they approach, onto medicine to the younger generation, when the batch is next to me, their commitment, commitment won't be a nice word, but again, their empathy and the way they behave and the older generation vis-a-vis to the newer generation with various things like life pressure to going to the remote place, we see a significant gap. But one thing which medical school does not teach is, and which is very much needed, is to give them a lens and make them understand what's happening in the world. But one positive thing of this is, if you look at those doctors in generation above and below, those who are committed are 100% more than the older generation. So that's a gap which is there. But how can we increase that commitment in the younger generation is something which we need to start right from school days and not from medical school days.
So add to his, I was about to say the same thing. The biggest challenge that we face, since we are a technology company, right, is finding the key stakeholders who will take it forward. This might be due to the generation gap that is there. So the old way of teaching is completely different from the newer way. So that's the main roadblock that we see. Regulations is one of those because it takes too much time to change a particular strategy of how things are getting imparted to the newer generation. So that's the main thing.
Very good. Maybe in the last couple of minutes, I'll just kind of ask you for final thoughts on a more positive note, so we don't end up on challenges and gaps and such. Maybe you can, if there's an example of something that you've done recently which makes you proud of a partnership or a collaboration that you've done, or looking forward over the next 12 or 24 months, what are you hopeful for, whether it comes out of these type of discussions, or what is your, something coming up in the future, or something you've just done that gives you a lot of motivation and enthusiasm that what we're doing and what we're trying to do here in the various countries and the people is actually working and achieving our goals?
One thing with the organization as an ASTA, we're really proud is about our ASTA volunteers. So ASTA Volunteers is a volunteering program for all our employees, whether it's nurses, doctors, all other employees of our organization. So we try to imbibe that into the DNA of the organization as a culture. Now, when you have a free time, spend your time. So we had a lot of issues, especially flood in Kerala. Our ASTA volunteers there in forefront. And now we are, from GCC perspective, we are looking at MENA region, especially onto the African countries. So number one, we've given them, looking at platforms to do health educations and going into these remote areas by donating these buses wherein health camps are done. Like you rightly mentioned, preventive healthcare is super important in coming days. If you can identify a disease much ahead, it reduces the burden on the society, on the country, and on the family. So most of the technology is developed in such a way that all these diseases can be diagnosed much ahead, and if treated, the morbidity and mortality can be significantly reduced. One of the things which I'm really proud about is ASTA volunteers getting into Africa, and last week we were in Tanzania, and we're going to other countries. And I think that will be a game changer, and all those like-minded people, because of the social media and other people, are lining through and voluntarily coming and asking us, can we be a part of it? So that's one platform which I'm really proud of.
Words of motivation from the others?
I would say that I'm extremely proud of the work that I'm doing, because I'm creating awareness about the cognitive health, which is a very untouched topic. People, as I mentioned earlier, that people are often using the term mental health instead of cognitive health when they are focusing the challenges related to their cognitive issues or cognitive functions or higher executive functions. So I'm creating awareness by writing articles in various newspapers and magazines. Even in College Times, I do write a mental health column on brain and mind health, and various global magazines, and our own blog, Cognizine, and our newsletter. So creating a lot of awareness about the cognitive health and the mental health. Second thing that I'm very proud of is that what we are doing is we have innovated techniques called as the cerebration techniques. And they are taking care of two aspects, the cognitive health as well as your emotional health. So they are divided into two parts, Imovere plans and the Cognosere plans. And they're very, very novel therapeutic techniques that are being used and completely based on the mindfulness-based practices. Even for your cognition, that is also based on the mindfulness-based practices, not necessarily the meditation. So it's very innovative, and it is getting a lot of applaud, and I have published quite a few research articles on that as well.
Joseph, proud moments and what you're looking forward to?
So one of the things that we have been trying to do is to see how we can push the envelope on the self-care path. Within the public health discourse and practice has not been so much in the forefront in the recent years, even though there is a WHO guideline on self-care, because the whole thing, and I'm very happy to share that supported with CSR funding from RICKET, Plan India is working with hundreds of thousands of mothers, new mothers on self-care, trying to see how we can push them, how they can bring them to start adopting. So it's not just about preventive, it's also about pre-preventive actions. So how can such actions, so that we are not just looking at public health from the lens of a patient and a doctor, and the patient with no agency. What we are trying to see is that even while you may have disease, illness, there is an agency, and that agency needs to be activated at times, so that through self-care models, the person is able to not just be prevented from a disease and move towards wellness, but also adopt or even get cured through processes. And I think I'll just end by taking a quote from what Dr. Harshvardhan just mentioned. How do we make public health as a social movement? Because I think that's something very important, because that's something, and already a lot is happening in that space. Thank you.
I will be quick, so less time is left. Yeah. So, so our goal for the next 24 months, 36 months, so we have two main goals which are there. So one is a global goal, one is a regional goal. So in terms of a global goal, we want to provide quality education to all the like low income countries that is there. So which is being basically possible through our technology that we are building in. We are investing heavily and it is doing wonders for us. And in terms of a regional initiative that we have taken into different parts of the globe, especially starting with Miyasa region, so is providing software solutions for the paramedics, because paramedical training is one of the most, they have the most stressful environment that they work in. So we are trying to build solutions for them where they get their training of reading a ECG waveform. Just by looking at it, they can determine what exactly is happening. So we are building more than 100 different waveforms to get them trained on. They can practice, they can deliver a shock in a very safe environment. So that's what our main aim is.
Thank you. Yeah, Shilpa, final thoughts from you.
So, Neil, I'm an individual, but because of my unusual life story, I am called very often to speak on motivation. So I'm very glad to contribute, to inspire anybody. I write in Khalij Times. I started a happiness chat during COVID times because people were so depressed. And more than CSR, I'm a believer of PSR, which is professional social responsibility. We can't leave everything to the governments, everything to the corporates. I think we all need to take responsibility and contribute whatever we can.
That's very well said. Awesome. Well, again, a very diverse panel, and as I said, my honor to kind of facilitate the discussion, but you guys led the panel. It's really, really encouraging, again, for me, and I'd encourage the organizers to pull more of the innovative, therapeutic people into this discussion. It really is eye-opening for us to listen to the stories and to be motivated by the individuals and the companies. And we're toiling in the labs and kind of building the innovative drugs that hopefully improve lives and kind of complement all the activities that you're doing. But thank you on behalf of the audience. Thank you so much for your stories and contributions and motivational words. Much appreciated. Thank you.
Thank you for steering that discussion. I would request Kamal to please come up on stage and present our speakers with the mementos. We are grateful to them for coming here and sharing their knowledge with everyone. I'm sure we've understood the meaning of partnerships from this discussion. I request you to please present a memento to Mr. Neil Verma, CEO of Promise Neurosciences. A memento to Dr. Sherbaz Bichu of Asta Hospital and Clinics. A memento for Ms. Shilpa Bhasin Mehra, Independent Legal Consultant. A memento for Dr. Mohita Srivastav. A memento for Mr. Mohammed Asif. And a memento for Mr. Manan Kalia. I request all of you to please gather for a group photograph. Please give a round of applause to our speakers on stage. We will now move on to a keynote session, and this is on building a resilient future, sustainable innovations in healthcare. For this, I would like to invite on stage Dr. Marika Kroons, MD, PhD. She's CEO of Impactful Innovations Management Consultants Dubai and Prime International LLC. She's also the board member of Clinical Laser Thermia Systems. Please put your hands together and welcome on stage Dr. Marika Kroons.
So, Your Excellencies, distinguished ladies and gentlemen, it is my pleasure to be giving you some ideas on the sustainability of healthcare today. Well, sustainability has a lot of meanings. In this very short keynote presentation, I will just concentrate on the healthcare. Go forward the slides. We have been already talking about the SDG goals. I guess you all would already know them, and many of them are related to healthcare and the well-being of humans. Also, these goals were actually established in 2015 by the UN General Assembly, and they are supposed to be fulfilled by 2030. I'm very proud that this country has taken on implementing these goals as well. So they do have a special emphasis on clear energy, but also on the sufficient food at the reasonable price, as well as education and healthcare. I'm very proud of these. And if we think about the health in SDGs, so what does it mean actually? The definition of SDG in health is very broad. it says that ensure healthy lives, in promote well-being for all at all ages. So it's a very broad definition by the SDG. The declaration emphasizes that we must achieve a universal health coverage and access to quality health care for all. No one must be left behind. And this is also what this country has embodied in their agenda. I'm very proud of that. So SDG 3 also prevents needless suffering from preventable diseases that can be prevented either by vaccination or by other means. And also preventing premature death. So what is sustainable? Why is sustainable healthcare important? I've listed just few points here. As we know, the population is aging. There will be increased demand of healthcare systems. There are more unhealthy lifestyles leading to metabolic diseases and other chronic diseases. There will be more demand to healthcare. All these drive increases in healthcare demand consumption. And when this is combined with actually the climate change, I think it is need for us to act, and act now together. So what do we mean with sustainability in healthcare? This is a busy slide, but we need to create a system that first of all meets the current needs of patients, healthcare professionals, and the communities. Secondly, we do not want to compromise the ability of the future generations to meet their own healthcare needs. So I have actually listed here 4 pillars out of which the sustainability in healthcare is built. They are the environment and sustainability. So we need to take care of the environment. We need to reduce the carbon emissions. We need to start replacing the plastic bottles. We need to promote eco-friendly approaches in healthcare. Secondly, we need to make sure that there is economic sustainability, that there is no money wasted, that we are financially viable, including managing healthcare costs in every country and also improving efficiency. Thirdly, we need to make sure that there is social sustainability. We need to promote equity, access, and inclusion in healthcare. We need to address the disparities that currently still are in the healthcare, ensuring culturally competent care and fostering the well-being. Last but not least, what we would need to do is the clinical sustainability. We need to maintain the high care of standards while evolving new technologies to healthcare. And what I already said, we do have the challenge of the facing the aging population, how to address this. I would like to present you very shortly just an example of new technological advancement. This program is called SIHA. It comes from Europe. It's going to enter UAE as well as other GCC countries. It's still in development phase. My company here in Dubai is involved in this one as well. So what is it? What is SIHA? So we have very many existing problems in the healthcare as of today. We have the fragmented healthcare systems. We have the lack of integration of wellness facilities. We do also have insufficient data management, complex user experience, privacy, security concerns. And we have the high transaction costs. So SIHA is supposed to address all these. So how does it do it? It empowers the users. There will be decentralization, so it offers compelling solution with its decentralized platform that provides transparency, security, and efficiency. The data will be controlled by the user. There will be also something which is new, a tokenization. It facilitates new business models and creates revenue streams for the users. And it will be seamlessly integrated into the healthcare providers, improving accessibility and user engagement. So SIHA is for everybody. In this room, in this country, in this world. It is for individual consumers and providers. It is for healthcare providers and institutions. This is the team developing SIHA, and they are from Portugal, as I said, entering the market. My company is supporting them with that. They are now in the financing round, so it's still in development. And this is if you want to scan the QR code, you will find more information. Anyhow, I think there are a lot of challenges that we need to address, and we need to address them now. It's getting late. Even though the goal by the UN was 2030, I think we are running out of time soon, and we need to collaborate with that all together. So, if you want to talk more about SIHA, about the SDGs, about my role, whatever, I would be happy to do it on the break. So please reach out to me. I'm based here in Dubai. I do run several ventures, medical doctor, oncologist by training, have a very long 21 years of international career in international business. Anyhow, I would like to thank you for your attention, and I think I exceeded my time with 1 minute. I'm sorry about it. So I'm now standing between you and the lunch and the networking. So thank you very much for your attention, and looking forward to collaborating. Thank you. Thank you.
I would like to request Kamal to please come on stage and present Dr. Krohn's with a memento. Thank you so much for your presentation. I'm sure the audience is now more knowledgeable about the Sustainable Development Goals and how healthcare fits in there. Thank you. We will now slip into a lunch break. This is your opportunity to catch up with each other. And I request all of you to please be back in your seats in another 40 minutes' time.
Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good healthcare for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future. a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social
Sí, 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 Hello. Hello. Check. Hello. Check. Hello. Check. 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 Hey. Hello. Check. Hello. Hello. Check. Hey. Hello. Hello. Check. Hello. Hello. Hello.
When 79th United
Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time, when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
when 79th United Nations General Assembly brainstormed on 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into
Welcome back. I hope we're all ready for post-lunch sessions, given that we've had a hearty lunch, and I guess your appetite for more information, more knowledge is just revved up after lunch. Welcome to the Sustainability Hour, a dedicated session within the prestigious 10th edition of the IHW Summit and Global Leaders Awards 2024. This is not just any hour. This is a time of powerful reflection, a time to amplify community education and mobilization initiatives that are shaping the future of our world. Today we are here to accelerate the voices of sustainability champions, global pioneers, those who have taken bold steps to change the narrative of how we live, work, and coexist with our environment. These special hours of sustainability, integrated into the heart of the IHW Summit, are designed to give each one of you the opportunity to raise awareness, to advocate for change, and to present solutions that can transform the very fabric of our global future. To talk more about the Sustainability Hour, I would now like to invite on stage Mr. Kamal Narayan, CEO, IHW Council. Please give a round of applause. Welcome Kamal on stage, and I request him to please talk to us about the Sustainability Hour.
Good afternoon. So this is that much awaited moment when we try to step up the whole discourse and campaign about sustainability and globally. So, distinguished guests and the global citizens present here. Today we gather at a pivotal moment in history as world leaders convene at the United Nations General Assembly for the Summit of Future to shape our common destiny. We here in Dubai stand united with one powerful mission: sustainability for all. This is not just a regional cause, but it's a global imperative. And today marks the launch of the new chapter in this movement, the world's first ever Sustainability Hour. And we bring it to you from IHW Council. In this hour, we bring forward the message that has echoes across continents and was amplified during India's G20 presidency by our visionary Prime Minister, Sri Narendra Modi. His call for Vasudhaiva Kutumbakam, the word as one family, resonates deeply with our timeless philosophy, inspired by leaders or inspired leaders during G20, and continues to call for unity and collective action, urging the world to prioritize sustainability and climate action. Prime Minister Modi's mission for lifestyle for environment, also known as LIFE, has now become a global call to action. It urges each of us to adopt conscious, sustainable practices to protect our planet and secure a brighter future for all. This is the spirit in which we gather here today at this first ever Sustainability Hour. And what better place to launch this initiative than Dubai, a beacon of hope for sustainable development. Last year, Dubai hosted COP28, further cementing its leadership position in driving global climate conversation and actions. The UAE has been at the forefront of incorporating sustainability into every facet of life, setting an example for the world. The IHW Council envisions Sustainability Hour as more than just an event. It is a global rallying point, a movement to inspire action, shape policies, and build a future where sustainability is not just a goal, but a way of life. Let this hour be the spark that ignites lasting changes, bringing together governments, industries, and individuals to take meaningful strides towards a more sustainable, thriving planet. Thank you for being part of this historic moment. Together we can make sustainability a symbol of hope, unity, and transformative action for our shared future. Thank you all, and shukran.
Thank you, Kamal. Now, sustainability is definitely very important, but you want to know why sustainability? Why is it the need of the hour? We have with us our keynote speaker who will throw more light on the why sustainability is the need of the hour. Please welcome Dr. Lalit Bhasin, Managing Partner, Bhasin & Co. Dr. Lalit Bhasin is a leading advocate and legal luminary with over 6 decades of distinguished service. He's the president of the Society of Indian Law Firms and has held key leadership roles across prestigious legal bodies, including the Bar Association of India. Please give a huge round of applause to Dr. Lalit Bhasin.
Thank you very much for your very gracious introduction. It's indeed a privilege and pleasure to be here as a part of a brilliant initiative led by Mr. Kamal Narayan and his very efficient team. We have the distinguished presence of Dr. Harshvardhanji and also Mr. Kamal Narayan, such eminent environmental lawyerists, you see, that is Sudhir Mishra ji and others, very distinguished members of the medical profession and other eminent citizens. I think I am the oldest member here, participant present today. Is anyone older than 86 years? No one. Okay. I started my law practice in the year 1962. So I have seen the evolution of not only the legal profession and the system of the administration of justice, but also as a citizen of the country, I've experienced various facets of life, including, you see, the field of medicine in the sense that everyone falls ill, as a student, as a professional, and as someone who believes in giving back to society after 62 years in the profession, I bring to you greetings from the Society of Indian Law Firms, which is the apex body, a unique body representing about 150 topmost law firms of the country. I happen to be the president. I also bring to you greetings from the Bar Association of India, which is the highest professional bodies of the legal profession in the country, as its immediate past president, and also as the chairman of the Chartered Institute of Arbitrators, which is headquartered in London. I have seen, as I told you, the evolution. Let us see whether we were better off, say, in 1960s, or we are better off now in terms of our way of life and our expectancies. Has technology helped us, or it has helped us to deteriorate in certain very important fields, including the field of medicine and health? Let me first take the example of my profession, that is the legal profession. Only about a month ago, I was sharing a platform with the Honorable the Chief Justice of India in Pune at the convocation of the Symbiosis Law School. And the Honorable Chief Justice said that how technology has helped the citizens and the litigants of this country, India, to approach the courts, reduce the costs by making it ease of filing, petitions, affidavits, everything, made it so easy. You can do online everything. After his speech, I had to speak to give a response. And I asked the Honorable Chief Justice, I say, you have facilitated, definitely it's a big help to the litigants, but what about the disposal of the cases? Virtually no one had any answer to that. There are about 6 crore cases. Please turn them into millions, because I'm not familiar with the crores and difference between millions. So 6 crore cases pending in the courts. Arbitration has become very expensive, even if it is online. It has become very prolonged. So what was the state of litigation when I started my law practice, when there was not much of technological use in the legal profession? I think we did not have more than a couple of lakhs of cases pending at that point of time. The litigant did not feel the difficulty in filing cases or approaching the lawyers. Litigation was not very expensive, and the decisions were forthcoming within a matter of a year or so and all that. Now compare it with the situation which is today. By use of technology, our pendency is increasing because it is ease of filing, but there is no ease of disposal. For the reason, simple reason, that technology or AI cannot help in disposal of the matters. It has to be decided on the facts of each case. Every case has to be decided on its own facts. And AI, it has been used in several high courts and even in London. And the results have been disastrous, you see, absolutely disastrous. And those decisions had to be overruled. This was the state of the legal profession. What is the state of the medical profession? Dr. Narendra Nagar pointed out what is happening, you see, in the hospitals. When I was a child, sometimes I had some illness. My parents used to take me to a family doctor, or the family doctor used to come. He used to attend to me, give some sort of medication. Hardly any injections were required. Hardly any investigation was required. And that was not the case just with me. When I'm saying me, it means people of my generation at that point of time. Every household had a family doctor who used to attend whether you have a headache or a stomach ache or you had a fall and everything. That was the state of health of people at that point of time, as I have seen. Today, and I can say with some daring certainty because my wife Nina and I, we are advisors to most of the eminent hospitals in India, including Apollo and Medanta and all that. We have nearly 200-300 cases of medical negligence pending against the hospitals and against the doctors across in the NCR in Delhi. Just in Delhi alone. When a patient goes to the hospital, first thing is, okay, you undergo all these tests. A long list of tests is given, as very rightly pointed out by Dr. Nagar. All those tests are undergone. Then he goes to one doctor. He says, oh, you have this ailment. You go to a specialist, then on to other. And if there are some surgeries involved, then anyway, the meter keeps on rising. The doctor's fee keep on rising. Even hospitalization has become a very, very costly affair. And poor patients can't, you see, afford that. In Apollo Hospital, we have this system of treating economically weaker patients. But the patients can hardly afford even to come to Apollo Hospital for treatment. And when they come also, they do not get the free medicines or free medical consumables. They have to pay for all that. So even that has become very expensive. Take the state of transport. When I was a student, I did not have the luxury of even having what we call the scooter. It used to be a Lambretta or a Vespa scooter, which used to cost about 3,000 rupees, which was a big amount there. We used to go on bicycles or some public transport and all that. These days, the students, they have the luxury of going to their colleges, institutions, in their own cars, or in two-wheelers, or in three-wheelers. Just see the pollution, you see, which this has caused. Instead of bicycles and all that, which we people used to, now you have the two-wheelers and three-wheelers and the vehicles. Every family, it was a luxury to have a car in one family. But now, it is a necessity for every member of the family to have a car, whether he is a student or whether he is a son or a daughter or son-in-law or a daughter-in-law, everyone must have a car. This is what has been caused. In the field of civil aviation, which is one of the major pollutants in the world. You see, civil aviation. We used to have about 10, 12 flights. Now you have hundreds and hundreds of flights, and still people are waitlisted. What pollution is being caused, you see. See the degree of the pollution which is caused in the air. It was not there at that point of time. Look at the state of the cities. And I'm saying that with my own experience. I used to visit Srinagar in Kashmir, such a clean city. Now it is full of buildings and buildings. You don't see greenery in Srinagar. You have to go outside and all that to see. Shimla, what is happening? Himachal, Uttarakhand, landslides. Every day you read in the papers, there are landslides because the ecological system is not working, you see. It has caused disastrous consequences. Therefore, don't play with the nature. Nature will play havoc on you. And that is what is happening. Today we have discussed several aspects, but we have not discussed in detail climate change. Climate change, which is so important for health, and that has not been discussed. Climate change has brought about very serious consequences, and we are experiencing it now also, day in and day out. The glaciers are melting. The sea level is going up. Landslides are happening. Floods are happening everywhere. In Europe, there is a heat wave. In London, I visited. They are not used to having fans, much less any cooling air conditioning. But now if you visit London, you see, the air conditioners, you need fans. That is the state which exists today. So what is the message? Message is, yes, development is important. Economic development is important. But should it be at the cost of the environment, for which Mr. Sudhir Mishra has been fighting in and out in the courts also. Mr. Mehta, he started the litigation in the Supreme Court to challenge whatever was happening in the field of environment. It is in a way to go back. And I told, so far my profession is concerned, I told the Honorable Chief Justice, and later on I have been speaking, let us go back to our old consensual form of administration of justice. We used to have a very effective panchayat system where people, the 5 people, wise persons of the village used to get together to resolve their disputes amicably, not in an adversarial manner. That is what was happening. Even when the Mughals came in, they believed in justice, not just technicalities of law. Adle Jahangir, Adle means justice. Jahangir's justice is known because he used to dispense justice right on the spot without any implications of any legal requirements or legal technologies. It is the British who brought in, you see, the adversarial system, 3-4 tier of courts, starting from the lowest court to slightly higher court and the high court, division benches of high courts and Supreme Court and all that. That is what was happening. And why can't we go back to that? That is what is required. It does not need technology. It does not need anything. And what has been highlighted by Dr. Harshvardhan, very rightly, the Prime Minister's 3-4 messages, which again have nothing to do with technology. That is fitness, emphasis on yoga, emphasis on good hygiene, cleanliness, that having toilets in every household, and also in the field of food. Now, why do people talk of organic food? Organic food is the natural food. Because other food there is contamination with chemicals which are put in there. But people want, in a way he's telling us to go back as far as possible without compromising on development. Because development is important if you have to compete globally. But we have to create a right balance, you see, of not using technology where it is not required, not industrialization where it is not required. Let us not forget the message of Mahatma Gandhi when he said, use khadi. By using khadi, he did not mean just use khadi. What he meant was promote khadi gram udyog. Khadi gram udyog, which never required any technology, any equipment, any machinery or anything. But that was a great message which he gave to the citizens of this country, our country in India. Why can't we do that? Take technology wherever it is required, but use of technology, kindly see what has happened. During my time when I was a student also, and when I started my practice, there used to be one telephone, that big black box type of a telephone you used to ring, you see, 1, 2, 3, and then dial and all that. It was difficult to get that connection. And now, with every child of even 1 year or 2 years, you give him a mobile to play with. What havoc you see that is going to create? What is it that we are giving to our next generation? This use of technology. They forget how to write, how to read. I visit law schools every day and I tell them, please tell your students, give them that skill of writing. People have forgotten to write letters or to send communications. Language has been mutilated to that extent that we use that SMS. Instead of FOUR4, we say just 4. What is it that we are heading to? Is this what is meant? Therefore, don't compromise on sustainability. Sustainability is need of the hour. What will happen, supposing you have a very, very developed country, say like US, but if nature strikes back, all your development will be set at naught. There will be no development, you will be finished. The countries will be finished if the nature has to play havoc with that. And we are creating those circumstances that nature will hit back sooner or later if we do not, you see, take effective steps now. Therefore, my appeal to all of you, people gave example of COVID. Yes, technology might have helped in creating certain preventive measures for COVID, but we forget what caused COVID. It was a man-made disaster which caused COVID. It was not a natural disaster, a man-made disaster. So we are creating those disasters to happen, and we will have no answer if the nature strikes back. Therefore, please, look at this from this angle. I know I'm speaking off at a tangent from the main theme of it, but I want to share my very strong views on this. Use of technology is there. It is good for development, but at the same time, there can be no compromise on sustainability, particularly if we are talking about health. Thank you very much for this patient hearing. Thanks a lot.
Thank you so much, sir. So you said that you are encouraging law students to learn to write. I think most of us are even forgetting writing when you have ChatGPT doing all your writing. Why would you even make the effort to write or even type? Let's hope technology only helps us. I would request Kamal to please come up on stage and present Dr. Lalit Bhasin with a memento. Thank you so much, sir, for your words. And let's hope all of us will, all the world pays heed to your words, and sustainability is something that everybody agrees upon and does something about. India and China are two large economies in the world, and they are in Asia. And the way they grow from here on is definitely going to have a huge impact on the carbon footprint of the entire world. Our next talk is on the role of Asia in sustainability challenges. And for this, I would like to introduce our speaker, Mr. Sudhir Mishra, founder and managing partner, Trust Legal and Door Tenant, United Kingdom. Mr. Mishra is regarded as one of India's leading lawyers in the field of environment, healthcare, media and infrastructure. In 2004, he founded Trust Legal to provide holistic, value-based, client-driven legal services. In 2022, he received the Guardians of Sustainability Award at a curtain raiser for Canvas, the world's first Student SDG Accelerator Initiative. Please give a round of applause to Mr. Sudhir Mishra. I look forward to listening to his words of wisdom on the role of Asia in sustainability challenges.
I'm using this medium because Kamal wanted that we should use like this. I like to make it as interesting as possible because our biggest challenge is that climate change is supposed to be a hoax. And that's what the biggest debate is. US election is happening. And how important US election has become for climate, that the President Trump has always believed that climate change is not there. And his opposite end is always done for last 25 years, much ahead than any other country. Even if they are part of COP or not, they were always bullish about how the climate transition should happen. Dubai is very important, and I'm thankful to Kamal. I'm thankful to Dr. Bhasin that he came here, gave us such a big voice to sustainability. And we have here ex-minister Dr. Harshvardhan. He is the actual Mr. Clean politician in our country. We always respect him that way. He was both the environment minister and he was also the health minister. So I have got a place where I can give you a few data. So COP 2023 happened in Dubai. It was about to be the biggest disaster so far the climate negotiations are concerned. At the last moment, they decided that, okay, we'll pass some resolution. So on climate financing, no major resolution was passed. But so far as reduction of fossil fuel is concerned, the COP23 concluded we will do it in the phase-wise manner. So globally, what is happening is that any fraternity, whether it's lawyers, accountants, they all are now understanding the sense of emergency we are in. Before going into specific aspects, I can tell you that in this house, we have so many people who are making me convinced that sustainability or basically taking a position on protecting the planet is actually a serious business now. We have Kamal taking this moment. We have Amrish Chandra here, who is talking about SDG in an entirely different way, taking Gorakhpur as a base. And we have Khalid Pasha, who has come from Bangkok, who represents IUCN, and I was in Bangkok 2 weeks back. So for a person like me, and Dr. Lalit Bhasin has seen it from very close, even to talk about environment 15 years, 20 years back was supposed to be why we are wasting time. And from there we have now come to a stage where everybody is concerned about it. But what is our success? For a country like India, the success is, and we'll start with India because I represent my country, we had 9% of forest cover in 1947 when we got independent. We have 17.5% forest cover today, with this kind of population which we have in our country. I think it's a big success. You can clap for this. We had less than 1,000 tigers, Project Tiger in 50 years, and Dr. Harshvardhan was leading that ministry. Tiger became an indicator species. It protected our forest, it protected our soil, it protected our rivers, it protected our streams, it protected our ecosystem, it protected the people around it, and the rise of tiger numbers is a case study for rest of the world, and Khalid will agree to it. In IUCN Bangkok 2 weeks back, everybody was talking about how India has protected tigers, and now under Prime Minister Modi, we are even introducing species which we had lost long back. So that's two. Now the third place where Prime Minister spoke about it on 16th of September, that India has already achieved its climate targets amongst G20 countries 7 years in advance, so far as energy transition is concerned. That just happened 4 days back. Now, anybody who is familiar with all the energy agreements which India is doing with various European nations, as a law firm, I am part of few of such initiatives where I am seeing that for solar, for lithium, for new kind of batteries, so much is happening. So many agreements are being done. And the best example is when you go to SEBI, you see the top performing companies in non-conventional energy sector, their stocks are booming and they are doing very, very well. 10 years back, they had a lot of problems on sourcing or understanding from where their growth will happen. So this is the India story. If you see even China, seeing what was happening around them, in 2023, China, in fact, decided to tell to top 300 companies to go for a ESG roadmap. So China finally joined the party. And the country who is leading, which is an aspiration for every European country or even for the Latin America and Africa, on climate finance or all the agreements which are happening with regard to financing of saving the sustainable movement is Singapore. Singapore, with whatever tiny population they have gone beyond their skin along with Japan, along with Taiwan, and along with even I will say Vietnam now, where they are signing more agreements for saving the planet on a daily basis. And Japan has created 3 verticals in Bangalore, Cochin, and in Delhi, which is only working on sustainable companies. And that all has happened in the last 3 to 4 years, post-pandemic I'm talking about. So if you see the global situation and how Dr. Harshvardhan will remember that when he took over as the Minister for Health and Environment, in 2015, I had filed a petition in Delhi High Court because there were various petitions pending on saving the Delhi lungs, because Delhi is the most polluted capital city in the world so far as air pollution is concerned. So the judges asked, why are you filing this petition? There is already a petition in the Supreme Court. There is already a petition in National Green Tribunal. How can you have so many petitions? I said, look, I'm not here for compensation. I have filed this petition because I want to save my lungs. I want to live in this city. And that petition is going on for last 10 years. It is still pending in Delhi High Court. So one important thing which Dr. Bhasin has said, and there is one reason why you have to appreciate the fact that he leads my bar, but he came all the way for this conference. And it's difficult to get his time even in India for different opportunities because he realized we are talking about sustainability. Dr. Harshvardhan, in last 3 years, He has mainstreamed Indo-American Chamber of Commerce, CII, where he was heading. He created the complete roadmap for ESG and climate change. And most of the people who are here in this hall are actually who believe that something has to be done on an emergency basis, and that's how the planet has to survive. Now, when we say, what are the challenges? I think the biggest challenge which countries like India are facing, Dr. Nagar talked about the rise of plastics in our society. Let me tell you, that's a big accident actually. If the pandemic had not happened, प्लास्टिक की तो नोटबंदी हो जाती. मैं बहुत बड़ा वर्ड यूज कर रहा हूं. July or August 2020, plastic would have been completely banned in India. There was a plan, the government was working, and to a large extent this succeeded in 2022 when they said from 1st of September, the plastic will be phased out. If you go to any Kirana store in India, you go to any vegetable center, you go to any milk booth, you will not find a plastic packet in India. You can find them in most of the Europe and in America. So we have succeeded there also. Of course, pandemic was a big reason why plastic came back. The biggest challenges most of the Asian countries are facing, and India in particular, is the river pollution and the air pollution. So we have saved our forest, we have saved our wildlife, we have mainstreamed the debate for the corporates that sustainability pays, or you take a pre-position on sustainability. But what do we do about dying rivers? What do we do about our urban clusters? How do we make real estate companies accountable? How do we make sustainability fashionable? That is our biggest challenge, and if we manage to do that, we'll be home. Thank you.
I would request Kamal to please come up on stage and present Mr. Mishra with a memento. Thank you so much for sharing your thoughts. And of course, India is doing exceptional work when it comes to environment, when it comes to digital public goods. And I'm sure we will have lots of templates for the world to follow, especially the tiger conservation program. Has been very heartening. We now move on to a panel discussion, and this is on catalyzing social change, harnessing the power of ESG, CSR, and community engagement for sustainable impact. Now, we have seen that the government is doing its part when it comes to sustainability, and there is a lot the government can do with plain laws and regulations. And there are some states which are no plastic states, where you will not get a plastic bag should you go shopping. There are some states which are totally organic. Sikkim is a state where they do not use pesticides, and we have a completely organic state. There is a lot of awareness in the country, and we are seeing this becoming more diffused by the day. But this session will examine the increasing importance of environmental, social, and governance (ESG) factors and corporate social responsibility (CSR) in driving sustainable practices across industries. This panel will bring together experts to discuss how ESG and CSR principles can lead to meaningful environmental and social impacts while also promoting long-term business success. The conversation will focus on how the evolving role of these frameworks is shaping a more sustainable and responsible future. So please put your hands together and welcome on stage our speakers for this session. Please welcome on stage our moderator, Mr. Sudhir Mishra, founder and managing partner, Trust Legal and Door Tenant, United Kingdom. Please welcome our other speakers, Dr. Abhilash Raghavan, Director, ESG, Sustainability and Safety, HSEI. Please welcome Mr. Ashish Alawat, ABP Digital Marketing and E-Commerce, Micro Labs. and Mr. Chinu Quatra, social influencer and founder, Kushia Foundation. I would request Mr. Mishra to please kickstart this discussion on ESG and CSR for sustainable impact.
So I kept it brief because I was knowing that I will have to come back again. But before we go to the ESG part, because we have representation from the industry, consultancy, I just want to tell you that a very interesting thing is happening across the globe. And what one first moment could be that whatever we are going to discuss today, we have to bring out the stories. Now, what is the story? The power of the stories. Because like when Kamal started with sustainability, this has become now the story. Everybody is trying to talk to that how this will be the new concept. I think our biggest problem at least in the country from where I come from, I was working on a assignment with textile industry, and we realized that there is a place in South India which now does zero discharge, because their entire dyeing industry is now in zero discharge. I'm talking about Tirpur, which was one of the most polluted cluster for textile industry. And I tried to search it on LinkedIn, I tried to search it on Google, but Kamal, I failed to find the stories. When will we start making stories like iPhone? That iPhone 16 has come, and there is a queue as long as the general elections, and people have not eaten for 18 hours standing outside the mall. Or there is a guy whose interview is viral, and somebody made a comment on Twitter that his grandfather must be a very wealthy person. He said, I'm standing here since 11 o'clock in the morning yesterday. My number will come. I'll be the first person who will buy an iPhone. So I did investigation. I don't think any one of us will remember who manufactured Xiaomi, OnePlus, Nokia, Samsung, but we all know Tim Cook and Steve Jobs. I think sustainability needs to find its own Steve Jobs and the stories like Apple. That's your first major challenge. So, with that, I will ask you that, will you say that how any ESG story you want to share, anything which makes it very interesting for people to absorb?
So, firstly, thank you so much, sir, for this question. And I am here just because of the story, my personal story.
Yours is a story, actually, the beach part, right?
Yeah. Yes. So, when I was in college, I hosted Nature's Club, and at that time, people laughed at me because it was just an EVS subject, and the subject which is not having any importance. Kabhi padhai karke nahi gaye uske upar, and still passed those subjects. Later on, when I got hit by a personal incident in my life where I was into suicidal thoughts, I attempted suicide twice, I wanted to come out of that. So I took the path of social service, and that gave me a second birth in 2014. And from there, I understood that how important it is to give back to the society. So currently we are having shelter homes, we are into education and environment. So I became a hero. I am on this dais just because of cleaning beaches. So earlier I was known as the kachre wala. Today we are known as safai wala. So there's a shift in the mindset of the people.
I'll just make a pause here because I know where you will take it. It will become very interesting. So if you do Google type beach cleaning, the Bombay beaches come and this man's name comes now. Please give him a clap what he has achieved. He has got all the film stars, all the blue people, all the politicians, and you have seen him picking it, not for effects, not for doing. So this is what is the Chipko moment for beaches actually, where you are actually doing the Chipko moment. So that's why we remember Chipko moment, you remember your beat. So now you can proceed.
So, but still we are considered as underdog. I was telling Harshvardhan sir the same thing right now, because he is one of the inspiration to me. The moment he came to the environment ministry, and I could see that environment ministry.
I'll give another one just to make it interesting. You now need to get Roman Magsaysay award. That can open up many, many things. People can become Chief Minister of Delhi if you get that award and come into public service.
Having said that, sitting in a closed room and talking about environment is very easy, I would say. But walking on the ground when you see that your environment is dying, and with the pollution made by yourself, so the beaches पे कचरा ऊपर से नहीं आया है, हम नहीं फेंका है, and we have to work on a solution. The solution is maximizing recycling in India, like other countries, where recycling is considered to be not a CSR or a profit-making project, where when it comes to CSR, it is all about put up the money where only the fixed cost is required, not the operational cost. We want to come up with those helping hands who can take up more recycling units and help the country to breathe in.
Very well. On this note, I'll tell you, here Dr. Khalid Pasha is here. He has come from International Union for Conservation of Nature. So I used to think that nobody will notice, as I said in my initial talk. First 10 years, I was chasing every poacher in the district courts. He was witness in few of those matters. So 4 or 5 times I was told to leave the court because there was a chance I will be shot by the poachers or somebody connected with them. And we are talking about Veerappan of North India, Sansachan kind of people. Openly I'm saying on this stage. All the time the threats was there on our life. When you walk on the ground, then you know the meaning of the forest. Similarly, when you walk with your own hands, you know the meaning of, and I think conservation needs that. So people Babas, or the waterman, Dr. Rajendra Singh, or the pond man, or you, these are the people who can connect us with the real effort of sustainability. I totally agree with you. Unless you have done that, you cannot make a large impact. Ashish, where do you want to take this story?
Thank you for this question, and Chinu, I would say great work that you have done. I have myself, been in Mumbai for 7-8 years and have seen the difference. The beaches have become a lot more cleaner. So I would not have such a compelling personal story to share as Chinu, but I definitely have a corporate story to share. So, and he has already given the background for it, saying that beaches are being polluted and plastic is one of the biggest pollutants today in the beaches and anywhere else we go. So I represent Microlabs, right? And just to give you a little bit of background, Mr. Bhasin also mentioned this, that we have to move to sustainable options and everything. But there is a challenge inherent in pharma industry or healthcare industry, that we cannot have substitutes, right? Needles have to be plastic needles, IV sets have to be of plastic, right? So how do we as a pharma company make an impact? And we decided that we have to act on this. So we came up with a very innovative solution called as plastic neutral solution, right? So wherein we chose our biggest brand, which is Dolo 650, and started work on it with an agency known as Repurpose Global. So what we did is we calculated how much plastic are we generating from our operations. So that came up to be around 350 metric tons of plastic is what we generate from Dolo 650 manufacturing. We cannot replace it, let's be very honest, right? Because then it will have problems like, the medicine not being stable and all that. So how we dealt with is, we started doing like Chinu mentioned, we have to act on the recycling project. We are now sponsoring 2 recycling projects. One in Udupi district of Karnataka, known as Project Anmol Kinara, Kinara being the beach word in Hindi. And also we are sponsoring one plastic recycling plant in Bangalore, Project Sada Shakti. So combined together, we will be removing 350 metric tons of plastic. So
very good. That's amazing. That's very good.
And very proudly today I sit here and say that by this initiative, Dolo 650 has become the first plastic neutral brand of India. So the amount of plastic that we generated, we recycled it, and the recycling plants actually have a lot of technology involved as well. I come from that background wherein we are using technology to trace every bit of plastic that we collect and we recycle and we do everything. And one more additional point is the social aspect of it, wherein around 2,000 waste managers are now getting consistent jobs for the entire year. and a life of dignity. So this is...
I'll just, Ashish, you have made such amazing observation. You started with so much of modesty, whether it's my work or Chinu's work, but I just want to tell you something on the ground. National Green Tribunal has been dealing with series of matters on monumental waste which Delhi has or many states have. And we have tried to make waste to energy plants, recycling, and we are still searching questions. When I forget about answers, we are still searching questions because every day the questions are emerging. And the second part is that even to process the waste which we generate in cities like Delhi, we have almost given up. We are not even talking about more sewage treatment plants, which the courts are saying, but you said you will do it. But in next 2 years also, we don't see them adding up. So if you have a story of recycling plant, we all can combine our energy. I can ask Kamal to make a story about it and tell it, put more funds in your hand that you make maybe 40 or 50 such recycling plants in the whole country. Because we are not having many examples. Why did I mention the forest and the wildlife? The reason was we succeeded there. And nobody believes it. We don't have game reserves in India. We don't kill our animals in this country. So I would say that these are tricky areas. If you have succeeded, tell us, we all will come and we will make about it and we'll talk about it. So what are the plans to scale up that recycling story?
So the plans for scaling up are like we experimented with one brand, and of course we'll want to do it to other brands as well, and maybe to other part of country. So we are headquartered in Bangalore, so we are focused more on Karnataka currently. We would want to take it to a national level initially, and then maybe other countries where we have operations as well. So those are the plans for now. And yes, I mean currently it's been going great.
Very good. Dr. Abhilash, I will leave to you that you have seen 2-3 stories now. Where do you see the ESG debate going and environmental debate going?
Good evening, everyone. And first of all, thank you very much for IHW Council, especially Mr. Kamal and his team, for giving an opportunity to share the dais with some of the dignitaries here. And regarding the point which Mr. Sudhir was mentioning, so he mentioned about Tirupur. So I'm very close to this place because in the year 2002, so I was working on a project there. And this Tirupur, if you remember, this place is famous for the cotton, textile and bleaching industry. So at that point in time, so there were roughly around 1,000 kind of unorganized textile dyeing and bleaching units. And during our study, because I was part of a project funded by National Environmental Engineering Research Institute from Nagpur, and I got an opportunity to go to each and every units which are located in this Tirupur area. And one of the important things that I've noticed there is the kind of pollution these industries are contributing to the local the water bodies. So there was a river called Noel River. If anyone from the south, they can recollect this name. So this is completely a tributary or a channel flowing with all the textile effluents. So from that point in time onwards, I think thanks to the kind of focus from the government, the Pollution Control Board and all, to insist on a zero liquid discharge plants. So this actually has resulted in wide-scale improvement. And if you look at the case there, so it is mandated to have zero liquid discharge plants across all the units. And if by any chance, if the infrastructure doesn't allow this particular small unit, they can tie up with a common effluent treatment plant called a CTP. So invariably, the government regulations were so strict, and thanks to that, I've seen, because the study was a before the SLD, and then after the installation of SLD. So there is significant change that has happened, and of course, there is a lot of investment that incurred.
So I'll just tell you very interestingly. Last week only we were doing this conference with the textile industry, and I was not aware about the Tirupur success. And I can tell you that so far as our tiger story is concerned, the world knows. But if you open any social media platform, they talk about how much pollution is there, how India is not careful. And my biggest challenge is, and people like Kamal and many CEOs who are present in this, we have to realize one big contradiction as a country we are living in. We are the 5th largest economy, and very soon will be the 3rd largest economy. 4 years or 5 years back, 7 years back, we used to say, no, 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 the West has polluted a lot, so we have also got time to do our carbon footprints, and they have done everything, so we'll take time. At the same time, we say that we are a responsible superpower in the making. Now, how do you explain this contradiction? That's the contradiction number 1. So you don't have to worry about, thankfully now we don't pursue that stand. In fact, 10 years back that was very apparent, we will not be bound by any major climate change thing. Now we are saying we will do voluntary cuts, we'll be net zero 2070. Tirupur, I'm going to Tirupur in fact. I promised them I'll go to Tirupur. My idea is that if I go to Gorakhpur, if I go to Tirupur, we create new areas which can be the Davos for the sustainable development. I would call them the Davos of the sustainable development debate. Or koi option hai nahi, we don't have option. Now you know about Tirupur, but how many people know that Tirupur has managed to do zero discharge for textile industry? The same Bhilwara has to do, same other clusters have to do. And then you have to do what Bangladesh is doing in a manner which is not being told to the world. They do all kinds of environmental pollutions, but they sell more than us in the international market because they may be finding some stories there. So how do you think our storytelling capabilities, I'm only focusing on that for a reason, that you all will go back and think about the stories. There is a private university in India, one of the finest OP Jindal University. They did one of the first SDG report. Almost 10 states started following the same format because it came out like a story. We prepared that reporting, in fact. So what do you think is the 2 message you will want from Tirupur, and you feel that the other clusters can take it?
There's a lot of learnings from Tirupur, and as you rightly mentioned, this is being replicated in other parts of the country also. And to add on that, as you rightly mentioned about the current focus from the government, the kind of the focus on the renewable sector or the other kind of clean energy development. So I think this kind of things are really helpful, and they are actually paving the way to a more sustainable world, and especially with the renewable, because I worked in a renewable company in the last instance, and we actually contributed to the addition of almost around 10 gigawatt of solar power to the grid. Okay, and it's not only that, we also ventured into the green hydrogen business and the battery storage system that we talked about, and we also have the hydro pump system. So the PSP, the pump storage project. So these are some of the new innovative areas which will help to decarbonize the overall industry. So I think the path is very, and I'm optimistic that we'll be able to reach the net zero target much before 2670 if this kind of growth and development is going forward.
You know, beach, we have 1700 kilometers of sea coast in India. Thanks to you, Bombay has a culture of now cleaner beaches. Goa is now struggling under the tourist pressure in such a manner, especially the North Goa part. So are you going to think about a beach hour or something where once in, like you go to the beach, I think weekends is something which you, what is the model? Can you explain what exactly you do? How do you get celebrities that particular time? And can we create a beach hour?
So yeah, we have already planned that. We are doing that in December.
Trademark मैं register करा दूँगा.
So basically, while I was here today at 10:30, 11 o'clock, we already had 800 volunteers at the beach in the morning who cleaned Dadar and Juhu. So idea is not about Chinu Kawatra. Idea is about the team. Idea is about to create your clones who can work in terms of environment and without money. So we need that heart at the right place where the volunteers are coming on ground and doing their part. The idea is not the cleanup. Cleanup karne se We are not pointing out on government that the part is not clean. We want to make people understand what mess we have created on the beach. And that's the reason, the moment you come for the cleanup, sir, you will understand someday or the other, you have littered this, or openly, unknowingly, or knowingly have thrown this packet or something. So that will hit your guilt. And in India, things will change only if the ego hurts. So we need to hurt the ego of the people at the right way so that the plastic menace and the debris goes away. With that, we want to focus beach cleanup. I want to, my whole goal of beach warriors is to close down beach warriors. It can only be when we can, when the beaches are clean. Now we are focusing towards the awareness part, because the coastal line, we were talking about rivers. In Mumbai, Meethi River is the known river which is known as Nala. Now it, on daily basis, more than 2,000 tons of garbage is coming out from that river itself. And we need to focus on the recycling, we need to focus on awareness. This year, my target is to start the recycling unit from the beach itself. So there is, in India, there is a concept where only the hard plastic or the polythene is getting recycled. So we are talking about the beach plastic, which will get recycled. I have successfully done it since last 7 years now. We have made a couple of benches, baskets, and all these things out of the beach plastic itself. So we are focusing now with the cleanup. हम अपना कचरा उठाएंगे, हम अपने आप ही उसको साफ करेंगे, recycle करेंगे, so that we can run that model successfully, and it is a self-sustainable plan.
I have a supplementary question, because I know ego is a big issue, especially in our country. It's a big issue. हमसे आगे कोई इंडिगो में होता है, अगर वो पहले उठ के बाहर निकलना चाहता है तो हमको बहुत बुरा लग जाता है. हमारा ईगो तो बहुत ही बड़ा है. तो आप फंड कहाँ से करते हैं? Where do you fund all of this?
3 years back, I planned to stop this project because I was exhausted totally. My credit cards were totally empty because of the project Beach Warriors, because you need to take care of the volunteers, you want to provide them refreshments, if not money, and all these things. A couple of years back, two corporates who came as a support to us, Transworld Group and Kalpatru. Now we are looking out for more corporates and more area, not only Mumbai. So we already done a cleanup in Goa. We did a cleanup in Surat. We want to get into South because beaches.
कमल, इनकी जो टी-शर्ट्स होती हैं, उस पे जितने लोगों हम लोग मिलके लगवा सकते हैं, लगवाएं, ताकि सब लोग कुछ न कुछ contribute कर सकें.
Thank you, thank you.
And I'm happy to be part of that. In any case. That's the starting point.
Thank you, thank you. Just a small story to share here. There was this surfer who was based in UK. I still have his YouTube link with me, who interviewed me. He came to Mumbai specially to interview a person who is cleaning the beach. Reason, sir, हमारा महानंदा दूध का पैकेट यूके के ओशन में मिला. यूके में ओशन में महानंदा दूध का पैकेट मिला. कैसे गया वहां तक? Because obviously it is a science. The garbage travels. It is not seeing any boundaries. So we are in Dubai. Unfortunately or fortunately, what will happen after 20 years if the beach is not clean in Mumbai? It will pollute the other cities, other countries too. So we have to step up.
And amazing. So on this, I have to tell you that very recently, have you heard about that social worker, environmentalist? She got a special IT product, and she threw it in her dustbin. It was picked up by the municipal authorities in some country. I'm not telling a lot of details. And then she had the science to see the journey of the waste on her laptop, that where it finally landed up and how much truth is there on the recycling part. And horrifying details have come up. So it's not about India, it's about a very important country, but that research is under process right now. A lot of people have gone to stop it, in fact, because this will open up a very different debate. Actually, you are picking up everything or you are doing it in a particular thing. The second part is, you've talked about plastic, that when it comes to textiles, total whatever we manufacture, and I want you to think when you will say about that, 60 to 70% goes in waste. Like today, it's a fashion that I have 30 sets of suits or all of us, even male also, we have become like, we all have become like great consumers we are. Where will this all will stop? So first you mentioned the plastic, but I'll come to you on that part, that what do we do about the trash coming out of the textile industry? Because 65 unused also, a lot of unused also. I'll come to you first. We'll go to the plastic part. Yeah.
Yeah, so like you rightly pointed out, I mean, it is a challenge, and also like we see in my opinion would be on this thing is that, like, if I give you a very common example, you talked about stories, if I tell you a story. Today you go to a restaurant or anything, what is the first thing that you notice? The plastic cups have been now replaced by the biodegradable or paper cups. That's a good move, right? The straws again are now maybe paper, biodegradable, or steel in some cases. So first is the reduce mechanism, which is playing its part, which is very important, that, like, you know, we reduce or limit the use of plastics wherever we can. Like I mentioned, in industries like ours, healthcare and hospitals, wherein, like, you know, we rely heavily on plastics to keep our products safe and sterile. There, I believe currently we do not have technologies to reduce. So there is where what we are doing currently, we are focusing on recycling part of it, right? And then, of course, like you mentioned, I mean, I studied in my school days, thankfully, I was not those kids who didn't pay attention, is the reuse part, right? So there can be mechanisms wherein, like, you know, like I talked about the steel straws, which are, I believe, better than biodegradable paper straws as well, which we can just use, keep on continuing and using. And yes, I believe the corporate world, or we as individuals, need to become more responsible in this part. Like, I give you one more story wherein we at Microlabs, from World Environment Day, which is on 22nd June, to World Earth Day, 22nd April, to World Environment Day, 5th June, we did 16 plastic cleanup drives. We went to beaches, we went to railway stations, we went to bus stops and everywhere, and we collected plastics. Our employees collected plastics in 16 locations pan India, and we collected around 30 to 100 kilograms of plastics in those 16 plastic cleanup drives. And yes, of course, that was then added on to our neutrality index as well, wherein it was reduced from that. So these kind of initiatives corporates can take, individuals, we as individuals can take, in any of the 3 R's that I talked about, where we can contribute, we should contribute. So I believe that's the right way.
I will. So.
All right. On the textile, the waste part, so it is, of course, a fact that there is a lot of rejection happening in the textile industry. And be it the quality rejection or any kind of manufacturing defect or anything of that sort. So if you look at the Western world, there is a lot of focus on the sustainable clothing these days. So which means that whatever is rejected, so they try to make it reuse. So this is actually something which is happening in a great momentum, and people in the Western world especially, so they have a tendency to use some products which are made from recyclable things. So it is again adding brand reputation as well as the customer loyalty. So in many cases, the fact is that these products are priced higher than the normal rate. So the customers are willing to pay a premium for such a recyclable product. So I think that kind of opportunity is, of course, there in the textile waste also.
And also, I think repeated studies in last 4-5 years have shown that in the morning, Dr. Nagar talked about the packaging and everything. I was part of the petitions where packaging industry were involved, and we have tried to reduce the plastics in the entire packaging thing. Even for the e-commerce companies, one mobile phone will go from one place to another place, how much layer of packaging was happening. We have taken initiatives that without going to court, we have given them enough ammunition that, look, Pollution Control Board can be approached and you will have a problem. E-commerce companies have started doing. But the best part is, consumers have started demanding. What my brother is saying, consumers have started demanding that please don't package it in so many manners. I think in India, a very important churn is happening in urban centers like Delhi. Has anybody realized in Delhi that breathing has become much better in last 20 years? One of the reasons is a default action. So when odd event happened, two-wheelers were exempted. And we all kept on saying they are highly polluting 10 years back, but nobody listened because the new party which had come in power, they wanted for obvious reasons to exempt them because they are two-wheelers. Those are the people who get everything for free. And free culture is very important. So it was said, no, 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 we can't touch them. Polluted hai to kya hua? Now that whole sector of 30 to 60 lakhs actually, more than 60 lakhs, is slowly shifting to electric vehicles. Why? Not for the love of the planet alone. Because traveling from office to home due to increased traffic in a petrol scooter or a motorcycle was much more costlier for him. It was costing him 3,000 rupees per month, 3,000 to 4,000 rupees depending upon the distance in Delhi. Now what he did, he bought an electric scooter which has mushroomed in last 5 years only. It has reduced Delhi's pollution by 18%. Now that's the figure for you. So if you have a very dynamic chief minister again in Delhi, I'll say just say that no non-electric vehicle can be registered in the National Capital Region. If you really want to solve the problem, that monumental like Delhi, where the poorest of the poor is the biggest victim of the climate change. The pregnant woman which goes to the government hospital on bus or in auto rickshaw, she faces more problem and her unborn child faces more problem than me going in my air-conditioned car. And we are not making it an issue, one day we will have to make it an issue. So if we can convince that, the whole debate will drastically change. So, you know, your last final thoughts, will you think about Yamuna also a little bit? We don't have beaches, but can you help us? Yamuna? Yamuna.
Sir, I already started doing that, Yamuna River cleanup. And unfortunately, I want to say it on this dais that after 3 weeks, we were stopped by the authorities.
Leave it there. I know the reasons.
So definitely we want to get into, the idea is not the cleanup, I said.
So I'll just tell you one thing. I live in Noida. And thanks to successive government, they have made railings on the, and this is a very important aspect for all of us, railings on the Yamuna River when we come to Delhi. I can see people climbing the railings. So railings have become higher and higher with every passing government. They realize people dump the plastic, people dump all kind of stuff which we use in puja and other stuff. They climb, usko Qutub Minar pe bana denge, to bhi climb karke usme dalenge. And they all are fancy people. How do we only expect government or Chinu to clean up? What about us? When somebody, Dr. Bhasin said that so many cars, every family, we have all have become so accustomed. So my problem is different here. How do we tell, how did you convince volunteers, all these people to come and join? यहाँ तो हमारे ego पे लग जाएगी अगर हम बोलेंगे कि आप पेड़ को बचा लो, गंदगी मत करो, यमुना में प्लास्टिक मत डालो, कोई नहीं सुनता है।
सर इसका ना सबसे पहला जो क्रेडिट जाता है, it is to Swachh Bharat Abhiyan obviously, because that has helped people to come out of the society from their comfort zone to do the cleanups. Because when they see their leaders are cleaning the floors, they definitely want to come down. Secondly, we need strict rules. COVID had strict rules. Without mask, directly fine were imposed then and there. Why not now? The littering, the marshals should be there. Try do it in the other country. Go out and try littering in Dubai itself. How many dirhams का fine आज लगेगा आपको, आप देख सकते हो.
बिल्कुल सही बात है.
That marshals and that strict laws are needed on ground to stop people. Because nowadays India में सब चलता है तो चलने के चक्कर में बेचारे environment की बैंड बजे जा रही है.
हाँ तो public को भी अपने को बदलना पड़ेगा, अपनी बात बोली. Yes, Ashish. Final thought.
So completely agree that we have to be more responsible in terms of our action and like you rightly pointed out and he pointed out. So I would also just want to add one more point that yes, state governments also have a very important role to play over here. Individuals, of course, do have. So case in point, I was reading recently, 4-5 days back, Bangalore is known to produce the most e-waste out of any city in India because it's the silicon capital and everything. So the government is coming up with a buyback policy wherein they'll buy it from the corporates, whatever e-waste they are generating. So state government's role is important, but yes, definitely an individual's role is also very important. Small actions that we do, like for example, now I have personally stopped saying no to a server giving me a plastic bottle. I tell him to give me water in a glass. If I'm in office, if I'm in a restaurant, anywhere, I always ask for a glass of water rather than a plastic bottle of water. So yes, small changes I believe will go long way.
Yep. Sir, Norway is going to have only non-fossil fuel vehicles from next year. They had a deadline, self-deadline they have made. They have almost reached to that level. First country in the world to have no fossil fuel vehicles. What is the situation of EV you feel? Because you are from energy sector. And will we be able to create sustainable batteries and the boom which is happening, or will have handicaps or roadblocks like United States is facing?
EV, I believe that's a great thing to happen. And as you rightly mentioned, Norway and Finland, for that matter also, they are pioneers in terms of using fuel cells and the electric vehicles. So, but when it comes to an Indian context, I would say that EV will be successful provided we have all the infrastructure available in the country. So I'm sure that there is a lot of momentum happening in terms of providing the charging stations, because IOCL or HPSCL, they all have come up with charging stations every nook and corner of the country. So all these infrastructure improvements will definitely catalyze the conversion to EV. And not only that, if you read the article, news a couple of days before, some of the major the automobile manufacturers, they have slashed the prices for the EV vehicles.
Yes.
Okay, so like Tata is, taking a lead in that, and followed by other companies in the country.
Yep.
So if that happens, of course, there will be much momentum, and also the incentives from the government. So that also is helping to gain a lot of things. But at the moment, this is more of a case for the urban sector. When it comes to the rural India, there is still a long way to go. And also to add on one point which Dr. Chinnu was mentioning on the impact of CSR and all on the social change. So I wanted to share one experience from my side. So because CSR fund is a corporate requirement, it's a requirement as per the MCA law and the Company Act. So 2% of the fund has to be earmarked for the corporate social responsibility. But I've seen in my personal experience also, like majority of this fund is not being utilized properly. And at the end of the year, what happens is that this fund will go to some of the common funds like the PM National Disaster Relief Fund. So a major chunk of this is going to that. The reason being, we are not finding trustworthy NGOs to collaborate or to partner with to ensure that this is actually making a real social impact.
I agree.
So
Point.
I think corporate plays a big role in
Absolutely.
this.
So we are absolutely out of time, and I just want to say the last part on the charging. Again, the private sector enterprise is going to create a unimaginably beautiful situation. Blue Smart, we think that they are doing electric vehicle. They are basically creating a charging infrastructure, which will become their main business one day. We have here one more person, very important, fintech sector, where people used to go to banks and wait for hours. He started the whole escrow thing, which is very important. Ashwini is here, and he started that fintech company where you don't have to really go and stand in line and spend so much of fuel. So all these new age companies are making a big difference. Thanks a lot for this wonderful discussion. I hope all of you enjoyed. Bye.
Thank you very much.
I will request Kamal to please come up on stage and present our esteemed speakers with mementos. Thank you for sharing your thoughts so candidly with the audience. I request you to please present a memento to Dr. Abhilash Raghavan, Director ESG Sustainability and Safety, HSCI. A memento for Mr. Ashish Elawat of Microlabs. A memento for Dr. Chini Quatra, social influencer and founder, Khushia Foundation. And a memento for Dr. Sudhir Mishra, founder and managing partner, Trust Legal and Door Tenant, United Kingdom. We just heard on stage how collaborations and partnerships can be struck, and perhaps this is a good platform for you to find the next connection, to find the solution for the problem that is niggling your business. But ESG will be soon. It is already mandatory. The compliance is mandatory for listed companies, and the enforcement is going to become stricter by the day in the years to come. So our next speaker is going to talk about ESG strategy for business success. Let me introduce Mr. Angelo George, Chief Executive Officer of Fertility International. With a career spanning over 3 decades, Angelo has held leadership positions in prominent organizations in FMCG, consumer durable, and pharmaceutical sectors, including Hindustan Unilever, EIT Parry, Dabur India, and Emami. Please put your hands together and welcome on stage Mr. Angelo George, Chief Executive Officer, Fertility International.
Thank you. Good afternoon. Thanks, IHW Council, for giving me this opportunity to speak to such an eminent audience. And Mr. Kamal Narayan, thank you so much. I represent Bisleri, one of the largest water manufacturers or the largest water company in India. Our journey started about 55 years ago, serving consumers in all parts of the country. And since last year, we are also in UAE. Now, when we look at sustainability, we have 2 challenges as a business. Water, which is our product, and a packaging, whichever packaging we choose. And before I go further, and you will be a little skeptical about what is the water company in plastic bottle talking about sustainability, let me give you a reassurance that we were one of the first companies in India to become plastic neutral and water positive. That we recycle more plastic than we put into the market, and we replenish more water than what is taken out of the ground. And as we speak, these numbers are getting better. In the current year, at the end of 5 months, our plastic recycling has reached 110% of what we have put in 5 months. And in terms of water efficiencies, We have now, just for 5 months, just to give you a number which we'll all understand, we have saved water to an extent of 30 million cases of Bisleri at the end of 5 months. That's the efficiency level. We have improved considering 21-22 as our base year. Now, there must be a consumer reason why you see plastic bottles all around the country. And most of us may not be aware, but this is the NSSO data, that only 47% of urban households in India actually have a pipe coming to their house. And almost 50% of the districts in the country have contaminated groundwater. Those are consumer reasons for pure and safe water to be provided to consumers for health. And we are unbiased on packaging materials. As long as it meets the 5 criteria that we have listed, which is about safety, functionality, and above all in a country like India, the solution also needs to be affordable and scalable. A lot of people come to me with bamboo bottles. Now, where am I going to get bamboo bottles for packing Bisleri to an extent? What will happen to the microfilm contamination which will happen subsequent usage? Because it needs to be reused. So it needs to be scalable, and end of the day, it needs to have a lesser carbon footprint. Now let me take a minute about plastic. Plastic as a material is familiar to us for about last 150 years. Are all plastics same? Like we can say all metals are similar? Iron, aluminum, and gold, are they similar? Not really. So is the case with plastic. There are some types of plastic which are eminently recyclable and some which are not. So I'm not saying a good and bad plastic, but the better plastic and the not so good plastic. Now, we use only 100% recyclable materials, and around the world, PET as a plastic. I'm taking a minute on PET because that's a plastic we use. You can see it's one of the simplest formula. It doesn't contain any kind of heavy metals. And in India, we have done extensive studies over 2 years to understand whether if you keep water bottles in your car in the sun, does it create leaching of chemicals? Conclusively proven no. There was a doubt that it will cause endocrine disruptions. No. And these are studies done as late as 2017 to 19 and 2022 to 23 by CFTRI Mysore and NSCL lab in Pune. And no wonder it's possibly one of the most accepted packaging material for food and beverages around the world, and that is what we use. What are the other options available to us? And what we must be aware is the final carbon footprint of a material. A lot of people talk about recyclability of glass and aluminum. Just to give you some numbers, United States of America produces 32 million tons of glass every year. You know how much of it gets recycled? Roughly 30%. And what's going to happen to the balance? Going to wait for millions of years under the landfill. And just look at those numbers at the end. The global warming potential. Are the other options better or worse? And these are studies done and submitted on February 4th, 2023, very recent. So we are unbiased. We will choose what is the most affordable and what is the most environment-friendly packaging material. However, I think India also has a plastic problem. 3.5 million tons of plastic accumulating all around the place. The previous speakers were talking about it. In fact, I have my own personal story on this. In fact, my education to circularity happened about 10 years back. We were on a trip back from Nainital, opened a packet of Lays, ate it, rolled down the window and threw it out. My younger son, must have been about 8 or 10, was sitting in the front seat. He told the driver, stop the car. He went out of the car and just stood like this and said, Papa, please go and pick it up. I said, come on, listen, kachra is better outside the car or better inside? He said, no, we have come to a nice place. You have no business to pollute it. I'm not getting into the car. Then it just hit me that I'm supposed to be educating him, and he was teaching me a big story in life. When shamelessly picked up the lace packet, took it all the way back to Delhi. I used to live in Delhi those days, and put it in the kitchen bin. So it's about intentional littering to a great extent. We need to modify our behavior. Plastic per se as a material, is it bad? No. Is our behavior that can be modified? Yes. And can some of those materials be converted into useful products? The Bisleri uniforms are made out of PET. 42 PET bottles go to make a uniform shirt, a full sleeve shirt. It's a 60-40, 60 PET, 40 viscose. And if you add value to what you recycle, obviously there's going to be takers. Repurpose the plastic. It's a good product. You need to handle it sensitively, moderate the consumption, obviously. And you can see that's made by one of our friends from Coimbatore, Karur in Tamil Nadu, who's presenting to our Prime Minister the jacket. So we at Bisleri, involved with both water and plastic, have put together a program a few years ago, and that is called Bisleri Greener Promise, addressing both plastic and water. Because we believe the starting point is really about educate the consumers that plastic is good. You need to modify your behavior. But is just education good enough? Just one campaign good enough? No. I think you also need to provide enabling mechanisms to take it, the used plastic directly to the recycling centers without getting it muddied in landfill. And that's the ecosystem we have created under a program called Bottles for Change. And you can see that our footprint now expands to almost 24 municipal corporations. You can see the logos there, where we engage with housing societies, educational institutions, corporates, and hotels and restaurants, where we tell them, please don't throw the plastic, use plastic in the kachra, clean it, segregate it, inform us. We will send either our own vehicle or our agent to come and pick it up. It will go directly into recycling, and we'll give you an account of what has happened. So there's an app called Bottles for Change, which you can download, inform, and if it's a town which is enrolled, our agent will get in touch with you to pick it up. You can see some of the work we have done. That's Punjab University, who have taken a pledge that zero plastic to landfill. We are putting a material a sorting center out there. And Punjab University, you can see their campus, we want to ensure it is not plastic free, plastic waste free, and zero plastic to landfill. And that's a collaboration with Tiruvallur Municipal Corporation, which is part of Chennai, where the MRF center is actually run by Bisleri. And we have 2 centers today in Tiruvallur. And somebody was speaking about Goa. We have just signed an agreement with the Goa Chief Minister just about 8 days ago for setting up an MRF center in Vela, Goa. And somebody was remarking about North Goa being a problem. Bang in the middle of that, we would have an MRF center to sort plastic, so it will go to the appropriate recycling centers. We also were wondering how can we make it larger, to engage the larger community. And this is what happened in Coimbatore in, I think it's in January this year, where we set the Guinness World Record for the collection of, world record for the maximum number of plastic bottles collected in 12 hours. PSG College of Arts and students, the staff, the teachers, and the entire community around that place, we were able to galvanize to create something like this. And we thought we should actually keep signaling to consumers what are the possibilities of recycling plastic. You can see these fabulous benches we have created out of used plastic. And those paintings you find on the back are paintings by artists who don't have hands and paint with their foot and mouth. It's also a recognition of their creative output, and we have put it in almost all the prominent places that you can think of. Soon it'll be all over the place, reminding people, don't throw away plastic carelessly. It can be repurposed. And that's a simple message that we want to send. We are also actively involved in building an understanding of the plastic ecosystem. This is partnering with Observer Research Foundation in the Resina Dialogues 2023 and 24. We're actively there. Talking about, and that's a book which we have released about plastic circularity in this country. And like my son taught me, that was a big lesson. I said, if we have to change behavior, you have to catch them young. This is the book which we have created with Center for Environment Education, Mr. Karthikeya Sarabhai and team. And this book, what I'm holding in my hand, is something which we intend to be used in schools. Illustrated well, because it's a difficult subject, so students must find it interesting to read. It's on our website. We are also converting this into 9 languages immediately as we speak, and also trying to make each section into a 15 to 20 minute video equivalent with a voiceover so that the teacher can teach the sessions. And as per the Honorable Prime Minister's new educational policy, we have 120 hours of environmental education in 10th standard, where we hope this will be something which Bisleri will dedicate to the nation along with CEE. This is something, can I have the audio at the back end? This is something which we did in Coorg, in Karnataka.
Today we have collected 20 bags of plastics and we are sending it for...
Hi, myself Chandan. So right now I am standing in the heart of the Coorg. 33% of the land here is covered with a forest. That means we have 135,000 hectares of forest land in Coorg.
We are here for one single reason, to remove plastic from this forest area.
Bisleri and the Bottle for Change have taken the responsibility to work with the local volunteers.
Many stakeholders from Gram Panchayat, from schools, from colleges, as well as from the forest department, we are collecting plastic waste from the forest.
And we have plans to take this the forest conservation and the cleanup program to the larger level, to the district level, because this is our homeland. So we are all participating to clean up the Coorg and make it free from plastics.
Our responsibility is not to pollute this serene environment in Coorg. Let us be a responsible citizen.
Our forest, our responsibility.
Namma aranya, namma jawabdari.
Now going across to water, I spoke about our water efficiencies, and we have water harvesting facilities at every facility of Bisleri, and we have about close to 150 of them across the country. And the surface runoff water is captured. That's our a small pond in our Bangalore factory in south. We also ensure that the water is in the locality or in the vicinity, the watershed as we call it. We replenish the ponds and other water bodies to ensure the water percolation happens and the groundwater balance is restored. On the left side, you can see the check dams we have created, more than 250 of them, ensuring in the rural, the farmers improve their livelihoods with water availability through the entire year and maybe get 3 crops. That's work done in a college in South in Chennai. And the right side, you have a work we did setting up a lake in Nubra Valley at an altitude of 11,500 feet in Ladakh. That's last year. And 3 days ago, we inaugurated even the next one. Now, when we look at the country, I'm sure we can see that water is a problem. You have almost 55% of the area where you have a groundwater issue. And in the last 70 years, we have pulled out more that the per capita availability has come down by 25%. The Honorable Prime Minister launched a program, Mission LIFE last year, which is about rewarding environmental friendly actions by individuals, corporates, or collectives along these 7 areas where any action will be rewarded, and that reward could be traded on a platform like carbon credits. We thought it's a brilliant idea, and you can see what can happen on water. But there is one challenge that we have when we are talking about water as compared to carbon credits. Water is quite local as compared to carbon, which is universal. So any measurement or reward needs to be in the context of whether I'm saving water in Kerala or I'm saving water in Rajasthan. They need to be valued differently. And if I am actually setting up an industry in a water scarce place, there needs to be a scarcity factor which needs to be applied. Scarcity deprivation potential to be specific. Or if I am polluting post my production, then there is a pollution potential which I need to apply negatively. Equally, as an organization or as a farmer, if I am going to save water, I need to be rewarded. And that's the premise which we have understood from this entire thought. So we thought as an organization, how do we take this forward as one of the largest water companies? So we partnered with Terry to create something called water credits. And we said we should do some intense work on this. First of all, review national and international policies on water credits, water trading, and the financial instruments that support water conservation. Figure out what I spoke about: pollution, scarcity, and conservation. Everything should be adjusted in something we call as impact adjustment. And we said we should try and experiment in 2 of our factories, one in a water scarce region and one in a water rich region, look at the values, and develop a toolkit which we can then dedicate to the industry and say, you put your values here, your water footprint will emerge. 2 plants we took, one in Sahibabad in Delhi. The only water body is the Ghazipur Nala, transporting the filth water of the drain water of Delhi. And the next one in Kamshed near Lonavala, where we have a lot of water, lakes and water bodies and rivers. One debate we had was, shouldn't we, when we talk about as a corporate, be accountable for what happens within our compound? How efficient are we? Just to give you a number, it takes me about 1.08 liters of water to create 1 bottle of Bisleri. But the moment I start looking at my business, right from maybe the PET which comes from Jammu to the transportation water footprint which I'll incur taking it to the market, I need to look at my business as a whole. And we said, as an enterprise, if you are a responsible enterprise, you have to be responsible for the entire value chain. And that's exactly what we did. We said we should take the water footprint covering everything, every aspect of our business. And don't worry about that. That's how complex the calculation was. Well thought through, debated. Obviously, the top academics familiar in the field were working with us, who had created more than 115 papers on water-related areas. Just to give you a snapshot of what we arrived, you can see that this is the Sahibabad factory Bisleri production footprint. You can see out of 1.21 lakh cubic meter water that we processed in Sahibabad, we have actually harvested about 1.07, almost 84% or 89% we covered through water harvesting methods. But what is hitting us, that is related to ingredients and packaging and energy related and transport related. So which was a wake-up call for a business like us, that 91% of our water footprint actually lies outside the fence of the business. But are you accountable? Absolutely yes. And just to give you summary numbers, then when we put numbers together, we understood to make 1 liter of Bisleri in Kamshed, I require about 10 liters of water. But to make the same 1 liter of Bisleri in Saibabad, I need about 14 liters of water. Now, so if I'm able to save out of 10 in Kamshed, I should get rewarded. And if I save out of 14, I should get rewarded in Saibabad. And if I were to make a carbonated beverage, then what happens? It takes 56 liters of water to produce 1 liter of a beverage. And you can see that finally, why it's happening? Because you're covering all aspects of water consumption. So we have dedicated this to the government, and this report is now being published and shared with all policymakers, and we would like to take this discussion further. There are many aspects which need to be taken forward, including defining the monetary value. And for people like us, maybe a water sustainability mark on the label will be a great value. Consumers would love brands which are going to be accountable for water. And it's a social aspect related to water. Enforcement has to be critical. And finally, 85% of the consumption of groundwater happens on agriculture. We need to create water-prudent crops and efficient irrigation. Just before I close, we're a marketing company. I captured whatever we do in a short 1-minute video. Thank you. Let's play the video.
चलो घर से मिले। तू एक बूंद दिल जिंदगी है, तू खुश सी मुस्कान है, हर जगह है तू डगमग पंख है, ऊंची उड़ान है तू, सारा जहां है तू, जा मंजिल के परे वो पागल बुलबुले, चल बचपन के तले वही तेरा घर मिले।
Thank you so much for the opportunity. This is our water credits book. We have it again available on both our website and Terry website. So you could go through that. Again, it's not just a scientific report. We have tried to make it interesting. We are finally a marketing company. Thank you so much for this opportunity once again.
I would request Kamal to please come up on stage and present Mr. Angelo with a memento. It is enlightening to know what Fertility is doing when it comes to recycling of plastic. It's really the need of the hour, and the efforts are very commendable. We will now move on to a very important topic which somewhat gets ignored when we talk of sustainability, and this is green finance and carbon trading. I want to introduce our next speaker, Dr. Sitaram, former CEO, Doha Bank. He is a prominent personality in the banking industry throughout the Middle East and an economic expert. He has transformed Doha Bank into one of the best performing banks in the Middle East. Please put your hands together and welcome on stage Dr. Sitaram.
Distinguished guests, dear friends, ladies and gentlemen. I should compliment the organizers, Integrated Health and Wellbeing Council, for an extraordinary efforts bringing together content providers who have been dominating since morning. It's very well tailored. The centerpiece of the whole framework is to recognize, as Anchor Anisha has mentioned, how do we get sustainable financing for all this? We recognize we're in a defining phase of the world. This is a changing phase of the world, changing phase of globalization, changing phase of deregulation, changing phase of technology, changing phase of consumerism. Pillars which are redefining the space started with Millennium Development Goal in the year 2000, and we redefined it in 2015 as Sustainable Development Goals. An extraordinary set of initiatives have been taken, and centerpiece of the whole thing is 4 pillars. One is human-centric values. How do we interconnect elimination of extreme poverty, gender equality, zero hunger, again, ensuring income inequality is reduced, making sure sustainable living comes in. Global warming and climate change in weather patterns is reflecting the entire health curve's fraternity and livelihood of this planet. So what we need to articulate is to not only recognize human development, we have to recognize the social goodness, social development, which is akin to the financing. And also we need to understand the dynamics ends not there. Environmental factors, how do we finance environment? The last but not the least is economics. Economic front, how do we make sure all these projects which we talked about from today morning, how do we ensure we get the financial backup comes in? How do we create a public-private partnership model? How do we ensure the seed capital comes in? How do we ensure we have debt which is commercially viable again? There are unique prospects for making it commercially viable. I have experience as a banker in the region for nearly 40 years plus. I have financed for green projects. Essentially, I thought I should share the case studies, and Anisha asked me to be in the dais. She wants to shoot some questions on this in specifics to SMEs. How do we finance the SMEs who are engaged in circular economies or even green financing? I'll answer for those questions as well. So let's understand the dynamics of the financing prospects. So if you want to comprehend major projects in terms of healthcare, Dr. Alfredson is here. He has gone through an extraordinary set of career, whether it's COVID or even from the WHO angle, how the global sustenance in terms of finance comes in. If there is a universal framework defined, we are evolving. We are evolving in terms of financing as well. The green financing started with green banking system because credit creation makes the logics more faster in terms of execution. So economic prosperity is contingent on banking financial stability rather. And that's what exactly I was trying to experiment, having come from a village background 43 years before, qualified as a chartered accountant from Tanjore, Tamil Nadu, where lush green was what I've seen. I thought when I landed in the Gulf, I saw maximum per capita carbon emission is a desert land. So being a banker, qualified to do the job, I said, how do we create green banking? Whether investments or lending, how do we ensure a portion of the risk-weighted capital can be allocated? This portion can be channelized for water management, waste management, biofuel, biomass, recycling opportunities, circular framework. How do we ensure? Some of the pundits have spoken about enormous terms. How do we create clean energy? How do we finance for renewables, solar or wind or is possible? This is arid zone. I have experimented because 365 days sunshine. So I started telling my board of directors when I was running a bank 24 years before in Oman, and again, last 22 years I was running a bank called Doha Bank in Qatar. We have branches all over, including India, right from Australia to Wall Street. Essentially, a portion of the risk-weighted capital has to be allocated as a governance. Unless you set in a risk-weighted capital is allocated, you are not going to experiment. You are not going to allocate. This is not a charity per se, mind you. These are commercially viable projects. I have proven. They raised their eyebrows when I started saying in Oman, when I was running a bank called Bank of Oman, Bahrain and Kuwait. And they said, listen, you have no business to use the shareholders' money and put it into
charity. I said, no, it's not philanthropy. It's a good, viable commercial model, solar. It's viable in this region, I was trying to articulate. So what we need is to set in the framework. A universal framework is to be converged into national framework. The policy framework has to come into corporate social responsibility mission in addition to commercial viability. That's the bottom line. So you have to evolve a policy framework, whether it is lending or investments. How do we do it? What sort of reorganization is required for commercial viability? What sort of risk alignment has to come in? You have to put your risk framework, enterprise risk integration is a key when you use the public finance, isn't it? Nobody gives the money free. You have to use it. So you have to work in tandem with the regulators, whether it is a government or central bank. You have to align yourself. Framework has to be evolved in terms of policies. That's precisely is happening world over now. Everyone is committed for conference of the parties, net zero emissions. Some countries are 2030, countries like UAE. Dubai has agreed a substantial portion. UAE is committed for 435 billion lending between now to 2030. So green lending is not an option. Green lending principles have been evolved by regulators. Let's understand this dynamics. So banks have to support this mission for a commercial viable projects. It is possible. So draw the policy framework and ensure you have lending in place. I think India as well has defined the green lending principles. Now what we need to articulate is how do we make sure it percolates down the line, irrespective of the public finance, if it is a public-private partnership. The seed capital, a portion of the seed capital can come from the government side or the mission or agencies which are prescribed for this purpose, who have defined the policy framework. And again, the debt has to come in. The debt has to come from the commercial banks. The development banks are in the middle. They have a national development policy and they articulate solution for carbon reduction. So when it comes to lending, what we did in this part of the world, in fact, this model has been transported across. Wherever I was practicing as a banker, I was trying to do it. So we started working with the development banks. For example, Doha, Qatar Development Bank was a principle-centered bank where developmental activities for economic momentum as a strategic drive, the local banks started associating with, and a portion of the risk-weighted capital came from the development bank. The individual investors who were engaged in the business model, whether big or small, had a partnership, joint venture. The debt portion, seed capital, you have allocated. Now, a portion has come. If it's a viable project, risk management will always be done. It's not again, nobody's going to give money, free money. So when it comes to viability, we do the evaluations, seed capital is sought, done. So when it comes to debt, how do we do it? A partial guarantee comes from the development bank to the commercial banks, banks like us. We work with the developmental banks and we made sure a partial guarantee comes in. Then the incentives. In fact, Anisha asked me the question, perhaps she will be much aggressive in asking me this question further. So the viability will come in for small and medium-sized entrepreneurs, or even the gestation period of long gestation period projects like water management. I financed $562 million, 2.3 billion Qatari riyal for water security. On my own, I could not have financed. So I need incentives. I need moratorium to be given. The regulators have to understand they cannot put the framework in line with commercial lending. These are long-term mission, evolving to be a fine combination for long-term prosperity. The centerpiece of the whole framework is a national mission. So every country has to design this and customize the solution in incentives or subsidies, interest rate, or even concessional advantage in terms of moratorium. We have to define the framework. That is evolving. It has happened, and I financed successfully. Even when there were water shortages, even there were political blockade, we were having our own water sustenance. So reinforcing sustainability is very important, and commercial lending is possible by risk participation from the commercial banks, as long as support comes from the development banks or the central banks, or a combination of both. It is possible. If you start doing this, whether big or small, doesn't matter. You have to be flexible in terms of aligning the policy framework, and the corporate strategies have to evolve. Individual institutions who are engaged in these models, whether water management or waste management or recycling plant or even solar or wind industries, they can make it commercially viable by working with various commercial banks as well as investors around the world. There are ESG funds around the world. There are ETF funds around the world. There are also mutual funds around the world which are engaged. Now, today's concept, if you look at it, everyone is committed for a compliance architecture. Everyone is breaching the code. The universal framework which was set in 1992 as a United Nations for climate change has not been fulfilled. Then we have series of conferences of the parties. The last one was, I was engaged in COP18 in 2012 in Doha. Climate Gateway, we put in the framework, most of the compliance were fulfilled. Then COP21 in 2015, India is committed for 175 gigawatt. We almost completed the task. We have only shot by 13%. Today, if you look at the carbon emission around the world, it's not a joke. 26% of the global carbon emission from China. 12% come from the United States. 10% come from Europe. 6% come from India. India has committed for 2070 net zero emission. Every country has 2030, 2040, 2050, 2060, 2070. A planet, Earth has to evolve its endurance for future generations. That's sustainability, right? So global cooperation has to come. It's a transcendent borders. We have one family, one united world, and we have to necessarily understand this climate change is not a single country's problem. This is a united mission to bring in the sustainability, global sustainability in terms of global solutions. So that is evolving to be a fine combination. If that is the case, take for example India. Now, we have fulfilled 175 gigawatts. Now we have, as we speak this year alone, we have got commitment nearly 35 gigawatts. 30 gigawatt has come from the water, and again, solar, 30, and 5 has come from the wind. We have 486 billion funding has been committed, nearly 500 gigawatts. Imagine, 500 gigawatts of, this is a green revolution for India, and there's a commitment coming. You can ask me, who is going to fund it? Funding is coming from global chain. They have to do it. Today, market capitalization of any individual institution is not without a social responsible accounting. You cannot be listed unless you are a good human being. You cannot create a good corporate. Unless you are a good corporate, you cannot, group of good corporate can create a good nation. A group of nations alone can create a good society, United Nations. So it's not a joke. It's not a joke. We understand that rising sea level, increasing temperature, animal extinction, carbon emission, the livelihood has been challenged. The climate change is going to play a havoc. Predictable weather condition is not there. So how are you going to have sustenance in terms of production as well as consumption? So it's not economics anymore. It is economics. Economics, convergence of ecology and economics has to come together. Unless the convergence taking place, you're not going to have economic indication. India is a telling story today. There are enough reasons to believe the transformative government is there. You have 110 billion smart cities are coming, 125 airports are coming. There are 2 billion mobile phones, 1.5 billion internet, and you have reason to believe India is transforming towards every form and substance of global growth is contingent on India's economic engine as well. We are doing very well in terms of policy framework. We are transformative in terms of substance. India has fulfilled its promise. Dr. Harshvardhan is here. And he knows how the vaccine diplomacy has played a role. Today we are really a global power. 43 years before, when I took the passport, people were looking me down. Today, India has transcended borders. Our culture, our cinema, our food, our literature has transcended. India is going to be the Vishwaguru. There is no question about it. This century belongs to India. Nobody can take it away. The demographic dynamics are well set in, the ground rules are set in. But what is going to block our way forward is the energy transition. So the ground rules are clear. Now we have to look at all of us together in this game, have to recognize the importance is not economics, economics, as I said. If we converge and make a mission commitment, definitely we can transit from fossil fuel to renewables. With this, we are also moving forward in terms of recognition of the fact we have trading mechanism evolving. Anisha asked me a question. How does carbon trading comes in? Yeah. Yes, Anisha.
Saying that, financing is possible and India is going to be Vishwaguru. We have no doubt India will be Vishwaguru. But when we say come halfway, the global north is not coming anywhere close to even halfway. You're saying finance will come. Where is the finance coming? The global south is asking for the green financing. It is not coming in. You're saying the development banks will do it. When? When will this happen? See, renewables is very sexy. In India also it's very sexy. You will get money if you want to put a large solar plant. But ask the small steel maker who is using dirty coal to fire his furnace. He can't afford, an arc reactor. He needs money. Who's going to give him money other than SIDBI?
Good question, Anisha. See, take for example UAE. COP28 was here. COP29 is going to be in Baku, Azerbaijan. You know the biggest partnership was between India and UAE in terms of renewables, in terms of soil conservation. We have commitment in bilateral terms, multilateral terms, it's evolving. Now, as I mentioned, COP21, what we committed, we fulfilled it. There was funding. There are clean technologies, the fintechs are evolving between India and the Gulf. It's evolving. Look at the free zones here. Indian companies are mushrooming here. Fintech is a fine combination, it's a fine partnership, and the funding is coming from local here. It's an investment partnership. We have to share the dividend. But if we have a mission to commit by 2030, as I said, over 500 gigawatts of electricity we have to generate through solar or wind, there is already 486 billion commitment has come. 486, if you look at a capital expenditure, the funding will come in multiple forms. And that's what I said. The international institutions, hedge fund holders, private equities, where they're going to put the fund. Because every country now has to transit and then achieve the net zero. It's a defining phase, and the funding is already coming from global value chain.
Hard to abate, sir. Hard to abate. Steel, cement, the dirty sectors, they have a huge carbon footprint. The small players there, who's going to fund them? Everybody wants to fund a solar or wind program.
Absolutely. So the big boys will always find a way because they have the credibility, they can go internationally, they can float their own debt papers, they will get the funding. Small and medium-sized entrepreneurs, this is where I think the SME chambers have to build a public-private partnership. Now, I've seen Maharashtra Chamber of Commerce has come in here 3 times, and Indian Prime Minister, when he visited all the Gulf states, even you take, for example, UAE, he has visited 7 times in the last 10 years. His focus was in the business. His focus was supporting the small and medium-sized entrepreneurs in India. And I know how each state is now evolving a partnership in the region. So the funding has to come. It is coming. Because I am a witness to it. When I was lending money, we were building the Gulf as a global gateway to get the base, get the tax advantage, tax holidays to start with, then the tax value advantage, and again, the infrastructure creation has been given with support, concessional interest is given, and they create a global gateway, and the funding is coming from multiple sources. I know 4 or 5 companies who have set in their footprints here, Indian companies, they got a funding from here, in the region. Some are from Qatar, 2 are from Qatar, 3 are from here. So it's evolving. Trust me, the additional framework we need to develop is you have to create the Commerce Minister, Piyush Goyal, when he came here, he was reassuring that SME's partnership between India and the UAE, they will set up a framework as a part of the Comprehensive Economic Partnership Agreement, CEPA, that the funding will be a joint venture. Investment partnership will be evolving. It's evolving, already evolving. So don't worry about small and medium-sized entrepreneurs. Let them come here. If they have difficulties, this region is flushed with funds. Right. Enormous amount of liquidity. Enormous, because look at oil price. Where there is a maximum per capita carbon emission, there is also enough liquidity. And building the partnership is very vital. I'm glad this council is setting the footprint here for the conference. And we have to leverage on it. So it's a win-win model we can create. funding will come in on the seed side, capital side, as well as the loan side. There are also banks which are setting their footprints in India. There are banks who are having operation in UAE. Indian banks are setting up here. The region itself, Indian banks are coming here. And similarly, the Gulf banks are coming to India. Now we have from Qatar, we have from two Emirati banks, we also have from Saudi Arabia. These banks can work in tandem to support the small and medium-sized entrepreneurs in bilateral terms and multilateral terms. Last question. Okay, very good. Thank you for your kind attention. I am very confident financing is possible. Green banking is evolving. Green finance banks are evolving as an independent enterprise. Green, mission, including carbon trading, carbon exchange. Anisha was asking about carbon exchange. There are two carbon exchange. One is already functional in Abu Dhabi. There another one where I'm the advisor. It is shaping up very well. So it's going to be in Dubai as well. So we have to reduce the carbon emission, more so for India. Let's not worry about the limitations what we have. We have opportunity now. The challenges are real. The opportunities are endless, I'm telling you. I'm cautiously optimistic, but I am glad we are building global partnership. The best is yet to come in terms of reducing the carbon emission, setting a footprint for universal healthcare, setting more so for Indian economics, and more prosperity will come in by focusing on healthcare in India, and support will come from multiple form and substance from various global partnership, and it will add value to our sustenance and sustainable value creation. Thank you, ladies and gentlemen.
I would request Mr. Sudhir Mishra, founder and managing partner, Trust Legal in Door Tenet, United Kingdom, to please come on stage and present a memento to Dr. Sitaram, former CEO, Doha Bank. We'll now move on to a panel discussion, and this is on sustainable economy in action, the pathways to enhancing business models. We've already had a presentation from Ms. Levy where they have shown how they are recycling their plastic and how it is making business sense for them. This session explores the transformative approach of designing systems that minimizes waste and makes the most of resources. This panel will focus on how industries can shift from a linear take, make, dispose model to a circular one where materials are reused, recycled, and regenerated. Experts will discuss strategies, challenges, and innovations that are crucial to creating a sustainable circular economy that benefits both the environment and the economy. The goal is to envision and implement practices that support long-term ecological balance and resource efficiency. Please welcome our esteemed speakers for this session. Please welcome on stage our moderator, Mr. Abhijit Sinha, National Program Director, Ease of Doing Business. Please welcome him on stage with a round of applause. He holds an additional charge as Project Director for National Highways for Electric Vehicles. Joining him on stage are our other speakers, Dr. Jacinta Da Silva, Research Director, SEE Research Center, Ms. Sarika Saluja, General Manager, World Toilet Organization, Mr. Mohammed Khalid Saeed Pasha, Asia Regional Coordinator, IUCN, International Union for Conservation of Nature. I'll hand it over to Mr. Abhijit Sinha.
Hi, hello Dubai. It's good to be here after COP28 last year. Before we enter into the critical panel discussion, the last one of the day. Formal announcement, if you have a mobile phone, please put it on flight mode, and if you have a pager, then do let me know where to hide. I thought giving a keynote, but in the interest of time, we will only keep it to key dots. One Earth, one family, one future. And the key dots are sustainability and circularity. With circularity, here we refer economy, and with sustainability, here we refer behavioral, lifestyle, and human impact. With us, we have very heavyweight speakers, and they do not need a context setting. Their work, their experience, and the right kind of audience that we have in the hall is with the true intent and capable content to create the right content. I believe that these 2 minutes, which I'm going to give to sustainability and circularity, are going to give you a challenging perspective of what we have discussed since the morning. Why is that so? Is because wish list for circular economy is in the balancing of the work cycle, and also to ensure every material and product, packaging and not usable devices to bring into an auditable, accountable supply chain management. Somewhere it generates, somewhere it originates, and then it becomes a garbage. Then it's become a load on the circular economy. As a context, it is very important for us to understand that it's a global challenge, and where 2 countries, India and Dubai, where we are speaking, has done wonderful work. Second and last is what do we expect and understand from sustainability. India is now entering into a phase where we have to choose between ESG compliances, which does not have a very transparent, accountable algorithm of calculating, assetizing, or processing data. But it has a narrative which essentially comes from European, American, British countries to make you understand that this is your ESG compliance. Mostly what I wish to say is it is still subjective. As of now, it has not become as objective. So how do we do it objective is one context which I wanted to give before we start this panel, is if we are manufacturing something, creating something, or building something, pushing it into the market, we have to take the equitable responsibility to look at the user chain of recycling of that particular material. CSR was a good attempt, but we need to go beyond ESG compliances to understand how we used to live 7,000 years before. And just to put an end why I choose this topic to place in front of you a very valuable and capable audience is because India has been doing it from last 7,000 years. Our religion gives us a very clear context of how to live with the nature. And this is why in G20, the world, including UAE, was in absolute agreement with the Prime Minister Modi and India's vision of sustainability and life mission, that how do you live is because of the ancient wisdom and cultural values that we bring. Ped, pahad, nadi, गाय, सूरज, सांप, हाथी, कुत्ता, चांद, बारिश. हम 7,000 सालों से इन सब की पूजा करते आए. And the first ESG compliance which you can find in the history which is written is in the Kautilya Earth Shastra, where the punishment and the prescription is you want to use tree, you will have to grow tree. You cannot cut existing forest. If you cut, the punishment is equivalent to if you hurt an animal. So with this, we start this imminent panel who will look into the possibility that what narrative India is going to subscribe, whether it is going to be absolute ESG compliance coming from West, or are we going to build something out of it? Over to you. With the lady, we wish to start a very fine line of introduction about the work you have been doing and the context which you wish to bring on the table for discussion.
Greetings, everyone. It's a pleasure to be here and listen to such a diverse experiences on this platform. I am Sarika and working with World Toilet Organization. It's a Singapore-based organization working in water sanitation and hygiene. We started our organization in 2001, and in 2013, in collaboration with Singapore government, we tabled the agenda Sustainable Sanitation for All at the UN General Assembly, which was unanimously adopted by 193 countries. And since then, our founding day became the UN World Toilet Day. We are working in the field of sustainability since our inception, and our intention is to collaborate with organizations across the globe to create a policy level change. So we are an ecosystem creators. We work closely with the governments, corporates to create an ecosystem for sustainable sanitation change. Thank you.
Thank you and welcome to the discussion. Our next speaker, very heavyweight speaker for us, for me to handle, and I'm sure that a lot of value is going to come from you.
Thank you so much, Mr. Sen, and thank you to the organizers for bringing us here. Well, I come from a sector which is very closely related to One Health, and this is from the perspective of nature. And as our esteemed guest in the morning, many of the eminent speakers, including our ex-health minister and the environment minister spoke, and Dr. Lalit Bhushan spoke about the triple planetary crisis which is happening now. And I would say that investing in nature is no more a charity, which people used to think. It is an imperative. And I come from an organization which is globally known, IUCN, which is International Union for Conservation of Nature and Natural Resources. And I work on leading and managing the natural resource management across Asia. The way the natural resources are getting depleted, today we are consuming 1.5 of the planet yearly. So we are consuming than what is being already available in our planet. The fast depleting species crisis, since 1970 we have lost 60% of the species on the earth. We are running with water scarcity, the excess. Coming to the health, what I would like to see and why I have come here is with one agenda, is to basically marry the environment with the health sector. And both, they go hand in hand. As I said, you cannot take out nature from One Health. One Health has been inclusive, and especially if we go back to our culture, which goes back to several thousands of years back within India, our own country, the One Health concept is not something new which has been brought to the table. It has just become a dialogue and an initiative now. But this is something which was very much embedded within our ethos and which was existing. So how can we make it more inclusive? How can we make it more equitable? That is the agenda I come here to speak with.
Wonderful. I think you have given a very good start for this conversation, taking sustainability beyond only nature to human, animal, and also plant health.
Thank you.
Amir.
I'm Dr. Mohammed. I am the academic director at C Institute. I'm filling in for my colleague, Dr. Jacinta, who's the research director, but this doesn't mean that I'm not worthy enough for listening. I'll give you a strong reason about C Institute, where I come from, is the knowledge arm of the sustainable city in Dubai. And that sustainable city is not just one, it's one of the 3 in United Arab Emirates. And something that we do is we defy the conventional education system. Though I represent the academic department, however, our theories, our education policies are derived from real life practices, the learnings that we have gathered through building sustainable communities. The C itself stands for SEE, which is the combination of social, environmental, and economical dimensions of sustainability. We are basically redefining sustainability and making it simplified. Just like how you have said, there are gaps in understanding ESG. It is subjective to sector. We, as an educational institute, a practical educational institute, simplify sustainability metric in each sector And I'm going to give you more details about it. Thank you.
I have first question from you only. Is you are also being an organization in UAE working on sustainability.
Yes.
Also involved into human capital, behavior, lifestyle, and how you're going to educate people about it. My question I find it very critical because it's a global emission, that there are two microeconomies. One microeconomy is the economy of manufacturer who creates something which ultimately becomes garbage. And there is a microeconomy of somebody who has to do recycling. Both of them, they have to do their own economics, right from funding to processing, certification, rule book and everything. And then again, you have to raise entire ecosystem for the recycling. The challenge for these two economies is to bringing them into one circular economy, larger economy, which is a circular economy, and making them accountable, making it assetizable, and making also an evidence-based policy making that what is the accountability that manufacturer is going to place towards the recycling. Right now, these two exist very, very far away from each other. Financing, funding, and everything is different. How do you look at it? In Dubai, it has been very, very successful. If you want to sell something in Dubai, which does not have a service station, it means if it's not working, you will not be able to get it repaired. It will ultimately sooner will become a garbage. Every company which is coming, operating, and it was a very typical target, it was a very typical challenge for any country or economy to control products which is coming from internet. Right now, everything is available on internet. How Dubai has managed to control that what is not giving a refurbished, recycled, reusable model should not enter its economy.
Me.
Yeah.
There is a statistic done by Nielsen which states that there is a corporate confusion in communicating the sustainability plan globally. And almost 75% of organizations struggle communicating their sustainability into sustainability metric system. And that is exactly if I ask a kid, can you take me to the parking lot? The kid might not know the directions towards the parking lot, but an adult might, because the adult knows how to read the directions. Sustainability on its own is a new topic which needs guidance in terms of understanding the metric system for each sector. We have interacted with multiple companies solving exactly the same problem, wherein we are connecting the people with the supply chain. So if you are ready to change as a sustainable company, you'll have to understand what are the sustainability metrics in your sector. And there was one request that we got recently, and I was in our climate talk series, which happened last week. There was one request from one banking industry. I don't want to name that company. And they said that, Doctor, we would like to explain or simplify the components of sustainability standards, basically ESG standards, but not through one-way teaching. So do you have an approach? And we had a talk with them. And through that talk, in 2 weeks, we have developed a board game. A board game with 100 cards, 34 cards for environment, 33 cards for social, 33 cards for governance, with 3 stages on a game showing the startup, the growth, the maturity, with different typical practical issues for which there is only one card as a solution.
Wonderful.
It's a growth journey. Now, when you go through such a journey which is engaging, in which the employees itself involved, there comes the next stage where you tell them to connect, to bring the suppliers onto it and connect an intranet system where they deliver. So always, whenever we train, we don't train it with, you always call us. We train it with the train-the-trainer approach. So we leave one person to pass on the message to their suppliers, to the supply chain whom they interact, and that is how we do it.
Wonderful. I will come back to you for future trends, how it's going to work. But let me take input from Mr. Pasha. Is how do you think this is the sustainability and health? They are very, very interlinked with each other. And it's not only human health and animal health, it's also including plant and the wildlife into it. It is going to change the world order after COVID. And the way world order has changed It is asking and demanding a high level preparedness for anything of that sort which can come again. The One Health mission, the One Earth and One Future, everything boils up to some very strict, stringent, and something which has never happened before to come as an evidence-based policy making so that we can at least have clarity and confidence that we are prepared for something like this coming up next. What is your wish list? How do you look at it?
Thank you. It's quite a big question and a nice one. First of all, as you mentioned about the One Health. One Health initiative now globally which has come around is one of the leading partners is called the Quadripartite Alliance, which is World Health Organization, FAO, World Animal Health Organization, and UNEP together. Now that alliance itself, which has been going around for the last 3 to 5 years, has been extremely successful in getting into the social aspect of the One Health. There are 6 tracks, and the track number 6 talks about especially environment sector. Now this is where on the other side of the fence we have not been able to make that connect. Most of the people sitting in this room, I am coming outside, we still are not able to connect, and somehow that connect has to happen to make that One Health inclusive. Because I will repeat that is still the whole circle of the diseases. And if you look at, you mentioned about COVID, 60% of the zoonosis is coming from natural areas. And these natural areas, when I talk about in our green spaces or the forest or the wildlife areas, these are the areas where animals, people, livestock, they come together. And this is something on a dialogue now. India has prepared a strategy on epidemic and tracing the epidemic, which is called Sentinel Surveillance Sites. Now, why can't we take these protected areas as sentinel sites and start doing the prevention right from there before it becomes an epidemic? So we have to, again, I would say that we have to really start looking at how do we really include nature? How do we really make that pathway into the wildlife and environment sector to come together with the nature, with the health sector and work very closely and hand in hand with that. So it is not going to be any more kind of a choice. It is something which we will have to make it and we will have to do it.
Very jointly need to prepare the response. Before we move to Lady, I wish to share with each one of you that recently Government of India has passed National One Health Mission, and it is focused on 4 parameters of pandemic preparedness, also integrated disease surveillance. In a lightning speed, if somewhere, someplace, any disease is detected which does not have a disease profile, it can be looked into it for a possible threat, and also strengthening routine prevention programs. Last but not at least is joint outbreak exercise, the preparedness that you need to prepare and keep it ready. In center of all this, human behavior is something very, very important. I think human behavior post-COVID, and as we stand on the last footstep of global warming, people's behavior has to change, and people's behavior in COVID have started changing. But how do you think, as now human control and their lifestyle is to be brought in the consensus, not only towards the hygiene, towards health, towards immunity, which used to be a prominent cause, somebody deciding the factor that they will survive the pandemic or not. If my immunity is low, I might get COVID and not be there tomorrow. But somebody's immunity which is high might get affected with COVID. So immunity has become the center sense. And this all revolves around the health, hygiene. How do you think the question of human behavior has changed, and where is it heading?
Thank you for this question. I think human behavior is always evolving. Our value systems and the education system plays a very critical role in defining our value systems. And if we need sustainability to be successful, we know that sustainable sanitation goals are ending in 2030, and we have not reached our set targets in any sector yet. We are still struggling. And we also know that the government in India in 2014 started with an agenda of building 111 million toilets. And they have done a very good job, but without a behavior change, it is not possible to make the program successful, because people's mindset is very much needed. Toilets can be built, but if they are not used and abundant after construction, the program would not be successful. Similarly, behavior change is applicable to all walks of life, because if people are not ready to adopt, change, accept, and build systems in place which can support the policies that government is bringing into place, the solutions that corporates are developing, and new innovations and technologies that are coming into place, they would not be adopted and successful if people would not have the mindset of change, accepting the change and living the change. So I think behavior change is very important in any field, be it water sanitation and hygiene or any other sustainable development like work that organizations are doing. Thank you.
Thank you. My last round of this conversation to get at least one of the very major, bold, maybe you can say something which you have not placed in front of public or on a forum, is what do you see as a future trend going ahead when we are talking about sustainability, and it is going to bring almost all microeconomies and sectors of our economy into a very strict audit of placement of their product in the ecosystem, and second, the power that they use and mobility that they use. Where do you see as a fact which is bringing as a trends for coming up? This question is from Irfan, and then I'll come back to you with your question.
Since I represent the education sector, a future trend in sustainability, what I see is gamification of learning. That's one part of it. And the new league of leaders who are coming in must be educated, must be understanding sustainability spectrum as a whole. Because if they are not clear with that vision, it would be very difficult to drive that initiative in the corporate. And for that purpose, I believe there are 3 levels of training maybe that goes through as a must in every corporate. A basic understanding, because the ultimate strength of a company is the man force. The entire man force can be divided into 3 categories: the basic level, the mid-level, the managers, and the C-suite. So the basic level must have an understanding of the basic sustainability metric. The middle levels need to know how to train or how to pass on the message in the most convenient and simplest manner between the top and bottom. And the final level of initiative that goes for C-levels are the strategic formulation that goes for long-term planning in 5 years, 10 years down the line. If that understanding is not there, we wouldn't have a future of sustainability, sorry to say.
It means lots of tough time is going to come for companies who are not looking at their carbon footprint, their logistic on which they are sending their product, and the way they are pushing their material in the market if they're not looking at the recyclable cycle of that. My question to you, Mr. Pasha, is where do you see India coming in the global health position, where One Health Mission as a leadership position, India has given this message very clearly in G20 that if you have to understand health and if you have to understand sustainability, there is no better country than India. Whether it's Vedic culture, whether it's ancient wisdom, or whether it's place where it has shown a very robust framework of vaccination to preparedness on a very surprise pandemic which we had. Even our rural economics, ASHA workers, the kind of resilience, the kinds of pivotal role they have given, India has taken the place of leadership into health. Where do you think it should place and it should play going ahead to prepare for such upcomings?
Going back, my reflections goes back to early before lunch and some of the speakers who spoke. Firstly, I think one of the important thing is, even in today's sustainability, where we talk about within IHWC, even council, which is here. I think so it's important and imperative, again, to include life on land and the life below water to be included as one of the goals. Maybe that is something that would be very good. I take the inspiration from our Honorable Minister, and I was constantly, when he was speaking, there was an image which was playing and which said, a tale of two drops. I look at India as a champion, and using that model of tale of two drops, possibly we have a story of saying a holistic cure in every step. And that is where I see that holistic cure as a One Health to be taken by India. And this could be the opportunity, as you said, India with championing with the health sector, with making those plans. This is the right time if India could come up, step up the leadership, and if we could host the One Health regional next year, because we have a next year, why I say, very close to this, where we are speaking today in Abu Dhabi, IUCN would be holding, which is the globally well-known conservation congress, which happens every 4 years, which would be happening in Abu Dhabi in October. If India can hold the regional conference of One Health before that and walks into Abu Dhabi with that roadmap, that would make us really shine up and show the model of India of One Health and bring the other, maybe neighboring countries as well as globally, as what the championing should be doing.
Very, very precisely and well said. I'm taking notes so that I can convey at least this message of yours to make every possible degree of participation. Over to you.
I think the coming time is for collaboration, the cross-sector collaboration. As much as we can have, we can show the impact at a global level. And as my friend was saying, that every sector needs to define their standards, set the benchmark, and come up with the matrix for sustainability. A lot of sectors right now, they don't have any such metrics defined. So what they can do is they can learn from others and develop on the similar line. So I see it as a collaborative platform. We can not only collaborate internally within the country, but also we can collaborate outside of the country with a lot of stakeholders. And AI and internet revolution has made it much easier these days to launch solutions in any given geography. Thank you.
I think with this, we wish to have at least a couple of 1 or 2 questions, but before somebody decided what could be the question, I have a closing note to be placed in the context of health and also in the context of climate, which are the 2 major pivotal pillars of this conference. And I also wish to congratulate IHW for their 10th anniversary. They have been doing wonderful work, not only a places of meeting, but also place of bringing related people, stakeholders together for a new era of policy making, which is an evidence-based policy making, which is driven by data, which is also speaking in the language where software is going to write a software in the age of AI and ML. This era requires a very, very strict and very tight auditing of every individual, every sector, which is in terms of personally, socially, lifestyle, and in terms of institution, how they are behaving on the terms of sustainability and on the terms of health. These 2 bringing together are going to give us the future that India has envisaged for. It is not only going to build an economy of $10 trillion in climate financing, but also going to build one of the bestest healthcare infrastructure in the world. Right from the groundwork to major initiatives of our Government of India, which I wish to bring in the conversation here, is National Highway Freeway, which has worked enormously on Delhi, Jaipur and Delhi, Agra. It is now expanding to 5,500 kilometers of e-highways in India, which will be the largest after Germany. Germany has around 109 kilometers. And the other initiative, which is bringing a very blended kind of support for both of the sector, which is speaking about air and your health, is climate financing. Climate financing also support any healthcare project, which as of now, if you go to rural area and if you want to develop ASHA workers, A&M, Anganwadi workers, it is very difficult to find interest of a company which is into tertiary care, because rural health is not their interest of area, and it is solely have been a responsibility of government from last 75 years. And in this next 25 years, which is the Amrit Kal, and last 25 years before our anniversary as 2047, India is also going to achieve a sustainable health tech action plan. Digital innovation and sustainable health tech for climate and healthcare action, Disha, is going to give a sustainable model that how you deploy resources and how you deploy sustainability by monetization of data, which is a very crucial subject to take it up. But with this note, I would like to have 1 or 2 questions, provided organizers gives time for this. Thank you for being wonderful audience and wonderful panelists contributing in this conversation. Any question, anybody? I think we are very, very well. Thank you. We are very well placed and good to have all of you here. I'm looking forward to have more conversation off the dais.
Thank you to our speakers. I would request Mr. Sudhir Mishra, founder and managing partner, Trust Legal and Door Tenant, to please come up on stage to present mementos to our speaker. We request you to please present memento to Mr. Abhijit Sinha, the National Program Director, Ease of Doing Business. A memento for Dr. Mohammed Irfan, Program Director and Senior Blockchain Advisor, SEE Institute. A memento for Sarika Saluja, General Manager, World Toilet Organization. And a memento for Mohammed Khalid Saeed Pasha, Asia Regional Coordinator, IUCN, International Union for Conservation of Nature. I request all of you to please gather for a group photograph. Thank you to all our speakers for sharing their thoughts with the audience today. Next, we have a keynote address from Mr. Amrish Chandra, Business Strategist and Global SDG Campaigner. Mr. Chandra is an edu advisor, philanthropist, and sustainable development advocate committed to advancing education through technology, creativity, and inclusivity. Please put your hands together and welcome on stage Mr. Amrish Chandra. He will be talking about using your abundance to propel SDGs.
Thank you very much, and a very good evening to all of you. It's indeed a matter of great pleasure to be here and to speak to a sustainable audience, so to say. And it's interesting how we progressed in society. And in the various occasions that I have been to speak,
from the House of Mosaic, which I represent. I've realized one very important thing, and that came to me when Mr. Kamal just came back and said to the chair that we were sitting that this is the green room. It's interesting that many years ago, the green room used to be where performers would sit and relax. And today, the green room is where the action is. So this is the green room. And a loud round of applause to all of you for being here, for coming, giving your time, and being here. And I would also like to take this opportunity before I really go on my journey and talk to you, to really compliment Dr. Harshvardhan here for having sitting and heard every speaker and every panel since the time this session began. I do not know if Sir had a coffee break or not, but thank you very much for your guidance as the Minister when you served the country, and today also leading the discussion here. Thank you very much, sir. To all those that represent the judiciary, Mr. Bhasin, and of course, my dear friend and brother, Mr. Sudhir Mishra, you don't just represent the bar, but as an early, young evangelist in sustainability, for me, you raise the bar for what you do in sustainability and your understanding. So a round of applause for you as well, for the judiciary. My conversations are broken into two parts. I would love to, at the end of the conversation, focus on IHW and what I see. But very briefly, I'm really impressed to have this opportunity to speak on this occasion. Privileged to know you, Mr. Kamal, and IHW. Honored to learn from this relationship of what you do in sustainability. What we basically talk about is, in our journey, is how do you propel the sustainable development goals through the abundance that each of us may have, through our organizations, through our educational institutions, through hospitals, through our enterprise. How do we propel that? I belong to a family of educationists. This is probably a 49th year. Our schools are known as St. Paul's, and our trust is known as St. Paul's Education Trust. But for many years, apart from looking after the schools, I've had the privilege to be across the world with advocacy in education, sports, and health. And since 2014, predominantly in the field of sustainability, but specifically in the Sustainable Development Goals. What we believe is very simple. It's not a complex subject. It may be green, and today everything we talk about, from green humor to green paper to green council, seems to be defining sustainability in different ways. But sustainability is defined in 17 different ways, with 17 different colors. So what we are suggesting, what I understand sustainability as, very simply, is a very simple story. And the simple story is, how could we use to whatever we have as abilities, as individuals, as institutions, to use that and use that abundance to do that. Now let's come to universities. Recently I was called to speak in a forum of the Times Group in Thailand, where we had the World University, it was the university ranking system. And we said, and I asked them, what is your abundance? The abundance of a university, for example, comes in its students. The abundance of a university comes in the campus that it has. And no university is in 20,000 square feet. They're in hundreds of acres, be it UK or America or our own country, India. So the question is, if you go down to these universities, the leading universities now, the top 50 universities, you would find that each of these universities have a course or a curriculum that is offered in some module of sustainability. You could become a chief sustainable impact officer. You could become a chief sustainable content officer. You could become a chief sustainable officer. But none of these universities, while they have put resources in making these programs, and they wonder why children do not take these courses up, none of these universities show a single expression of a goal in their entire campus, in their entire collaterals, in their entire brochures or one magazine. Not one university that I have visited in 27 years, but more aggressively since 2014 till date. And I'm a fellow of few leading Russell Group universities, not even them offer this. However, when you go back to India and you look at the model, and Sir would understand this, having been a former minister, that you'd find that each government school, and this is where I'm coming to the point, each government school will have loads of wall paintings talking about one scheme or the other. Beti Bachao, Beti Padhao. This eradication and that eradication. And yet the government wants, and I do not have a political agenda, I have a sustainable agenda. And yet we want that we should be the top achievers by 2030. I'm sorry to say that even a district magistrate of a district may not know the 17 goals and what they mean. So now when we are going across our districts and cities in India, I'm talking about India now as a model, the idea is we are not doing, while we have a model of a recall system of advertising or marketing, to orient people what they could get as an agri loan or an eradication vaccination or a scheme, we are not using them to make them sustainably conscious citizens. And neither are the universities across the world. In both scenarios, you have an abundance that we are not optimizing. So the thing is, how do we optimize our abundance and use this? You come to a hotel, you come to this hotel. It might be a LEED certificate hotel, but at any point of time in this hotel, have you seen an SDG goal that talks about or makes you conscious? You will not. You might still have reminders in toilets of the wash that the bathroom should go to, but it will not have a tag of SDGs. I wonder why any of our institutions do not carry or talk about or use our walls, our corridors, our toilets, our cars, our transportations, our drivers, our magazines, our newspapers on the top to talk about the SDGs, what they are, and orient them with the colors or the objectives or whatever they are. So as House of Mosaic, we took it on us that we will work only on level 0, as described by the United Nations, which is we will only create awareness. If you are not aware, you cannot be compliant. So we do not work on compliance. We do not suggest that. There are various agencies who do that. What we do is we work with institutions, with governments, with agencies, with initiative makers. So for example, if I have to pick up just an example here, I would pick a Bisleri. I would say, sir, can you carry a logo of an SDG on your bottle? Every time, maybe the first 10 Bisleri bottle openers will miss it. Maybe the 11th would see it. Maybe the 15th would see it and say, now what is this? We can do a trademark on that. We have forever known the advertisement campaigns of Amul. Why is not a single Amul ad made that we watched since the time of R.K. Lakshman that talks about one SDG goal and one color? We do not. We are very careful to wear the color of ties and the pocket square that we wear to match, but we still do not know what a green color would be, what a yellow color would be, or what a red color would be. It's very important. And at this just moment, I'll just take a quick 1-second break because Kamalji said you have to be the showstopper. I'm not, but I'll do something to stop the show. And just let me show you one photograph that the media team can show that. Dr. Anushka, if you can just put that picture on screen to show how basically just in a small town in Gorakhpur, we have used our campus in every which way that you can to show and display the SDG goals. Whether it be a water tank, whether it be a lawn tennis court that will tell you what green sports is, be it the corridors, be it the staff room, be it the table tennis room, the auditorium, the toilets, it'll each tell you which goal does it talk about. And therefore, in the city of Gorakhpur, we are going to open on this 28th of September, the first SDG-aware school of India, probably of the world. Probably of the world. And what is just taken is just a club of passionate evangelists in sustainability, teachers and students put together, that said, let's put this learning now on the ground. So it's not a big task for us to do this. But what it requires is an agenda. And that agenda can be defined by 17 goals. So now what we do is that in the House of Mosaic, while we do this, let me go a little further down. When you have an institution or a business house, you'll have events, you'll have collaterals, you'll have magazines. We created the first storybook, known as Salad, tossed in the flavors of sustainability. Short stories tossed in the flavors of sustainability. Our idea is a little big, but I promise you that we'll deliver it someday. The idea is to create 17 episodes, a mini-series on 17 goals of SDGs. And of course, then have some flick somewhere who wants to take it. But no movies that you see, even absolutely obvious movies on gender equality, will talk about the subject, but will not orient you about the goal that they hit. I would not want to ask this question, but if I did, I know the answer will be 0. If there's anybody here in this hall that runs an organization that does sustainability and carries a orientation program of the goals that you hit broadly displayed. But I was impressed when I entered the IHW Council. And I remember requesting Mr. Kamal to have a photograph there. And the sustainability R and the wheel in it is one example of how you can merge your initiative and the SDGs and bring out something as defining as the sustainability R. So thank you very much for taking that initiative. It's absolutely amazing. So this is what we do as a House of Mosaic, is where we just talk to people and we tell them the story of how you can do this. On this 20th of September, we've taken another big leap of faith and a leap in sustainability. And what we have done is that we have created a parallel program to the global goal wheels in United Nations. In the city of Gorakhpur, collected world leaders, green thinkers, philosophers, professors from universities to come to the city of Gorakhpur and celebrate with us a top agenda. And the agenda is propelling your abundance to talk about SDGs. And we celebrate that with an award system that first took place in the House of Lords. And I'm very lucky that we are the first recipient, and Mr. Sudhir Mishra here, known as the Guardians of Sustainability and the Angels of Sustainability. And in my last bit, we create councils like the Green Council, the first Green Council of Vice Chancellors across the world that talk about the agenda of propelling your abundance with the awareness of SDGs. We all talked about stories, and before I leave, I'd love to leave you with this little story which describes what IHW has done. And it's a promise on this note that the House of Mosaic will be a participant with you in the sustainability hour to wherever you want to take it. And the story goes that in 1984, in Phoenix, Arizona, there was a bear that came to street. The bear was wild, it had to be caught, and it was caught by the wildlife department there. When it was caught, it was decided by the mayor of Phoenix, of the city, that they would make a cage to keep the bear. But the cage had to be so big that even if the bear grew in 2 years' time, it would still be able to hold the bear. So in 2 years' time, they made a natural habitat. And after 2 years, the moment came, the cage was airlifted, brought to the park, the mayor was there, cameras, lids, picnic baskets, you name it, they were all there. The cage was open, the mayor pressed the button, the cage was open, but the bear did not walk out. The morning went to the afternoon went to the evening. The mayor packed his bag, breakfast, the picnic baskets were folded up, sandwiches had finished, media people went back, and they waited for the bear to walk, but nothing happened. At 4 o'clock in the morning, the zookeeper called the mayor and said, "Mayor, I think the bear is going to walk out." So in came the mayor, and whichever media could come in, and they came in. But the thing is, that while he walked into, he saw that there was a rattle in the cage and the bear was beginning to walk. Friends, the bear walked straight ahead of the cage, looked left and right as if he was on a crossing, then decided to go on his left-hand side. And as he walked a few steps on his left-hand side, and hear my story on this very carefully, he touched his chest as we do when we leave a pen, and as if he had left something back in his cage, and he went back to his cage. As soon as he went back in the cage and stepped inside the cage, he slumped. A few minutes gone, and the mayor suggested to the vet, please go and check the bear. As the vet poked the bear, he slumped on one side and was declared dead. He had had a heart attack, and the bear had died. The silence here was a silence there. And the mayor was absolutely lost that his wish to give him a habitat for life sustainably had somehow got lost somewhere. How could he die? So he went across and stood there across the cage. And he just looked at them and he just started going back to what the bear had done. Friends, remember, he had walked straight, left and right, walked left, had forgotten something, walked back. He had walked 12 feet, he had walked 8 feet, and then he walked back 12 feet. He had walked the exact measurement of the cage in which he was kept for 2 years. Even though he was set free, he was still captive. In his mind, he had not been able to break the shackles of the captivity in which he was kept. IHW Sustainability R does exactly this. It's breaking the shackles and telling us that we are free to think and breathe sustainability. But can we do that? Thank you very much and God bless.
Thank you for that address. I would request Sir to please come back. I request Mr. Chandra to please come back. We have a memento we'd like to present to you. I would also like to invite on stage Mr. Sudhir Mishra, founder and managing partner of Trust Legal, to please present the memento to Mr. Amrish Chandra. Thank you for your thoughts. At this point in time, we will slip into a 20-minute break, but after that, we have the highlight of the evening, the awards coming up. Request all of you to get some refreshments and then be back in your seats in another 20 minutes. See you then.
When 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good healthcare for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good healthcare for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action, and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time, when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the Pact for the Future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirates, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action, and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems. when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate. A platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirates, a platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time, when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities, Dubai, United Arab Emirate. A platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good healthcare for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world. In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
At a time, when 79th United Nations General Assembly brainstorming SDGs progress, revitalizing the pact for the future. IHW Council activate the world's first Sustainability Hour from the global land of opportunities. Dubai, United Arab Emirate. A platform where SDGs champions take the center stage to influence the world through their impact stories of driving change, groundbreaking innovation, transforming global goals into grassroots action and local sustainability realities. Be a part of this pivotal moment. Select your sustainability story from sustainable healthcare, nutritional security, water security, climate action, clean energy, green mobility, circular economy, sustainable agriculture and food systems, social sustainability, biodiversity conservation, gender inclusion, sustainable businesses. Share, engage, be the change. Join the movement. Together, we build a sustainable future.
Ladies and gentlemen, I request all of you to please settle down and take your seats. We are going to start with the most awaited part of the day, the awards ceremony. Ladies and gentlemen, distinguished guests, it's with great pride and excitement that we come together tonight to honor extraordinary individuals whose visionary leadership and unwavering commitment has transformed the landscape of healthcare and sustainability. The Global Leader Award is not just an accolade, it's a celebration of pioneers who have paved the way for a healthier, more sustainable world. These trailblazers have challenged the status quo, driven innovation, and inspired countless others to follow in their footsteps. Their impact reaches far beyond borders as they lead with compassion, courage, and a relentless pursuit of excellence. Whether in groundbreaking medical advancements, environmental stewardship, or creating equitable access to health, their contributions are shaping the future for generations to come. As we recognize these champions tonight, we not only celebrate their achievements, but also highlight their profound influence on the global well-being. They remind us that true leadership is more than just success. It's about making a lasting difference. Join me in applauding these remarkable visionaries as we present the Global Leaders Awards, recognizing the finest in healthcare and sustainability. Before we start with the events, we are very honored and privileged to have with us esteemed dignitaries who will be presenting these awards. Please welcome on stage Ms. Amrita Fatnabis, renowned social activist. Please give a round of applause. Welcome her on stage. I request her to please say a few words of encouragement to the leaders who will be given awards today, presented awards. Your words of encouragement will truly be very endearing for them. So please give a round of applause to Ms. Amrita Fatnabis and welcome her on stage.
Model villages with the overall development of village infrastructure and local well-being. Amrita is a founder member of an NGO called the Divyaj Foundation that has worked extensively for the wellness of the sweeper community of the Municipal Corporation of Greater Mumbai and has conducted wellness workshops for Film City employees, Maharashtra State Security Guard Board, and Good Touch, Bad Touch program for school children. She has committed to eradicating malnutrition, poverty and unemployment in the tribal areas of Palghar and conducted various workshops for Anganwadi and Asha workers. Amrita, in association with the Maharashtra State Commission for Women, embarked on a special awareness program named Sakshama for the rehabilitation of acid attack victims to reinstate their lost confidence, create a sense of belonging in the society and make them self-reliant. Amrita has also worked with children of deceased farmers, specially abled individuals, and street children, and supports various cancer initiatives. She launched a rehabilitation program for the meaningful and transformative living of Arthur jail inmates. She also initiated relief programs during the Maharashtra floods. More than 1 lakh families were supported with food, essentials, sanitizers, masks, medicines, immunity boosters, and education help during COVID-19 relief work, including the vaccination program and blood donation camps. The Honorable Governor of Maharashtra appreciated her efforts. Amrita has won numerous awards for her efforts and contribution to society. The most notable ones are I Am Woman Award for service towards women empowerment, Jeeto Power Woman Award, Lokmat Maharashtra's Most Stylish Icon Award, award for bringing about meaningful and significant changes and positively impacting the world at the Cannes Film Festival.
That there's too much to do in this universe, and whatever a person does is like a small drop in the ocean. But we should remember, many such drops create ripples in the sea. So let's all continue doing this great work and serving humanity. Thank you so much.
Amrita is also an accomplished singer and has lent her voice to various causes like female infanticide and feticide. She aspires to provide support to underprivileged, talented children. With this aim in mind, she has launched Mitti Ke Sitare, a musical talent hunt program for children of municipal schools and street children, creating a platform to showcase their talent, which they would have been deprived of, and they still continue their training. The woman of substance, Amrita Fadnavis.
A very good evening, Mr. Gagan Malhotra, Mr. Kamal Gupta, Mrs. Sarika, and our very own Dr. Harshavardhan, Your Highness, other dignitaries and friends who have joined the Summit, Integrated Health and Wellness Summit, organized by IHW Council. It's a privilege to be here today, as we all know that today the world has shrunk. We all are well connected, but our problems are also manifold. They arise due to different reasons, but the basis behind all these problems is about climate change, is about sustainability, is about physical and mental well-being. Our conditions currently have challenged our well-being in different areas. We all are in better position in terms of communication, in terms of technology, medicine. Today we can transplant kidneys, hearts, we can transplant skin, but you would be knowing that India is the diabetic capital. Second largest number of people suffering from diabetes are from India. And all this comes out of the stress which arises from our regular lives. Example, let's take our children. They are always in the horse race of performing in their schools, later in their exams, then in their competitive exams. Similarly, it is with parents in their respective professional lives. So as we say, sustainability also talks about our basic ethos, which goes back in our Vedas, that we should have simple living and great thinking. If we take in moderation in our lives, I think so, most of our problems would be sorted. Moderation in terms of our ambitions, wherein our ambitions sometimes overpower our health. Moderation in terms of our greed, wherein this environment, this beautiful environment which we live in, It suffers because of human greed. We have seen so many examples of our natural assets, oceans, rivers getting depleted, getting dirty, because we have human ambitions which has surpassed anything and everything. So according to me, what is a sustainability goal? What is sustainability? I feel that it is interconnected. Interconnected, as you were showing this AV also. It is about healthy food, it is about potable water, pollution-free air, sanitation, good environment. All this brought together will give you wellness. And to bring this all together, we need to have a network of people, not just in any one country, India or Dubai, but world across. Because in any corner of world, if there is a disaster, if there is an issue, it has butterfly effect on other corners. So we need to be all together for these kind of issues. Everyone here is, I spoke to a few people, everyone is working in their own capacity to bring about a change. May it be beach cleanups, or I must mention one endeavor which we have also started through my NGO, which is called Bache Bole Moriyar. Yes, we love our culture, we love our traditions, but if they are not going environment friendly, what can be done so that we can balance it out? So like Bache Bole Moriyar was an effort wherein we tried to teach children how to make Sharu Mati or eco-friendly Ganeshas, and how to also immerse them in eco-friendly ponds. Yes, we have to continue with this beautiful tradition of Ganesh Chaturthi, but we have to see that our oceans are not dirty because of visarjans. We have to see that the marine life doesn't suffer. We have to see that the economy doesn't suffer because of the dirt we create. So everything is so well interconnected. And here we must realize that it is not any one person's effort which will help. This is the effort of society as a whole, as a unit, which will create ripples. And I thank you all for joining this beautiful cause. Thank you, Mr. Gagan, for inviting me for this. We all in Maharashtra also are into sustainability, like Dr. Harshavardhan has been into Ayushman Bharat. He's been a great part of it. Similarly, in Maharashtra, we have a different Dr. Maja Ghari, and these type of yojanas, policies, which help sustainability in terms of health of a common man, and also in terms of medicine. Once interwoven into our system, will create a long-term sustainability, and we need to be vocal for local. What we produce, we should know the impact of it on our health, grow that more, consume that more, and that will take us a long way. Thank you. Jai Hind, Jai Bharat.
Thank you, ma'am. I request you to please take your seat off stage. I will call you back, ma'am, on stage soon enough. I would now like to introduce His Excellency Dr. Bu Abdullah, the Chairman of Bu Abdullah Group. We are very, very privileged to welcome him here, and we are honored to have him with us. He's an Emirati businessman of par excellence, having his expertise in law and business. He has dealt with not less than more than 200 companies in the Middle East, Asia, and other parts of the world with his company, Bu Abdullah Group of Companies. Ladies and gentlemen, please give a round of applause and welcome on stage His Excellency Dr. Bu Abdullah. I would request him to say a few words to the audience to encourage the leaders that we will be felicitating today.
Everyone, I'm not prepared today to say something, but whatever, I want just thanks who organized from this event, and I thanks who present today, especially Fernandez is our, I think she's doing so hard work always, I looking, and I just welcoming all in Dubai. I'm always here in our government and our all is local, help, and do any things, whatever we can help. I love and respect always for you guys. Thank you so much.
Thank you. Now we will start with the awards. I'm sure all of you are waiting eagerly for this. So hold your breath. We're going to start with the awards. But before we do that, I would like to invite on stage our distinguished guests who will be presenting these awards. Please put your hands together and welcome on stage Dr. Harshvardhan, former Union Minister for Health and Family Welfare, Science and Technology and Earth Sciences, Government of India. I request him to please come up on stage to present the awards. Joining him on stage to present these awards are His Excellency Dr. Boo Abdullah, Chairman of Boo Abdullah Group, and Nikki Gupta, CEO and co-founder of Teamwork Communications Group. Please give a round of applause to our esteemed dignitaries and welcome them on stage. Request them to please present the first set of awards. We will be starting with the Sustainability Awards. And first off, in the category of Global Corporate Responsibility for Environmental Stewardship, the award goes to Fertility International. Please give a round of applause to the winners. Fertility International. I would request Mr. Angelo George to please come up on stage to receive this award. Fertility International is a pioneer in global corporate responsibility, recognized for its outstanding commitment to environment stewardship and sustainability. Through innovative initiatives like Bottles for Change program and extensive water conservation efforts, Fertility has set a benchmark in promoting sustainable practices. Congratulations. In the category Global Sustainability Leader, Social Impact, the award goes to Micro Labs. Congratulations to Micro Labs. I would request Ashish Elava to please come on stage to receive the award. Micro Labs is recognized as a global sustainability leader for its unwavering commitment to social impact and sustainability through innovative practices in pharmaceutical manufacturing and responsible resource management. Micro Lab actively contributes to improving health outcomes while minimizing environmental footprint. The next award is Global SDG Leader for Green Mobility. This award goes to Mr. Abhijit Sinha. Please give a round of applause to welcome Mr. Sinha on stage. He's a distinguished global SDG leader recognized for his pioneering efforts in promoting green mobility and sustainability. He advocates for environmentally friendly practices that align with the United Nations Sustainable Development Goals. The next award is for Global SDG Leader, Sustainable Conservation, and the award goes to Mohammad Khalid Saeed Pasha. Congratulations to Mr. Pasha. He is celebrated as a global SDG leader for his exceptional contributions to sustainability through innovative strategies and community-driven initiatives. The next award is for Global Sustainability Leader Award, and this award goes to Ricky Tej. I would request Mr. Ronald Phillips to please come receive this award on behalf of Ricky Tej. Ricky Tej receives the Global Sustainability Leader Award for his tireless advocacy and creative endeavors in environmental conservation, using his platforms to raise awareness and inspire action towards a more sustainable future. The next category is Equity and Inclusion Leader, and the award goes to Sarika Banhalkar Malhotra. Malhotra. Please put your hands together and welcome Sarika Malhotra on stage. She is honored as an equity and inclusion leader for her impactful work in sustainability, championing inclusive practices that empower marginalized communities. Our next award is Sustainability Champion Award, and the award goes to Dr. Tusif Pasha. Please give a round of applause and welcome the winner on stage. Dr. Tusif Pasha is recognized with Sustainability Champion Award for his exceptional contributions to environmental stewardship, driving sustainable practices, and inspiring positive change across communities. Global Sustainability Leader for Sanitation, and the award goes to Jack Sim. I would request Sarika Salucha to please come up on stage to receive the award for Jack Sim. Jack Sim is celebrated as a global sustainability leader for his groundbreaking work in sanitation, advocating for improved hygiene and access to clean facilities, and significantly advancing global health and sustainability. The next award is for Global SDG Leader, and the award goes to Amrish Chandra. Please give a round of applause for Mr. Amrish Chandra as he comes up on stage. He is an advisor, philanthropist, and a sustainable development advocate committed to advancing education through technology, creativity, and inclusivity. He champions the need for educational reform to ensure it becomes the foundation for a sustainable future. For presenting awards to the award winners so far. Thank you so much for cheering on these leaders as they make such a great impact in the field of sustainability. I would now like to invite on stage Ms. Amruta Papnavis and Gagan Malhotra of IHW Council to please present the next set of awards. Please welcome them on stage with a round of applause. Our next award is Global Sustainable Advocacy, and this award goes to Mr. Sudhir Mishra. Please give a round of applause to Mr. Mishra. He is honored for his global sustainability advocacy, championing environmental protection and policy reforms that promote sustainable development and conservation on a global scale. And now we have the Global Sustainability Leader Award for Sustainability in the Steel Industry, and this goes to Mr. Karthike Y. Nath. Please welcome Mr. Karthike Nath on stage with a round of applause. This award has been presented in recognition of his outstanding leadership and dedication to advancing sustainability practices within the steel industry. Amongst the awards for sustainability, we have come to the last award that is going to be given in this large category, and this is the Lifetime Achievement Award for ESG and climate laws, and the award goes to Dr. Lalit Bhasin. Please give a huge round of applause and welcome Dr. Lalit Bhasin on stage. He is a leading advocate and legal luminary with over over 6 decades of distinguished service. He is the president of the Society of Indian Law Firms and has held key leadership roles across prestigious legal bodies, including the Bar Association of India and the Chartered Institute of Arbitrators, India. And inclusion leadership in healthcare. The award goes to Plan India. Congratulations to Plan India. It is recognized for its outstanding equity and inclusion leadership in healthcare, empowering marginalized communities with accessible health services and promoting health equity across the region. I would request Komal and Mohammed Asif to please come up on stage to receive the award. Of Global Public Health Leadership in Diagnostics Technology. And the award goes to Hiritsu Bioscience. Congratulations to Hiritsu Bioscience. Hiritsu Bioscience is honored for its global public health leadership in diagnostics technology, pioneering innovative solutions that have revolutionized early disease detection and diagnosis. We have Minoru Hayashi on stage to receive the award. The next award is Elderly Care Excellence, and the award goes to Kites Senior Care. I would request Mr. Raja Gopalan Ji to please come on stage to receive the award. Kites Senior Care receives the Elderly Care Excellence Award for its dedicated efforts in providing compassionate and high-quality healthcare services tailored to the needs of the elderly. The next category is Global Health Leader for Innovative Health Solution. And the award goes to U4RAD Technologies Private Limited. I would request Mr. Parthade and Dr. Vivek Sahi to please come up on stage to receive the award. U4RAD Technologies is acknowledged as a global health leader for its innovative health solutions, transforming healthcare delivery with cutting-edge technology that enhances patient care and outcomes. Who is coming up to receive her award. Please give her a round of applause. Mom IVF is celebrated for its leadership in reproductive health, offering advanced fertility treatments and compassionate care, making parenthood possible for countless families. Congratulations to Dr. Sushil Jatana. Please welcome him on stage with a round of applause. He is recognized as a global integrated health leader for his holistic approach to healthcare, integrating advanced medical practices with community-focused health initiatives. for innovative ESG initiative. And the award goes to Ms. Shobini Khanna. Congratulations to Ms. Shobini Khanna. I would request Mrs. Sudhir Mishra to please come up on stage to receive the award on her behalf. Ms. Shobini Khanna is honored as Global Youth Healthcare Leader for her innovative ESG initiative, driving transformative changes in healthcare, sustainability and community well-being. Global Advocacy Leader in Mental Health, and the award goes to Dr. Mohita Srivastav. Please give a round of applause to Dr. Mohita Srivastav, an internationally trained neuroscientist and neuropsychologist. She leads Cognito.me LLC with a focus on enhancing cognitive health through scientific and holistic approaches. Is for the Global MedTech Leader, and the award goes to Prem Iyengar. Congratulations to Mr. Prem Iyengar. He is a distinguished technology leader in the life sciences sector with over 20 years of experience. As Accenture's lead for life sciences technology, he has pioneered digital transformations across pharmaceutical and medical devices industry. The next award is for Global Menstrual Health Champion, and the award goes to Advaitesha Birla. And I would request Girija Goenka to please come up on stage to receive the award on Advaitesha's behalf. Advaitesha Birla, a young socialpreneur and the scion of the Birla family, founded Ujas, a menstrual health and hygiene social enterprise under the Aditya Birla Education Trust at just 18 years old. Ujas is dedicated to reducing period poverty and empowering adolescent girls and women across India. Our next award is for the Global Menstrual Health Champion. Oh, sorry, that award has been given. The next award is for Global Health Leadership, Public Health Impact, and the award goes to Jagran Pehel. I would request Mr. Sahil Talwar to please come up on stage to receive the award. Jagran Pehel. Jagran Pehel is recognized for its outstanding leadership in global health and its profound impact on public health through innovative initiatives and widespread awareness campaigns. I would like to thank Gagan for encouraging all the award winners, and I would like to invite on stage Kamal Narayan to please come up on stage. He's the CEO, IHW Council, to present the award to the next set of winners. And the next award is Global Health Leader for Health Delivery, and the award goes to Vinay Lazarus. Please give a round of applause to Vinay Lazarus. He exemplifies unwavering values and ethical principles, serving as a beacon of integrity and inspiration for his team. He's a certified health executive from Canada with a postgraduate degree in healthcare administration. He brings 28 years of leadership across India, Oman, and the UAE. The next award is Global Public Health Advocacy Leader, and the award goes to Mohammed Asif. Congratulations. I request Mohammed Asif to please come up on stage to receive the award. Mohammed Asif is the Executive Director of Plan India, leading initiatives for child rights, gender equality, and social development. With over 25 years of experience, his expertise is managing large-scale community programs, and his leadership in health and education sectors drive Plan India's mission to improve lives across the country. Leader, Women and Child Health. And the award goes to Ravi Bhatnagar. I would request Sahil to please come up on stage to receive the award on his behalf. Ravi Bhatnagar is a pioneering advocate for women and child health, recognized as a global SDG leader for his impactful work in advancing United Nations Sustainable Development Goals. Through his visionary leadership, Ravi has played a pivotal role in creating sustainable solutions that uplift the women and children in India. The next award is Global Health Leader, and the award goes to Dr. Dharmender Nagar. Please give a round of applause to Dr. Nagar and welcome him on stage. Through his visionary leadership, he has expanded Paras Healthcare's presence into underserved regions, pioneering innovative solutions that bring affordable, high-quality medical care to communities in need. Our next award is for Global Mental Health Impact, and the award goes to Mrs. Neerja Birla. I would request Girija Goenka to please come up on stage to receive the award on her behalf. Neerja Birla, the founder and chairperson of the Aditya Birla Education Trust, is a transformative leader in education, mental health and women's empowerment. Through her pioneering initiatives, MPAR, Aditya Birla World Academy, Aditya Birla Integrated School Nalanda and the Aditya Birla Education Academy, she has positively impacted over 120 million lives in India. Now we have the Lifetime Achievement Award for Healthcare. And this award goes to Azad Mupen. Congratulations to Azad Mupen. I would request Charbaz Bichu to please come up on stage to receive this award. Dr. Azad Mupen is honored with a Lifetime Achievement Award for his remarkable contributions to healthcare sector. Which is the Lifetime Achievement Award in Healthcare, and this goes to Dr. B.S. Ajay Kumar. I would request Ms. Harani Chandrasekhar to please come up on stage to receive the award. Dr. B.S. Ajay Kumar is a visionary oncologist and healthcare entrepreneur with over 3 decades of experience. As the founder of Healthcare Global Enterprises, he has revolutionized cancer care in India, making it more accessible and affordable through cutting-edge technologies and a network of comprehensive cancer centers across the country. The Lifetime Achievement Award in Healthcare goes to Dr. Atul Kapoor. Please give a round of applause to Dr. Atul Kapoor and welcome him on stage. He is a pioneering healthcare leader known for founding Regency Hospital and transforming it into a leading super specialty medical institution in Kanpur and its surrounding areas. With over 28 years plus, he has assembled a team of doctors bridging the gap between demand for high quality medical services and available resources. Our next Lifetime Achievement Award is in the field of diagnostics, and this goes to Honorary Brigadier Dr. Arvind Lal Padma Shri. I would request Dr. Palat to please come on stage to receive the award on his behalf. Would request Dr. Palat to please come up on stage. Right. Honorary Brigadier Dr. Arvind Lal Padma Shri is a distinguished pioneer in the field of diagnostics, and as a driving force behind Dr. Lal's path labs, he has transformed the diagnostic industry in India, making high-quality diagnostic services accessible nationwide. for the evening is Lifetime Achievement Award in Healthcare, and this award goes to Mr. Habil Khurakiwala. I would request Dr. Hufaiza Khurakiwala to please come up on stage to receive this award. Habil Khurakiwala is being honored with the Lifetime Achievement Award for his unparalleled contribution to the healthcare sector. As the founder and visionary behind Wockhardt, he has revolutionized pharmaceutical and healthcare services, making significant advancements in research, development, and global healthcare delivery.
Good evening, everyone. I would like to thank the IHW Council for conferring this award on my beloved father and respected chairman of the Wockhardt Group, Dr. Habil Khurakiwala, and we are very happy to receive the award at the hands of ex-Union Health Minister Dr. Harshvardhan, Ms. Amrita Fadnavis, and Mr. Kamal Narayan. Thank you very much. This award is dedicated to the 10,000 Wockhardians who have worked tirelessly towards better, innovative, and groundbreaking healthcare in India and across the world. Right now, Wockhardt is on the cusp of a major breakthrough in antibiotic research, and we are the only pharma company in the world which has 6 products in the QIDP status, which is fast-track clinical approval by US FDA. So we have the highest QIDP status by US FDA in the world, and antimicrobial resistance is going to kill 39 million people by 2050. And 7 in 10 patients in the ICUs have a microbial resistance. So we have come out with 6 antibiotics where there's no resistance coming. And these are going to get approved by US FDA in 6 months. And our breakthrough product, Zenix 64, is got a penetration of 64, which is the highest in the history of antibiotic since Alexander Fleming invented the penicillin. So this is the highest recorded in the humanity. The 64 is a count which had been given by the clinicians. And lastly, I would like to say that we have one philosophy at Wockhardt, that mankind is one family dependent on God. And the most beloved to God is the one most beneficial to mankind. And thank you very much.
So we have a few more awards, one more award that we wanted to present, and this is for women empowerment, and the award goes to Sandhya Bajaj. Please give a round of applause to Sandhya Bajaj. Was awarded the Global Public Health Advocacy Leader Award. He is now in the hall with us. Would request him to come up with his award for a photo opportunity, which I think due to traffic he got caught up, but now he's here with us. Please give him a round of applause. Congratulations to all the winners. Please give them a round of applause. Their work has been exemplary. I would request our distinguished guests to please stay on stage. We are very privileged and grateful that you're with us. I would request Kamal to please present mementos to our distinguished guest on stage. I request you to please present a memento to Dr. Harshvardhan. Thank you so much, sir, for encouraging all the award winners today by presenting the awards to them. And thank you so much for your presence at the conference through the day. a memento to Ms. Amrita Fatnavis. Thank you so much for encouraging all the winners today. I would request His Excellency Dr. Bu Abdullah, Chairman of Bu Abdullah Group, to please come up on stage. We would like to present you with a bouquet of flowers. Thank you so much for coming here, for your words of encouragement and for encouraging all the winners of the evening today by presenting them awards. Trophies for a group photograph. Heartiest congratulations to all the winners. Please give them a round of applause. It is their day under the sun, under the spotlight. The spotlight's on them, and heartiest congratulations to all of them. Please join us for dinner and a glass of wine.